गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरु साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः. गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरु साक्षात् परब्रह्मा तस्मै श्री गुरवे तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः.
Good evening, everyone. It's my great pleasure to welcome you all to the first day of Adveshta National Seminar presentation organized by Ayurveda. The seminar has been envisioned with a clear purpose to promote the growth of Ayurveda and to empower both doctors and students to represent this ancient science with confidence and commitment in today's evolving healthcare landscape. At the very outset, I would like to extend my heartfelt appreciation to all the panel doctors who have stood by us through every stage of preparations, working tirelessly, often late into the night, to ensure the success of the event. Your dedication has been the backbone of this seminar. We also sincerely thank the numerous colleges and hospitals across India who have helped us spread the word about the seminar to doctors and students far and wide. Without your support in outreach and encouragement, this gathering would not have been possible. A warm welcome as well to all the registered presenters who have prepared diligently to share their research, clinical experiences, and innovative ideas. Today's presentations will cover a diverse range of crucial topics, including cervical cancer prevention, an overview of laparoscopic surgery with special reference to exploratory procedures, advancement in diagnostic laparoscopy, and several other clinically significant subjects that reflect the depth and breadth of Ayurvedic and integrative medical knowledge. As the sessions are being live streamed on YouTube, we kindly request all participants to avoid unmuting unnecessarily to ensure smooth proceedings for both our on-site and virtual audiences. With that, let us not delay any further and proceed to our first presentation of the day. I wish all the presenters the very best, and I encourage the audience to engage with curiosity and respect as we begin this exciting academic journey together. First is a paper presentation. First, I would like to invite Dr. Ashish Bhiva Lawate for the paper presentation.
Samprapti and Chikitsa of Sthoulya. First introduction. Sthoulya is a Sandarpanutta Vyadhi caused by excessive nourishment and derangement of metabolic processes. Agni, that is digestive and metabolic fire, play a vital role in the maintenance of health and prevention of the disease. Impaired Agni leads to arm formation and accumulation of Meda Dhatu, thereby contributing to the pathogenesis of Sthoulya. Sthoulya, classified under Sandarpanutta Vyadhi, is one of the Ashtanindaniya Purush described in Chikitsa Charak Samhita. It is not only a cosmetic concern but also a systemic metabolic disorder. Ayurveda attributes to the root cause of Sthoulya to Mandagni, which initiates improper digestion and accumulation of Meda Dhatu. Agni is the fundamental factor for digestion, absorption, assimilation, and transformation of food. When Agni is deranged, it leads to formation of arm, derangement of dosha, and coitation of Meda Dhatu, resulting in Sthoulya. Therefore, understanding Agni's role in is vital for devising effective Chikitsa approach. The conceptual study aims to critically analyze the involvement of Agni in the Samprapti pathogenesis and its utility in Chikitsa treatment of Sthoulya, with special reference to the Samanya Vishesh Siddhant and Tridosha theory. Next slide. Aims and objective to explore the role of Agni in the pathogenesis of Sthoulya, to understand the types and function of Agni in relation to Meda Dhatu, to analyze the principle of treatment of Sthoulya based on Agni restoration, to provide a conceptual framework of Agni-oriented management of obesity, material and method. Type of study. This is conceptual literary review study based on classical Ayurvedic text and contemporary source of data. Classical Ayurvedic text, Charak Samhita, Sutrasthan, Nidanstan, Chikisastan, Susrut Samhita, Sutrasthan, Chikisastan, Ashtang Hruday, Sutrasthan, commentaries like Chakra and Arundatta, textbooks of Dravya Gun, Rasa Shastra and Panchakarma, research journal, article and dissertation, website and database such as Ayush Research Portal, Google Scholar, PubMed. Next slide. Agni. In Sthoulya, due to Rotorodh by Meda, there is aggravation of Koshtagat Vat, Samanya Vat, which causes Jatragni Atisandushan, and because of this, the person is in urgent need of food. He consumes whether is available, irrespective of time. He goes for Ahlawat and Adveshta type of R7, which further leads to formation of arm. According to Vagbhat, the Agni present in at the Dhatu level is Dhatu Agni, and it's a part and parcel of Jataragni, as both perform the identical function through at different level. The increases or decreases of particular Dhatu Agni lead to vritti or kshaya of that particular Dhatu. In Sthoulya, there is a violation of Medha Dhatu Agni, Posh, Poshkamsha, due to which the Medha Dhatu Agni is unable to perform its function properly. This causes formation of more Medha Dhatu, Poshana, Poshaka Rasa, and hence accumulation of more Medha Dhatu. At the same time, there is a Shaya of Uttara Dhatus, that is Asti, Maja, and Shukra. Next slide. Samprapti. Samprapti refer to the manner in which a disease manifests, starting from Dushta to the appearance of clinical feature. The knowledge of Samprapti is essential for the comprehension of specific feature or Vyadhi Ghataka of disease like Dosha, Dusha, Protrodrushti, Ama, and Agni. Its knowledge is also essential for the purpose of Chikitsa of a disease, as the basic of Chikitsa, according to Ayurveda, is Dosha Dusha Samurjana Vighatana. Basically, Sthoulya has been considered as a Dusha dominant disorder. Medoja Vyadhi, Ama. Ama is one of the most important factor in the Samprapti of Sthoulya. It's a well-known fact that Ama result from Agni Madhya, and hence in this case also there must be Agni Madhya either at Jataragni level or Dhatavagni level or at both level. Excessive intake of Shita, Snigdha, and Madhura Ahar leads to Jataragni Madhya, as these gunas are opposite to that of Pitta. This leads to formation of Jataragni Janya Ama, and there is further accumulation of Ama in Medovah Srotas. Ama formation also takes place as a result of Medo Dhatavagni Madhya. Review of literature. Classical source Charak Samhita Sutrasthan, Charak Samhita Nidan Sthan, Charak Samhita Chikitsa Sthan, Ashtang Hruday Sutrasthan, Sushrut Samhita Sutrasthan, Charak Samhita Viman Sthan, Bhav Prakash Nigantu, Contemporary Research. Discussion. Sthoulya is a Santarpanata Vyadhi that arises primarily due to Agni Madhya, hypofunctioning digestive fire, as emphasized repeatedly in Ayurvedic classic. The proper functioning of Agni ensure that correct digestion of food, formation of Ahar Rasa, and subsequent nourishment of dhatus. When Agni is impaired, it leads to arm formation, which blocks channels and causes vitation of Medha Dhatu. Agni as the root factor in Samprapti of Sthoulya. Jataragni Madhya leads to improper digestion and production of Ama. Ama affects the Dhatu Agni, particularly Medha Dhatu Agni, leading to excessive or improperly formed Medha Dhatu. This excess Medha is not utilized properly, accumulated in body and causes Medha Vriddhi, one of the key features of Sthoulya. Simultaneously, other dhatus, Rasa, Rakta, receives less nourishment, leading to Daurbalya, weakness that is despite the obvious appearance. Therapeutic role of Agni in Chikitsa of Sthoulya. Agni is not only responsible for the pathogenesis but also forms the basis of treatment. Restoration of Agni is essential to resolve the abnormal Medha formation. Ayurvedic Chikitsa aims at Agni, Dipana, Amapachana, and Shodhana, especially Lekana and Rukshana therapies. Dipana and Pachana Drave like Trikatu, Chitrak, Hingu, and Pipali Mul enhance Jataragni. Ruksha and Lekana Upakram like Udavarta, Takarasek, and Ayashruti are useful in Medha Shoshana. Langana and Vyam improve Agni and burn excessive Medha. Conclusion. Agni is the constant of health in Ayurveda, and its impairment is the root cause of various diseases, including Sthoulya, that is obesity. This conceptual study established that the pathogenesis of Sthoulya begins with deranged Agni, leading to arm formation, Dhatuvagni Dushti, and abnormal Medhatu Ruddhi. The Ayurvedic approach to Sthoulya focuses primarily on restoring and maintaining the optimal function of Agni. Therapeutic strategies such as Dipana, Pachana, Langana, Rukshana, and Shodhana are designed to reclean Agni, is eliminate ama, and reduce excessive method. Incorporating dietary modification, physical activity, and Agni balancing herbs forms an essential part of long-term management. The principle of Samanya Vishesh Siddhant provides a rational and individual treatment approach. Therefore, understanding and correcting Agni Dushti is not only fundamental in managing Sthoulya but also in preventing its recurrence and associated metabolic complication. This reinforces the relevance of Ayurvedic principles in addressing modern lifestyle disorder effectively. Thank you.
Thank you, Dr. Ashish, for the paper presentation. Next is an interesting topic. Next topic is the management of dermatitis and psoriasis through Ayurveda. I would like to invite Dr. Shradha H for the paper presentation.
Namaste. My topic is going to be immunomodulation meets biopurification in the management of dermatitis and psoriasis through Ayurveda. I am Dr. Shradha H. I'm from Tamil Nadu. So we don't need specific introduction for psoriasis and dermatitis. We do know the differences between the two as we are all doctors here. So I'm not going in detail there. The burden of diseases very specifically, psoriasis, 125 million people worldwide are affected with it, and the relapsing nature of it and associated comorbidities make it an even bigger deal. Okay, dermatitis, 20% of children and 3% of adults globally are affected, and 30% of treatment resistance is seen to steroids and biologics. 58% relapsing rate in 6 months is observed as per current research. So, compiling a lot of case studies and comparative analysis and data synthesis, we have created a pattern by which we have created an understanding of Ayurvedic methods which can coexist or even perform way better than allopathic treatments in terms of dermatitis and psoriasis. So, in such case, evidences are taken from 2021 to 2025. So, in that, in plaque psoriasis, there was one study that was done wherein intervention was Panchakarma, Virechna, Takradara, Panchatiktagrita, and Bakuchi. Control group was biologics, which in use was anti-TNF alpha and interleukin 17, and topical steroids were used as per normal allopathic outcomes. So outcomes assessed are PASI, lesion clearance, and relapse rates of that particular individual. At the same time, biomarker shifts were also observed here. So interleukin 17, TNF alpha, and cortisol levels were measured. So this is one such study. The results of it is very interesting because Ayurveda came out with flying colors. The previously discussed outcomes assessed is PASI lesion clearance and relapse rates, no? That has been discussed here, wherein in Ayurveda, 82% of PASI reduction rates have been seen, while in allopathy, it is only 45%. Lesion clearance was 78% and it was complete, while 35% in allopathy and it was partial. Relapse was 0 to 12%, zero, no relapse to 12% relapse in 1 year, while it was 58% relapse in allopathy. And biomarker shifts were also analyzed. So interleukin 17, 60% of it was reduced by the reduction that was caused by Ayurvedic intervention, while 48% was the reduction. Comparatively, the p-values are also very significant when it comes to Ayurvedic research. So in TNF alpha, 55% of it, and in Ayurveda, and 52% of it in allopathy. Cortisol rates went down by 40% in Ayurvedic treatment, which there was no change observed in allopathic treatment. That says a lot about the varied aspects of both. The strong correlation between TNF alpha and PASI scores have been established as such. And this case is 68-year-old female with plaque psoriasis, which was resolved in 12 weeks with no recurrence in 1 year. So, what is the mechanism of superiority involved in Ayurveda? So, immunomodulation, biopurification are two things. So Panchatikta Grita reduces NFKB, which is a signaling cascade expression for inflammation, immunity, and cell growth. Also reduces TNF alpha. Okay, so Ashwagandha reduces cortisol, thereby reducing flares. Bakuji reduces filaggrin synthesis and thereby reducing or healing, facilitating more healing in the fissure healing regions. Biopurification, Virechana is set to eliminate AMA and interleukin 23 is reduced, causing reduction in flares. Shodhana PASI 24 was reduced to 6 in 8 weeks with Shamana drugs as well. So no recurrence in this. Jalaukavacharan cleared Palmer psoriasis within 21 days. These are all significant results, and this is the before and after of the treatment. Discussion and conclusion. Ayurvedic achievements, now it is highly clinically efficient and it can sustain remission. Holistic impact of it, along with comorbidities like anxiety or depression associated with these conditions, can also be treated in Ayurveda. And the safety aspect of it, the ADRs have not been reported in any cases. And while at the same time in allopathy, 20% of steroid atrophy has been reported and other associated side effects as well. So limitations of this Ayurveda comes about with case reports which are not considering large cohorts. Okay, and standardization of the treatments and biomarkers are a little bit of a lacuna is there. So future research can concentrate on these while acting on RCTs and standardization of treatment, standardization of biomarkers, collective cohorts, and longitudinal studies. So thereby enhancing the entirety of Ayurvedic perception in the treatment of psoriasis and dermatitis. So it is way more efficient than allopathy is what I want to conclude here. And there are a lot of avenues wherein we can sustain this kind of development. These are the references. Thank you very much.
Thank you, Dr. Shradha, for the well-explained presentation. Thank you so much, Doctor. Next, we go to the paper and poster presentation. First, we go to the paper presentation. I would like to invite Dr. Neha Banduji Dhongade for the paper presentation under the Shailendra panel.
Hello everyone, myself Dr. Neha Banduji Dhongade. My guide name is Dr. Gayatri Mavle ma'am, HOD of Shalyatantra. My co-guide name is Dr. Ganesh Belorkar sir, Professor Shalyatantra. I'm PG scholar and my college name is Dr. VJD Gramin Ayurved Mahavidyalay, Patur, Akola. Topic of paper presentation is an Ayurvedic approach to Dushtavrana, a case study. Introduction. The term Vrana refers to the destruction, rupture, break, or discontinuity of body tissue or a body part. Dushtavrana, chronic or non-healing ulcer, is commonly encountered condition in surgical practice. If not managed properly, Dushtavrana can severely impact a patient's health, leading to complication and even mortality. Delayed wound healing can be attributed to factors such as infections, love, and the presence of foreign bodies. In contrast, clean wounds tend to heal more efficiently. Therefore, maintaining wound cleanliness throughout the healing process is essential. Surgeons aim for optimal wound healing with minimal pain and scarring. Acharya Sushruta elaborated on 6 types of Dushtavrana and their treatment include various therapeutic approach characterized mainly as Vrana, Vrana Shodhan, wound cleansing, and Vrana Ropan, wound healing. Additionally, Sushruta described 60 different techniques, Shashti Upakram, for managing wound. In the current study, a topic formulation known as Vrana Lepa has been selected for its wound cleansing Vrana Shodhan properties. Methods. Case report. A 48-year-old female patient presented with a non-healing ulcer or medial aspect of left ankle joint associated with pain, pus discharge, swelling, and itching since 16 days. The ulcer became infected with pus discharge. There was no history of diabetes mellitus, hypertension, or any other major disorder. The family history was also not significant with the patient disorder. Local examination. Location. Medial aspect of left ankle joint. Size 3 into 4 centimeter. Discharge. Purulent discharge present. Floor. Covered with slough. Margin irregular. Edges inflamed. Tenderness and localized raised temperature. General examination. General condition good. RS clear. CVS S1 and S2 normal. No added sound. CNS normal. PA soft. BP 130 by 70 mm of Hg and pulse 88 per minute. Treatment. Triphala Guggur 2 BD orally and Ashwagandha lep locally. Mode of action. Ashwagandha lep. Ashwagandha lep consists of ashwagandha, katafal, yashti madhu, and lajjaru. Ashwagandha present in the formulation is kapvat pacifies as well as shothar due to its madhur and snigdha properties. Its purifying blood reduces local inflammation and relieves pain. Katfal is a potent runner-open drug which reduces local itching around the infected wound due to its kashai katu and ushna properties. It acts crumigna, leading to crumigna effect. Yashti madhu, due to its madhur sheath snigdha properties, pacifies pitta and reduces local irritation, causing effective wound healer. It also has anti-inflammatory properties. Lajjaru, due to its kasha and sheath properties, help in raktastamban and stop local blood loss in the infected wound. Due to its sandhanya properties, it helps in fast healing. Triphala Guggur. Triphala Guggur Shodhan, its main work is Shodhan, purification. Triphala Guggur helps cleanse the wound by removing impurities and necrotic tissue, facilitating the creation of healthy environment for healing. Ropan, healing. It promotes tissue regeneration and encourages the wound to close. preventing scarring and promoting the formation of new skin. Anti-inflammatory action. Google is a key ingredient, possesses anti-inflammatory properties, helping to reduce swelling, pain, and discomfort associated with the wound. Antimicrobial action. Triphala Gugul components including Gugul and Triphala exhibit antimicrobial activity helping to combat infection and prevent further complication. Vedna Shamak pain relief. Triphala Gugul help reduce pain and discomfort associated with Dushtavrana. Application. The wound is cleaned with normal saline after drying with sterile gauze. Vrana lip is applied over the wound, followed by sterile pad as absorbent layer. The dressing is secured with bandages without compromising the circulation. The dressing is removed in the evening and the wound is cleaned again with normal saline. Discussion. The treatment approaches on Ayurveda, such as lifestyle modification, management of underlying disease, and systemic drug administration. There is no any specific scale applied for the assessment criteria for the case. Only the following point were observed. Change in pain over 1 month. Reduce first discharge, swelling and itching over 15 days. Effect on Vrana Vedna, pain and tenderness was gradually reduced by the end of third week of treatment. Vedna is a predominant feature of Vat due to Triphala Gugul Vedna reduced. Effect of Vrana Akriti. By 13th day, Vrana was completely healed. This may be due to the Vrana Shodhan and Vrana Ropan properties present in the Vrana lip. Observation. There was improvement in the symptom of the patient. Pain and redness reduced. Overall improvement in the quality of life was observed in the patient. Conclusion. Vrana lip can be used effectively in the management of Dushtavrana. It also helps avoid the painful procedure of debridement of slough in those who are unable to tolerate pain. It also does the action of Shodhan and Ropan. It removes only the unhealthy granulation tissue, hence wound size does not increase. There is a further need in the research of the Shashti Upakramas mentioned by Sushrut in order to validate their efficacy and broaden the scope of Ayurveda in wound management. Result. The clinical feature of Dushtavrana were improved around third week and the wound was completely healed at the end of the 5th week. Thanks.
Thank you, doctor. Next is a poster presentation on the topic conceptual review of Parikartika, Fissure in Nano.
Hello everyone, myself Dr. Neha Banduji Dhongade, PG Scholar, Department of Shalyatantra, Gramin Ayurvedic Mahavidyalay, Patur, Akola. My poster presentation topic name is Conceptual Review of Parikartika, that is Fissure in Ano, under the guidance of Dr. Gayatri Mavle Ma'am, HOD of Shalyatantra, Gramin Ayurvedic Mahavidyalay, Patur, Akola. Introduction. Anal fissure is one of the most common and painful disease. The most consistent finding on physical examination is spasm of the anal canal due to hypertonic of the internal anal sphincter. Fissure in ano, commonly encountered in surgical practice, has predominant feature of parikartika, that is burning and cutting pain, constipation, stool streak with blood, an increase in the muscle tension in the internal anal sphincter can lead to fissure. Need for study. Anal fissure is a medico-surgical condition. In general line of treatment in Ayurveda include Vatanuloman, Agni local application of oil, etc. In medical treatment, it includes analgesic like non-steroidal anti-inflammatory drug, bulk of laxative, local application of anesthetic, and soothing ointment. Operative procedure has its own stigma. The complication of surgery may include anal incontinence, which occur inability to control gas, recurrent ulcer formation, and persistent mucus discharge. Symptoms: the symptom of anal fissure include Sharp anal pain is seen during the stool passage, followed by burning pain for few hours. Bleeding on defecation of stool. An anal tear or cut is especially seen in chronic fissure. Small anal bump or anal fissure and skin tag near the anus. And anal spasm also present. Treatment. In treatment include Parikartika as a disease has been considered very briefly by Sushruta and other successive authors. They have given the brief possible description of Parikartika treatment. Kashyap has mentioned its management according to Doshika predominance. Others have not considered as Doshika type classification, but it is a fact that none of them has described surgical management, thereby showing that there was no need of surgery as the disease was completely cured by the use of medicinal preparation only, and they were satisfied with management. There are two categories for medicine based and how they are administered. First is Sthanik Chikitsa, that is local treatment, and second is Abhyantar Chikitsa, that is general treatment. In Sthanik Chikitsa, mainly Basti Karma is used. In Basti, Vat Shamak, Vrana Shodhak, Vrana Ropak, and Pitta Shamak drug are used for Basti. And there are three types of Basti, that is Anuvasan Basti, Picha Basti, and Sheetal Basti is used in Parikartika for pain relief and uh, anal spasm. Abhyantar Chikitsa. In Abhyantar Chikitsa, the oral preparation have many folds objective. Some are used to correct the anorectal disorder, other used as laxative, and few more are as to correct the Agni Dushti. Sushrut has advised for cold water bath and milk for oral administration. Uh, like this, fissure in ano treatment is explained in our Sanhitas. So my presentation is complete. Thank you.
Thank you, Dr. Neha. Next, I would like to invite Dr. Yogita Ahlawat for the paper presentation.
Chemical nootropics and Ayurvedic bio. Good day, everyone. Today, I'll be presenting a scientific review on phytochemical nootropics and Ayurvedic biohacking. This is an effort to explore how Ayurvedic herbs, especially media rasayanas, can be understood through the lens of neuropharmacology and modern biohacking. So, nootropics are substances that support or improve cognitive functions like memory, attention, and focus. While modern science uses synthetic compounds, Ayurveda has always offered a natural approach through media rasayanas. These include herbs like Mandukparni, Yashti Madhu, Guduchi, and Shankapushpi. These herbs not only support memory but also have neuroprotective and adaptogenic properties. In today's world, where brain performance and stress management are top priorities, Ayurvedic nootropics have much to offer, especially when seen through the concept of biohacking. This presentation is based on an extensive literature review from classical Ayurvedic texts to modern research databases like PubMed and Science Direct. The aim was to identify key nootropic herbs, their phytochemicals, mechanism of action, and clinical significance. All the data was then categorized thematically to show their relevance in cognitive enhancement and integrative medicine. Let's now look at how classical Medhya Rasayanas work pharmacologically. Take Mandupani, which is rich in saponins like asiaticoside. It supports dendritic branching and protects neurons. It's clinically useful in anxiety and epilepsy. Yashti Madhu, which is known for glycyrrhizine. It's a neurotonic and adaptogen effective in stress-related disorders. Guduchi is both detoxifying and immunomodulatory. It is useful in cognitive decline with systemic involvement. Jatamansi with calming effects. It is used in insomnia and seizures. So here we are not just treating memory loss, we are addressing the root imbalances also. Beyond the main Medhya Rasayanas, Ayurveda offers many herbs with cognitive potential. Shankhapushpi increases acetylcholine and calms the mind, which is ideal for ADHD and stress. Brahmi improves synaptic transmission and is known for neurogenerator. Jyotishmati activates mitochondria and shows promise in Parkinsonism. Kushmand is anti-epileptic and cooling. Vacha enhances speech and intellect by modulating GABA receptors. Ashwagandha is a powerful adaptogen that lowers cortisol and supports nerve growth. Swarna Prashan is a beautiful formulation where gold, Medhya Rasayanas, honey, and ghee come together. The gold particles improve neuroplasticity, while Brahmi, Shankhapushpi, and Vacha promote memory, clarity, and speech. Honey and ghee act as yogavahis, enhancing the absorption of lipid-soluble compounds. This formulation is ideal for early neurodevelopment and immune enhancement, especially in children. One of the unique ways Ayurvedic nootropics work is by modulating the HPA axis, which controls our stress response. Ashwagandha reduces cortisol and resets circadian rhythm. Jatamamsi and Brahmi enhance GABA and serotonin, promoting a calm mental state. These herbs don't just suppress symptoms, they restore neuroendocrine stability and protect the hippocampus from chronic stress. To function optimally, the brain needs good blood flow and oxygen. Herbs like Shankhapushpi and Mandupani increase nitric oxide, which improves blood flow to brain tissues. Mitochondrial function is also improved, increasing ATP production. This means better mental energy and focus. Herbs like Brahmi and Ashwagandha stabilize stress response molecules called HIFs, which protect neurons during hypoxia or stress. In summary, Ayurvedic nootropics offer a powerful blend of ancient wisdom and modern neurobiology. They work by improving brain circulation, reducing oxidative stress, regulating hormones, and enhancing nerve regeneration. These herbs are not merely supplements, they are true biohackers of the humankind. Moving forward, we must invest in clinical trials to standardize dosage and proof efficacy so that Ayurveda can take its rightful place in the global field of integrative neuropathy. Thank you for your time and attention. I'm open to your questions and suggestions.
Thank you, Dr. Yogita. Thank you for the well explained and wonderful presentation. Thank you so much, Doctor. We know that Agnikarma is the important part of Shalyatantra. Next is the Agnikarma related paper presentation. I would like to invite Dr. Annapurna Kadakol for the paper presentation.
Hello everyone, this is Dr. Annapurna, a PG scholar from the Department of Shalyatantra at Sri Shivayogeshwara Ayurvedic Medical College, Inchal. Today, I am presenting a paper on the topic Agnikarma, a classical thermal cauterization technique in Shalyatantra. So, this presentation will make you know about the classical origins, clinical applications, and modern rationale of the Agnikarma, one of the most powerful yet underutilized parasurgical tool in Ayurveda. The Agnikarma described in the ancient text Sushruta Samhita is a unique parasurgical procedure using the thermal cauterization. It is primarily indicated in the disorders of Vata and Kapha origin, especially musculoskeletal and the painful conditions. Acharya Sushruta states, Yatra Beshajani na siddhati, Yatra Shastrani cha na siddhati, Tatra Agnikarma siddhati. Where both the medicine and the surgical measures fail, the Agnikarma gives the relief. In today's time, with the increasing demand for the minimally invasive, OPD based, and the cost effective procedure, Agnikarma holds the immense clinical value. Then comes the aim. What is the aim of this study? The aim of the paper is to explore the Agnikarma through both the classical Ayurvedic text and the modern biomedical understanding. The objectives are to study the textual references and the practical steps of Agnikarma, to explore its indication and contraindication, to present a case, that is a clinical study, and to correlate its mechanism. Then the literary review. The concept of Dagda Karma or the thermal cauterization is extensively explained by the Acharya Sushruta in the Chikitsa Sthana. Different types of Dahana Upakarmas are told, like Loha, that is iron, Tamra, copper, and the Shalakas made with the various materials are described. Application patterns include the burner like Bindu Dahana, which is a spot burns, Reka Dahana, linear burns, Vileka Dahana, scraping type cautery, etc. Then comes the indication. Agnikarma is mainly indicated in the Vata Kaphaja conditions such as Gridrasi, Vata Kantaka, Sandhivata, Arsha, Bagandhara, and Granthi. However, it is contraindicated in the Pitta Pradhana conditions, pregnancy, uncontrolled diabetes, and bleeding disorder. Hence, the proper patient selection and the assessment are critical. Agnikarma consists of 3 stages, that is Purvakarma, Pradhanakarma, and Paschatkarma. Purvakarma includes the explaining the procedure to the patient, cleaning the site, applying oil, and give the mild svedana, that is sedation. Pradhanakarma includes the shalaka is heated till the red hot and applied to the affected area in the required pattern, example Reka for the sciatica, and pain is immediately reduced due to the heat stimulation and denervation. Paschatkarma includes, after the Dahana Karma, cooling the agents like Grita or the coconut oil are applied, followed by the sterile bandaging and advice for the rest and the wound care. Here is the case study. Let me share a clinical case. A 45-year-old male patient presented with the Vata Kantaka, that is heel pain due to the water vitiation. Reka Agnikarma was done using the Loha Shalaka on the plantar region once in every 3 days for 3 sittings. The outcome was pain reduced significantly and the VAS score was dropped from 8 to 2 and the no recurrence was noted. And mode of action. The Ayurvedically, Agni possesses the Ushna, Tikshna, Sukshma, and Ashukari gunas, which help in clearing the Srotoroda, pacifying the Vata Kapha, stimulating the Agni in the affected region. From the modern perspective, it is the heat causes the denaturation of the pain fibers, increases the local blood circulation, stimulates the healing by increasing cytokinin response, and acts similarly to the radiofrequency ablation. What are the advantages? Some unique advantages of Agnikarma include there is no need of anesthesia, it is OPD based, cost effective, immediate pain relief, and the lower recurrence rate, and the minimal bleeding and the scar formation. No systematic side effects are there. In today's settings, Agnikarma can serve as an effective pain management tool in the standalone on the integrated practices. What are the limitations? However, the limitations include the fear of burn among the patient, need for the proper training and precision, limited use of localized and the superficial conditions, and requires a strict hygiene and the wound care. Hence, the procedure should always be performed by the trained physician. To conclude, Agnikarma is a powerful yet simple parasurgical technique mentioned by our ancient acharyas for treating the Vata Kaphaja disorders. It is evidence-based, reproducible, and suitable for day-to-day clinical practice. Modern science supports its neurovascular and thermal effects, making it a bridge between the classical Ayurveda and the modern pain management. Let us revive and utilize this gem of Ayurveda in daily Shala practices. Yatra Beshajam na siddhati, tatra Agnikarma siddhati. Where other medications fail, the Agnikarma succeeds. Thank you.
Thank you, Dr. Annapurna, for the energetic presentation. Thank you so much, Doctor. Next is the paper presentation. I would like to invite Dr. Sagar Patil for the paper presentation. I would like to invite Dr. Sagar Patil for the paper presentation.
Myself, Dr. Sagar Patil, MS Scholar, Department of Shalya Tantra, Dr. VJD Gramin Ayurved Mahavidyalaya Patur, District Akola, guided by Dr. Ganesh Belurkar, MS Shalya Tantra, Associate Professor, Department of Shalya Tantra, Dr. VJD Gramin Ayurved Mahavidyalaya Patur, District Akola, Dr. Gayatri Maule, MS Shalya Tantra, HOD and Professor, Department of Shalya Tantra, Dr. VJD Gramin Ayurved Mahavidyalaya Patur, Akola. My subject is effect of Jalaukavacharan in the management of Dushtavrana WSR2 venous ulcer. Introduction. Wound management is a critical aspect of healthcare with various conventional approaches. Varicose veins are leading cause of chronic ulcer termed as venous ulcer. Ayurveda have gained an attention for their potential benefits in venous ulcer as the heading of Dushtavrana. This case report presents a unique instance where Ayurvedic intervention was proved beneficial for management of venous ulcer. Case presentation. A 48 years old male, non-hypertensive, non-diabetic patient presented with a non-healing chronic wound on mental aspect of lower leg near medial malleus of right leg. He had history of trauma over left leg 6 months back. He had no history of systemic illness and surgical intervention. The conventional treatment, including local dressing and oral antibiotics, had been initiated without significant improvement. Considering the patient's interest in Ayurveda, a decision was made to incorporate Ayurvedic principles in the treatment plan. Routine investigations were carried out before intervention, along with general and local examination. Material method. The Ayurvedic intervention selected for wound management are combination of Jatyadi Tail and Kashishadi Tail, leech therapy, along with oral Ayurvedic medications known for healing and antimicrobial properties. The oil was applied topically to the wound, following appropriate wound cleansing. Regular dressing changes were performed along with Jalaukavacharan weekly, which allowing the oil to penetrate the wound bed, improving blood circulation and facilitate the healing process. Result. This case report highlights the potential efficiency of Ayurvedic management for venous ulcer. Discussions. Over a period of 6 weeks, the wound showed remarkable progress. The patient reported reduced pain, decreased wound size, decreased swelling, and improved overall wound condition. The multifaceted properties of the Jatyadi and Kashishadi tail, including anti-inflammatory, antimicrobial and wound healing effects, may have contributed to observed positive outcomes. Jalaukavacharan leech has property of anti-inflammatory, anesthetic, analgesic property along with improving blood circulation and microchannels in vascular compromised parts. Keywords: chronic wounds, Dushtavrana, Venous ulcer, जात्यादी तेल, कशिशादी तेल, जलुकावर्चन. Thank you.
Thank you, Dr. Sagar Patil. One of the poster presentation is there. I would like to invite Dr. Sagar Patil for the poster presentation on the topic Conceptual Review of Agnikarma in Arsha Hemorrhoids.
Myself, Dr. Sagar Patil, MS Scholar, Department of Shalyatantra, Dr. VJD Gramin Ayurved Mahavidyalaya, Patu, District Akola, guided by Dr. Ganesh Belurkar, HOD, Dr. Gayatri Maule. My subject is a conceptual review of Agnikarma in Arsha, hemorrhoids. Background and purpose. The disease Arsha piles is initiated with Agni Mandya, improper digestion due to improper food habits and lifestyles. Arsha piles is an extremely common problem reported since thousands of years with a prevalent rate that is highest among all the anorectal disorders. However, hemorrhoids can reoccur even after proper management. Hence, it is mentioned as one of the among Ashtamahagada. Agnikarma has been explained by Sushruta as one among the Anushastras having greater importance in the management of Arsha. Vagbhata even termed it as the best amongst all kind of therapeutic procedures in Ayurvedic armory because of its non-reoccurrence speciality. To establish the importance of Agnikarma in modern era, material and methods, Agnikarma is one of the important parasurgical procedures described in Ayurveda, which is still in practice widely in the management of Arsha, but according to modern methodology, results modern cauterization is nothing but the Agni Karma. Discussion. In modern management, different laser techniques are used such as infrared coagulation, bipolar, direct current and radio frequency, ablation therapy and BEIM technology, but it all includes direct or indirect thermal power, hence it is Agni Karma. Conclusion. Further larger scale study is needed to enhance Agnikarma in recent advances. Sushruta is the pioneer of Agnikarma. Keywords Agnikarma, modern cauterization, Anushastras, Arsha. Thank you.
Thank you, Dr. Sagar Patil, for the wonderful and insightful presentation. Our next topic is recurrent laryngeal nerve injury in thyroid surgery, an Ayurvedic and modern perspective, a vital subject addressing both surgical precision and holistic care. I now invite Dr. Desai Pallavi Babasaheb to present. I would like to invite Dr. Desai Pallavi for the paper presentation.
respected judges, esteemed faculty members, and fellow colleagues. Hello everyone, I am Dr. Pallavi Desai, a second year postgraduate student in Rachna Sharira from Rajiv Gandhi Educational Society's Ayurvedic Medical College and Hospital, Rona. So today I will be presenting on the topic recurrent laryngeal nerve injury in thyroid surgery and Ayurvedic and modern perspective. So today I will be presenting in this presentation, I will discuss in detail anatomy, surgical relevance, potential mechanism of injury, preventive strategies, and the Ayurvedic correlation through the lens of Marma Sharira. My aim is to bridge modern anatomical insights and with classical Ayurvedic understanding for improved surgical safety and patient outcomes. So my contents are introduction, objective, anatomy, clinical relevance, Ayurvedic insight, importance, recent advances in RLN preservation, discussion, conclusion, and references. So I would like to introduce what is RLN. RLN is also called as the guardian of the voice and what injuries happen in the laryngeal nerve during thyroidectomy. So thyroid surgeries are among the most common endocrine procedures primarily performed by conditions such as goiter, thyroid malignancies, and various thyroid diseases. Despite their frequency, these surgeries carry a risk of significant injury. One of the most critical and feared is injury to the RLN, that is recurrent laryngeal nerve. Damage to RLN can cause debilitating symptoms like harshness of voice, complete loss of voice, difficulty in breathing, which may require urgent medical intervention, or we can have to go for immediate tracheostomy. The key to preventing such complications lies in the profound understanding of the RLN anatomy, and that is, I am proud of being a student of Rachna Sharira that anatomy plays a very important role in preventing the common and rare variations and meticulous applications of surgical techniques and prevent injuries. To understand ancient Ayurvedic texts, particularly the concept of Kantamarma, refer to the vitality and sensitivity of this very region, highlighting an awareness of its critical importance. The objectives are, this presentation aims to bridge ancient wisdom with modern surgical science and to prevent RLN injury during thyroid surgery. So anatomical exploration will lead to the common variations, emphasizing structures proximal to the thyroid gland, whereas surgical correlation helps in the detailed anatomy with its surgical importance and outline precise strategy for RLN identification and its preservation during thyroidectomy. The Ayurvedic perspective is to highlight the ancient Ayurvedic understanding, to encapsulate the concept of Kantamarma, and discuss its relevance in contemporary to the neck surgeries. So for that, we should understand what is the anatomy of recurrent laryngeal nerve. Its origin and cause. It is a branch of vagus nerve, that is the 10th cranial nerve. On the right side, RLN loops around the subclavian artery, whereas on the left side, RLN loops around the arc of aorta and ascends in the tracheoesophageal groove, enters larynx below the inferior constrictor. Its relation is close to inferior thyroid artery, Berry's ligament, and Zuckerklun's tubercle, as you can see in the diagram. The variations of RLN is that it has one more part, that is non-recurrent laryngeal nerve. It's very uncommon and it is present especially on the right side, and it can be found in 0.5 to 1% cases only. So what is the clinical relevance in thyroid surgery? RLN injury is the most common cause of vocal cord paralysis following thyroidectomy. And what are the types of injuries? The types of injuries may be temporary, that is neuropraxia during the operation. It is due to the compression, or it may be due to the thermal damage. So common causes of injuries due to stretching or traction or manipulation of the thyroid gland, ligation, the nerve in ligatures, especially around the inferior thyroid artery or Berry's ligament, thermal damage, use of energy devices like electrocautery too close to the nerve, entrapment in scar tissue during reoperative surgeries, crushing injuries from clamping instruments, prevention strategies, visual identification. So avoiding blind ligation, we have to avoid the blind ligation of especially the inferior thyroid vessels. We should be ligated away from the nerve's expected path. Intraoperative neuromonitoring, electromyographic monitoring of vocal cord activity to confirm nerve function and aid the identification. What is the Ayurvedic insight of this RLN? So according to Ayurveda, there is a marma located which is called as Kantha marma. It is specially located around the laryngeal neck region of the neck corresponding to the area containing the trachea, esophagus, and the neurovascular structures of the voice box. It is also classified as Vishalagna Marma, and this marma is considered as if any foreign body is present over their shalya, if it is extracted from there, it can be fatal. What are the consequences? According to Ayurvedic test, describes that injury to kantamarma can lead to breathing difficulties, dyspnea, and aphonia. In severe cases, it can also be fatal. It causes death. So this ancient description remarkably parallels the modern understanding of RLN injury, which can cause similar life-threatening complications. It reflects a sophisticated ancient awareness of the delicate and vital nature of the structures within the neck, particularly those involved in phonation and respiration. What is the importance of anatomical knowledge? So a deep and comprehensive understanding of surgical anatomy is not merely academic, but it is the cornerstone of patient safety and surgical excellence. First, it prevents laterogenic complications. It meticulous anatomically knowledge significantly reduces the risk of unintended injury to the RLN during surgical procedures. It helps in pre-surgical planning. If the person knows the proper anatomy, so it will be helping in anticipating variations which can prevent the surprises. Also, it is important in the cases like reoperative thyroid surgery. Enhances dissection training. It promotes safer and more confident, precise surgical technique through rigorous training using anatomical landmarks. Boosts surgical safety and trust. It helps in minimizing the complications, and hence it can lead to the patient's safety, build trust, and reduces the medico-legal challenges. What are the recent advances in RLN preservation? So intraoperative neuromonitoring, real-time electromyographic monitoring of vocal cord muscle provides immediate feedback on nerve integrity, guiding dissection and warning of potential injury. MRI and CTs can also help the surgeons to visualize nerve pathways and anatomical variations preoperatively, aiding in personalized surgical approaches. RLN regeneration research is also going on, which may help in the nerve grafting. Also, in future, the robotic and endoscopic techniques are very much important because they are minimally invasive and approaches enhance magnification and articulation and helps for the proper precision for RLN dissection in selected cases. Discussion. Clinical significance. RLN injury is a major complication post-thyroidectomy, and it can cause hoarseness, dysphonia, dysphagia. Bilateral injury may also cause airway obstruction. What is the anatomical consideration? Poses in tracheoesophageal groove close to the inferior thyroid artery, variable branching, relation of the Berry's ligament, rare non-recurrent variation may increase the injury risk. Ayurvedic correlation. RLN function linked to Vishuddhi Sthana and Udana Mata governs speech and respiration, and region corresponds to Kantha Marma, that is Vaikalya Kara injury can cause functional loss. Integrative insight is preservation of marmas is very important for the protection of vital function, and it aligns with the modern microsurgical nerve sparing principles. Post-operative support at Vata Shamana therapy, Swarabheda Chikitsa for voice rehabilitation. Conclusion. Preventing recurrent laryngeal nerve injury in thyroid surgery demands a multifaceted approach that integrates profound safety of anatomical understanding with surgical precision and advanced technologies. Anatomical mastery, a detailed understanding of RLN's pose, relationship, and common variations is non-negotiable for all surgeons performing neck procedures. Precision and prevention is very important because it helps to prevent the rooted meticulous surgical skill, constant awareness of anatomical landmarks, and cautions dissection to avoid damage. Ayurvedic validation, the ancient concept of Kantamarma underscores the historical recognition of the neck, offering a timeless perspective. Synergetic approach, integrating rigorous anatomical education with contemporary safety strategies like neuromonitoring and appreciating traditional wisdom, can significantly enhance surgical outcomes and patient well-being. The references for my today's presentation are Gray's Anatomy, Shushruti Samhita, Surgical Anatomy, Mishra, Sharma, Marma Science, and Ayurvedic Surgery. I hope you all have understood what is my objective and what was my objective behind the presentation. Thank you everyone for my patient listening. Thank you.
Thank you, Dr. Pallavi, for the energetic presentation. Next is a poster presentation.
Hello everyone. This is Dr. Pallavi Desai, second year PG scholar, Department of Rajna Sharira from Rajiv Gandhi Educational Society's Ayurvedic Medical College and Hospital, Rome. So today I'm going to present in front of you all the poster on the topic carpal tunnel syndrome, the integrating anatomical, Ayurvedic and applied clinical insights. So first I would like to introduce the carpal tunnel syndrome, that is also known as CTS. It results from the compression of the median nerve within the rigid osteofibrous tunnel at the wrist, which causes sensory and motor symptoms in the hand. From an Ayurvedic standpoint, this aligns with injury or dysfunction at the Manibandha Marma, a vital Snayu Sandhi Rujakara point at the wrist junction. So integration of both perspective enhances holistic understanding and to plan the treatment strategies. So for that, first we should understand what is the anatomy of the carpal tunnel. So carpal tunnel, it is a narrow osteofibrous canal on the palmar side of the wrist bounded by the carpal bones and transverse carpal ligament. As you can see the picture on the left side of the poster, the anatomy of carpal tunnel. So the borders are formed by scapuloid and trapezium on the radial side, pisiform and hamate on the urinal side, and roofed by transverse carpal ligament and floor by the carpal groove. So what is the contents? The contents are 9 tendons and the median nerve. Flexor carpal radialis tendon lies outside the tunnel. Median nerve supplies sensation to thumb, index, medial and radial half of the ring fingers and motor to the thinner muscle. Also in Ayurveda, we have the reference in the Sushruta Samhita, 6th chapter, 27 shloka, which states that Manibandho Vishalascha Tatra Tantvasta Sanchitaha. This describes that wrist as a region with concentrated tendinous structure which links with the median nerve entrapment in the CTS. Also, it is mentioned as osteofibrous tunnel, so which also correlates with the Sushruta Samhita quotation of the shloka in the 6th chapter, 27 shloka. Right? Yes. So one more Ayurvedic perspective is of Manibandha Marma. So what is Manibandha Marma? It is located at the wrist joint, measuring about 2 angulis, and it is classified as Snayu Marma, Sandhi Marma, and Rujakar Marma. Also, it is classified under Vaikalyakara Marma, whose injury causes deformity or functional disability. As you can see in the poster on the right side, the integrated perspective of carpal tunnel syndrome, that is anatomical, Ayurvedic and clinical. So here I can explain you that repetitive wrist strain causes the carpal tunnel syndrome or the narrowing of the carpal tunnel because of congenital or the acquired form. So these leads to compression of the median nerve, and that will lead to the symptoms like tingling, numbness of the thumb, index, middle and radial half ring fingers, as I have explained in the anatomy of carpal tunnel that it contains the medial nerve, and according to that it also causes the motor to thinner muscles weakness which can affect the grip. Same in the Ayurveda, the injury or compression to the Manibandha Burma dysfunctions, Snayu Sandhi Rujakar and Vaikalyakara features as pain, numbness, and the functional loss, which is similar to the CTS in modern science. Then, what are the treatment pathways according to modern? So, according to modern, the first line of treatment is usually splinting. They give the support and then they use the non-steroidal anti-inflammatory drugs. Even after this, the patient does not get relief, then we have to take the patient for the surgery or we have to advise them surgery. Same in Ayurveda, the treatment aspect for the CTS is Abhyanga, the oil massage, or we can go for Agnikarma or we can go for Marma Chikitsa. So these all things can help to subside the symptoms of the CTS. So Abhyanga improves circulation, Svedana reduces the stiffness. Also we can go for Nasya for Vata suppression. Marma Chikitsa stimulates the nerve function and Agni Karma relieves pain and improves conductivity. So how these treatments of Ayurveda can definitely help the patient in the carpal tunnel syndrome. So according to poster, you can see the transverse section of the carpal tunnel. We have got it from the dissection image of the carpal tunnel. And then in the poster, we can also see Ayurvedic perspective that where the Manibandha Marma is located, that is exactly at the joining of the palms and the hand, that is wrist. We call that region as wrist. So what is the conclusion? So CTS and Manibandha Marma injury are structurally and functionally similar. So integrating modern anatomy with Ayurvedic Marma science enhances diagnosis, prevention, and treatment. So its holistic approach benefits patient outcomes and preserves wrist function. Also, combining anatomical precision with Ayurvedic wisdom, particularly Vaikalyakara Marma theory, provides a comprehensive understanding and holistic approach to treating carpal tunnel syndrome. So all these things have been explained in the poster, and which is definitely going to help in future for the perception of easy knowledge of modern science as well as Ayurvedic approach towards the CTS. And what are the key sources or the references from which I got the help to create this poster is Gray's Anatomy, the 42nd edition, Shushrut Charirasthan, and then CCRAS Marma Manual. Thank you everyone for the patient listening. I hope my today's presentation has provided some enlightenment towards the topic of carpal tunnel syndrome and the integrated approach of modern science, anatomy, as well as Ayurveda. Thank you one and all.
Thank you, Dr. Pallavi Desai, for the insightful, well explained, wonderful paper and poster presentation. Thank you so much, Doctor.
Thank you.
You have heard about essential hypertension, a condition often called the silent killer due to its subtle symptom but serious long term effects on health. Up next, we will learn how Ayurveda and lifestyle modifications can work hand in hand to manage this condition effectively. I would now like to invite Dr. Dimple Ravindra Bedane to present on an integrative review on essential hypertension and its management through Ayurveda and lifestyle modification. I would like to invite Dr. Dimple Ravindra Bedane.
Namaste, myself Dr. Dimple Bhadane from Yeshwant Ayurvedic College, Kadoli, Kolhapur. Today's paper presentation, my topic is an integrative review on essential hypertension and its management through Ayurveda and lifestyle modification. Introduction: hypertension is often referred as silent killer because it is typically present no noticeable symptom until significant damage has already occurred to the vital organs such as heart, kidney, or brain. According to American Heart Association, hypertension is defined as systolic blood pressure 130 mmHg or diastolic blood pressure 30 mmHg, whereas according to WHO, high or raised blood pressure, a condition in which blood vessel has persistently raised pressure. Large portion of individuals with hypertension remain unaware of their condition, and even among diagnosed, treatment is insufficient or poorly managed. It is essential to prevent the onset of hypertension to enhance awareness, treatment, and control. Although term essential hypertension is not mentioned in Ayurvedic texts like Samhitas, Granthas, it is acknowledged in Ayurveda that not all the diseases are assigned specific name. Aim and objective: understand hypertension through Ayurvedic lens, material and method, collected all these things from Ayurvedic texts, modern medical literature, scientific research. Ayurvedic perspective of essential hypertension. Various Ayurvedic scholars have described hypertension using different terminologies like Raktagatvad, Siragatvad, Avratvad, Dhamni, Prapuran, Vikshepan, Prakop, Raktamat, Uttarakhtachap, Vyan, Atibal. On each term reflect unique Ayurvedic interpretation of condition involving imbalance in dosha, especially Vata dosha, and disturbance in the circulatory system. Concept of blood pressure in Ayurveda. It is essential to understand physiological aspect of blood pressure from Ayurvedic perspective, which is fundamentally rooted in Tridosh theories. This foundational concept provide the basis for interpreting circulatory function and imbalance such as hypertension within Ayurvedic science. Blood first eject out of blood, then it is distributed to all part of body, and then return back to the heart. The return of rasa toward heart is controlled by function of Samanvat, pumping action of heart, lateral pressure accepted by flow of blood on the wall of artery. Heart possesses intrinsic pacemaker, which is as node, which autonomously generate electrical impulse that initiate contraction during systole. And all these things we can relate it with the Vyanvat. As a node generate impulse on its own, and rate of impulse generation is controlled by ANS, and it is Pranvat situated in Murdha. Peripheral resistance. We can correlate peripheral resistance with our lumbar cuff. What is peripheral resistance? So it is diastolic when diastole occurs when the heart muscle relax, allowing chamber to fill with blood. During this phase, there is no active contraction of heart. Instead, blood flow continues due to pressure generated by its passage through the narrow chamber and arteries. Elasticity of artery. Vascular tone is controlled by ANS, which is altered diameter of artery and vein and as required. Peripheral resistance offered by artery due to vasoconstriction triggered by sympathetic nervous system can be correlated with Pranvat in Ayurveda. Autonomicity of heart is driven by action potential generated by influx of Na and Ca, calcium and sodium, and efflux of potassium across the SA node, initiating the electrical impulse that regulate the heartbeat. And the involvement of this chemical ion can be undertaken the preview of Pitta dosha due to its Tikshna, Drava, and Saraguna. Volume of circulating blood. Blood volume and viscosity are largely influenced by the quality and quantity of rasa and rakta dhatu. Blood pressure regulation and role of Tridosha. Short-term regulation, long-term regulation. Short-term regulation is by Pranvat and long-term regulation by Sapanvat. In modern, there is essential hypertension is considered idiopathic and Ayurvedic. There are nidanas given in Charak Samhita Sutrasthan, dietary causes, Madhyapan, Atilavan Sevan, lifestyle causes, psychological factor, seasonal influence, genetic factor, all these things. Lakshana, Shiraruk, Shrama, Krodha, Jvara, Brahma, Klama, Tamas, Kampar, Dita, all these things. Samprapti, Nidan 7 lead to Tridosh, Prakop, and all this lead to all this influence Pranvat. Prakopit Avalamba Kav induces exaggerated contractility of heart. This event lead to forceful expulsion of blood through dhamanis, and which is lead to hypertension. Samprapti Ghatat, dosha involvement, Vad, Pran, Udan, Vyanvat, Sadak Pitta Kapha, Avalambak Kapha, Rasa Rakta, Mamsa, Meda, all these things are Samprapti Ghatak. Chikitsa Sutra, there are initial phase, middle phase, and final phase. In initial phase, we can induce Shodhan therapy. In middle phase, Shaman, and final phase, Rasayan. Balance. Key principle of Ayurvedic healing is balance of Tridosha, strengthening Agni, removal of arm, and building Oj. Chikitsa, first step is Nidan Parivarjan, lifestyle modification, then Shodhan Chikitsa, then Shaman Chikitsa. according to dosha involvement, we can give patient different shodhan therapy like Virechan, Basti, Raktamokshan, which ultimately lower the blood pressure through various action. There are single herbs which can be used in combination. Vivitak, Marish, Guruchi, Punarnava, Gokshuv, Sariva, Manjishta, Brahmi, Sarpaganda, Shankapushpi, all these things, all these drugs lead to reduction in blood pressure through various mechanisms of their action. Integrated approach to manage hypertension, we can use low sodium diet, regular physical activity, stress reduction technique, weight management, adequate sleep. If patient is taking tobacco or consume alcohol, so we can suggest him to avoid all these things. Then an Ayurvedic lifestyle modification, we can suggest Dincharya, Rutucharya, Vyayam, Sattvic diet, Abhinga, meditation, all these things. In conclusion, after in-depth review of classical Ayurvedic text and modern medical literature, it is evident that Ayurvedic approach to disease management is centered on breaking the Samprapti Vikatan. It is highly relevant in treatment of hypertension. In Ayurvedic, hypertension can be corrected with abnormality of Raka Dhatu, commonly referred as Sunita Dushti. To ensure sustainable benefit, this intervention must be complemented with proper Pathya, helping maintain doshic balance and overall cardiovascular health. Thank you for your attention and time.
Thank you, Dr. Dimple Devendra Badane, for the informative and well-researched presentation. You have probably heard about. Thank you, Doctor. Thank you for the session. Next, I would like to invite Dr. Renju S for the paper presentation on the topic adulteration of crude drugs and its detection. I would like to invite Dr. Renju S for the paper presentation.
Dr. Angelus, Associate Professor in the Department of Rashyastra and Bhaishya Kalpana, SAPM Ayurveda Medical College Hospital, Gonda, Uttar Pradesh. Today, I am going to present a topic on adulteration of fruit drugs and its detection. These are the contents of the seminar. Coming to the introduction, the availability of fresh or dried plant materials required to prepare various medicines was not a major problem when human population was small and plant material collected were within limits, allowing enough number of plants to regenerate or regrow in the following years. Coming to the definition, a drug is said to be adulterated if it does not meet the quality and purity characteristics. It is represented to possess if sold under the name which pertains to another drug. It is the imitation of a substance which for the other drug in a manner likely to misleading. Adulterants, an adulterant resembles the genuine drug in respect of its morphological appearance, or it may be cheap or available in fairly large amount. The types of adulterants are chemical or physical adulterants. Difference between adulterant and substitutes. Adulterates are apparently similar, cheaper, abundant, either free from or inferior in chemical or therapeutic properties of original drug, and substitutes may not be similar, may produce the same therapeutic effect in the non-availability of the original drug. The effects of adulterations are impurity, spoilage, deterioration, admixture, or sophistication. Types are intentional or unintentional. Intentional adulteration are normally commercial one and are originated mainly in the intention of enhancing the profit. It is because of the non-availability of the authentic plant or due to high cost of the original drug. Unintentional adulteration may be due to confusion in nomenclature, lack of knowledge about the authentic plant, non-availability of the authentic plant, similarity in morphology or aroma, careless collections, etc. These are the examples for that. Name of confusion. In Ayurveda, Parpada refers to Fumaria parviflora, and Siddha, Parpadagam refers to Mollucopentaphila. Lack of knowledge of the authentic source. Nagakesara is an important drug in Ayurveda, which source is Mesophora. In market, there are adulterated with flowers of calophyllum, inophilum. Similarity in morphology. Mucuna pruriens is the best example for unknown authentic plant, and similarity in morphology. Lack of authentic plants. Hypericum patulum is adulterated with Hypericum perforatum. Ghee is adulterated with vanaspati, beef flour is adulterated with chalk powder, etc. Careless collections. Some of the herbal adulterations are due to the carelessness of the herbal collectors and suppliers. Methods of adulteration due to manufacture of substitutes, addition of inferior commercial varieties, due to addition of exhausted drugs, addition of superficially similar, cheaper, natural substances, addition of worthless, heavy materials, addition of synthetic principles to fortify inferior products with the drugs, the presence of adventitious matter naturally occurring with the drug. Therefore, powdered materials, generally waste products of a suitable color or density, are used. Harmful effects of adulteration may be, it may cause some poisonings like rodent fecal matter is mixed with cardamom, so it's a very harmful adulterant. It may be, there are some examples also have given. How adulteration can be prevented. Proper identification of botanical source. The collectors and traders have to be educated in about the danger and unethical nature of the adulteration. Proper awareness of the macroscopical or microscopical differentiating features are to be created among the practitioners. Proper encouragement for protecting and conserving an area of certain plants that are critically endangered. Studies and surveys should be conducted on the availability of the medicinal plants. It can be detected through observations and experiments to establish the identity, gross morphology like color, odor, taste, size, shape, etc. Histology and microscopical morphology can be done. Microscopical linear measurements for the stromatal number, etc. can be done. Diameter of starch grains, phloem fibers, height of sclerenchyma cells, etc. can be done. Solubilities, qualitative chemical tests, physical constituents. It can be identified by exposing the powder cut surface to UV light, etc. to establish the quality. Assay for alkaloids, glycosides, yield to solvents, ash contents, etc. can be done, and quantitative microscopy also can be done. Biological evaluation also can be done to in effects of living organisms like bacterial, fungal growth, etc. Chemical evaluation for the isolation, purification, and identification of the active constituents are chemical methods of evaluation. These are the genuine drug and the adulterants used. Due to lack of time, I'm not explaining the slides. Coming to the food adulteration, a food shall be deemed to be adulterated if it bears or contains any poisonous or deleterious substance which may render it injurious to health. It falls below the standard purity, quality, or strength which it purports or it's represented to possess. It bears or contains any non-nutritive article or substance except harmless coloring, harmless flavoring, harmless resinous glaze, harmless natural wax, harmless natural gum, and pectin. These are the examples of food adulterations under IPC section 275, 272. It can, due to adulteration, can be punished with an imprisonment of either destruction of a term, which may be extended to 6 months, or with a fine, which may extend to 1,000 rupees, or with both. Come to the discussion. Our preceptors were able to identify the adulterants which are context specific, and in such conditions, rather than giving importance to guna karma, were taken into considerations. Adulterations are somewhat similar to genuine drug in respect of morphological appearance like color, size, shape, smell, etc. But it does not mean that they have either the identical or a similar form of physiological actions if taken internally. Adulterants have caused a major problem in the research on commercial natural products. It's due to the failure of researchers to recognize the importance of identifying the correct source of test materials, adulterated or commercial herbal products. Conclusion: adulteration is only appropriate when the additions are unwanted by the recipient. They may be unintentionally adding to more expensive substances to create visible quantities and reduce manufacturing cost, and for some other deceptive or malicious purpose. Different methods of adulteration are in practice since long time. The adulterant substances are producing serious health problems. The methods of detection of adulteration helps to standardize the genuine drug. These are the references. Thank you.
Thank you, Dr. Renjues. Thank you for the insightful and well-explained presentation. We have all heard about Shidavita, commonly understood as urticaria, which causes itching, redness, and discomfort. Haridrakhanda, a well-known Ayurvedic formulation, has been traditionally used for its management. Next, I would like to invite Dr. Snehal Vishwambar Award to present on review study of Haridrakhand in the management of Shidavita. I would like to invite Dr. Snehal Vishwambar.
Hello everyone, my name is Dr. Snehal Awad, MD Scholar Kai Chikitsa. My college name is Ashwin Rural Ayurved College, Manchi Hill, Sangamner. My topic for today's paper presentation is Review Study of Haridra Khanda in the Management of Shita Pitta. Abstract. Shita Pitta is one among the important and common skin problem described in Ayurveda, primarily caused by Prakupit Vat and Kapha doshas mixed with Pitta, which is triggered by dietary, environmental, and lifestyle factors, resulted into Shita Pitta Vyadhi. Nowadays, due to spicy and fast food eaten which have less nutritional values, produces various types of allergic reactions. One of them is urticaria, which is very common. There is increase of Vata, Pitta and Kapha in our body, in which Pitta dosha is most aggravating and causing Shita Pitta all over body. Shita Pitta can be correlated with urticaria. Haridra Khanda used to manage allergic skin disorder due to its Shrothara anti-inflammatory, Kandugna means anti-itching, and Rakta Shodhaka means blood purifying properties. Introduction. In Ayurveda, Shita Pitta mentioned as one of the Tvakvikara. Shita Pitta composed of two words Shit and Pitta, which has different meaning. The word Shita indicates Vata and Kapha dosha and their association with Pitta dosha. In Madhav Nidan, it is caused due to exposure to cold breeze, which causes vitiation of Vata and Kapha dosha association with Pitta dosha. Due to impairment of dosha, it leads to Rasa and Rakta Dhatu Dushti. It spreads externally and internally over body, causing rashes. In today's advanced lifestyle, improper and unhealthy food habits has low nutritional value in diet. Today's life is very fast, and with urbanization, daily lifestyle changes very drastically. Polluted environment, work in shift duties, stress, and anxiety, etc., are the main trigger factor for the variation of Vata and manifestation of disease in today's era. Shita Pitta is correlated with urticaria due to similarity of causes and its symptoms. Haridra Khanda is a drug of choice for Shita Pitta. It is mentioned in Vaishajya Ratnavali. Due to its Katu Tikta Ras, it clarifies Agni Mandya. So, Jatra Agni increases, which causes increase in Dhatu Agni. Thus, the Dushti of Rasa and Rakta Dhatu will be pacified. Rupa of Shita Pitta. Varti Damshta Samsthana Shotha. Inflammation like insect bite. Kandu Bahula. Severe itching. Toda Bahul. Excessive pain like pricking. Chardi. Vomiting. Jwar. Fever. Vidaha. Burning sensation. Content of Haridra Khanda. Haridra Shunthi. Pippali. Marich. Ela. Nagkeshar. Loha Bhasma. Ghrita. And Sharkara Pak. Preparation of Haridra Khanda. Fry the Haridra in Ghrita, then mix it with Sharkar Paka. Add powdered herbs like Shunti, Pippali, Maricha. The mixture is stirred until a granular consistency is reached. Matra 6 gram, Anupan Koshnajal and 7 kal is Vanudan. Mode of action. By Katu Tikta Ras, especially Haridra Khanda, clarifies the Agni Mandya, thus increases the Jatra Agni. By this Jatra Agni will lead to increment of all Dhatva-Agni, thus the Dushti of Rasa and Rakta will be pacified. As the Agni is corrected, all the Dhatus, especially Rasa, is formed properly. A well from Rasa will lead to formation of all Dhatus properly. Haridra Khanda balances aggravated Vat and Kapha doshas while clearing toxins from the body. Its anti-pruritic and soothing properties helps to reduce itching, swelling and rashes. Most of the ingredients having Vishagna, Kandugna, Kushtagna, Shotagna properties that will help in Samprapti Bhagna of Shita Pitta by slow down the process of inflammation or pathogenesis. As per context, 3 dosha involvement in Shita Pitta, therefore 3 dosha hara drug should be used. As a Haridra Khanda, Haridra itself is the main ingredient and having the Tridoshama property, anti-allergic, anti-inflammatory properties. Haridra Grhita, sugar, rest all drugs are Satmya to our body and maximum ingredients having Varna properties which in terms will help Tvak to retain its normal stage. Conclusion. Haridra Khanda is a safe and effective Ayurvedic formulation for managing Shita Pitta and related allergic skin conditions. Its multi-targeted approach ranging from detoxifying the body to balancing doshas makes it a holistic treatment option. As in Haridra Khanda, main ingredient is Haridra, which is having anti-inflammatory, anti-allergic, Tridoshagna, Varnya, Kandugna, etc. properties that will surely pacify the pathogenesis occurring in Shita-Pitta. Also, the principle of Nidan Parivarjan is to be followed to stay prevented from a disease. References: Baishacya Ratnavali Adhyay 55, Shlok number 13 to 17, Charak Samhita, Chokamba Bharati Academy Varanasi 1998, Bhav Prakash Nighantु, Madhav Nidan, Madhukosh Commentary by Dr. Himsagara Chandra Murthy.
Thank you, Dr. Snehal Vishwambar, for the informative and detailed presentation. We are all aware that sciatica or gridresi as described in Ayurveda is a painful condition affecting the lower back and legs, often caused by nerve compression. Managing this condition requires both accurate diagnosis and traditional treatment plan. Next, I would like to invite Dr. Snehal Vishwambar Award once again, this time for a poster presentation on an integrated approach in diagnosis and management of gridresi with respect to sciatica.
Hello everyone, myself Dr. Snehal Vishwambar Awad, PG scholar from Ashwin Rural Ayurved College, Sangamner. My topic for today's poster presentation is an integrated approach, diagnosis and management of gridresi with special reference to sciatica. Need for the study. Gridresi is one among the 80 types of Vataj Nanatmaj Vadis. The chances of gridresi is expected to increase in upcoming years due to sedentary lifestyle, the increased use of computerization, and also due to increasing body weight, mental stress, hectic work schedules, and excessive traveling. Keeping these facts in mind, this study has been undertaken to bring out a treatment modalities with no side effects and long-lasting relief. Methods: different Ayurveda and modern textbooks, journals, research papers, articles are referred to study concept of gridresi and its correlation of sciatica. Analysis: diagnostic methods like SLR test, Lesigue test helps us giving perfection to diagnose the disease. Signs and symptoms mentioned in Samhita's guide to diagnose the disease. Causes for sciatica. Sciatica is most commonly caused by a herniated disc in the lower back that compresses or irritates the nerve. The other causes include spinal stenosis, bone spurs, spondylolithiasis, and less frequently tumors or infection. SLR test. The straight leg raise test is common physical examination technique used to assess for sciatica, which is characterized by pain in the sciatic nerve distribution. The test involves passively raising a patient's straight leg while they lie on their back, observing for the reproduction of familiar leg pain. A positive SLR test indicates potential nerve root compression is typically characterized by pain radiating down the leg, particularly below the knee, within a range of 30 to 70 degrees of hip flexion. Management: Antara Kandara Gulfe Sira Bastagnikarmacha Grudhrasishu Prayunjita. Discussion: diagnosis of gridresi according to Ayurveda principle mainly focus on Vata Prakop and its local effect in lower limb region, whereas modern approach totally suggests performing diagnostic tests like SLR, Lesigue test, etc. Thus relying on symptomatic approach according to modern science. Ayurveda according to its Nidan Panchaka, five-fold diagnostic methods, helps in exact diagnosis of gridresi and in turn effective management of same. Conclusion: the clinical features of gridresi and sciatica have close correlation in between them. Shodhan Chikitsa used in gridresi helps in effective management in treatment of gridresi. In similar way, various exercises demonstrated by modern science also proves effect in treating sciatica. In this way, both Ayurveda and allopathy treatment modality helps long-lasting relief in symptoms of Gridhrasi. References: Charak Sutrasthan, chapter number 19, Charak Chikitsa Sthan, chapter number 28, K.D. Tripathi, Essential of Medical Pharmacology, Harrison's Principle of Internal Medicine, Davidson's Principle and Practice of Medicine. Thank you.
Thank you, Dr. Snehal Vishampravat, for the valuable paper and poster presentation. We all know that diet plays a vital role in maintaining health, and Ayurveda places great emphasis on proper food habits and methods of preparation to promote well being and prevent disease. Next, I would like to invite Dr. B. Sharavanan to present on the topic food habits and dietary preparations in Ayurveda. I would like to invite Dr. B. Sharavanan.
Sabhaya Namaha, Om Shri Gurupya Namaha. Respected dignitaries, myself Dr. Saravanan. Today I am going to present the topic on food habits and dietary preparations in Ayurveda. First slide. In Ayurveda, it is believed that food is made up of the Panchamahabhutas. Each element's specific Bhudagni break down its corresponding components during digestion and metabolism. But this occurs only when activated by Antaragni, that means the central digestive fire. Nutrition is vital because a proper, wholesome, and balanced diet forms all the body constituents. That means dosa, dhatu, and mala. Ayurvedic Samhitas provide detailed descriptions of the concept of Ahara Kalpana, including its properties and uses. What we are, what we eat. From this quotation, we can understand the importance of Ahara. Next slide. Ahara Kalpana in Vedic literature. Humans have always sought taste in their food. And during the Vedic period, they experimented with various Ahara Kalpana just as we do today. Various food preparations are frequently mentioned in Vedic text. Yava, barley is referenced in the Rig Veda, Yajurveda, and Atharva Veda. Some notable Agara Dravyas from the Vedic period include dana, fried yavadanya, karamba, churned food items, shaktu, roasted flour, paribaba, roasted grains, payas, milk, dadi, curd. Amiksha is a preparation prepared from that milk and curd, vagina, liquid part during amiksha preparation, madhu, honey. Additionally, Vedic literatures contains direct references to preparations like Madhya Kalpana, Payasa, Dadi, Navanida, Sarpi, Paribaba, Laja, Shaktu, Karamba, and Vodana. Next slide. Food habits in Charaka Samhita. The 27th chapter of Charaka Samhita Sutrasthana, known as Annapana Vidhi Adhyaya, provides comprehensive insights into various food items and their qualities. Food articles are classified into the following 12 groups: Sugadanya, grains; Samidanya, pulses; Mamsavarga, meats; Shiravarga, milk and milk products; Shagavarga, vegetables; Phalavarga, fruits; Haridavarga, green leafy vegetables; Jalavarga, waters; Tailavarga, oils; Exuvarga, sugarcane products; Tridannavarga, prepared foods. Next slide. Food habits in Sushrada Samhita. According to Sushrada Samhita, it is important to consume the right amount of food at the appropriate time while seated on a raised platform. Start your meal with sweet tastes, followed by salty and sour flavors, and conclude with pungent, bitter, and astringent taste. The sweet taste helps elevate vayu in the stomach. Salt and sour flavors stimulate digestion, and pungent, bitter, astringent taste balance the kapha dosa. Amlaki, Indian gooseberry, should be consumed at the beginning, middle, and end of the meal. Heavy foods can be consumed to satisfaction. Next slide. Food habits in Ashtanga Hridaya. Vagbada emphasizes the importance of eating while sitting on the floor, as this practice enhances digestive fire. The food plate should be slightly elevated above the floor. For evening meals, it is advised to eat before sunset, as the digestive fire diminishes after the sun sets. After eating, lying on the left side is beneficial as it is stimulate the Pingala Nadi on the right side of the body, which in turn activate digestive fire. After sunset, only liquid foods are recommended. Next slide. Food for the mind. In Ayurveda, different types of foods are associated with influencing the three qualities of the mind, that means sattva, rajasa, and tamasika. Sattvika foods promotes clarity and harmony, enhancing the quality of sattva. Rajasic foods stimulate the activity and desire and increasing the qualities of rajas. And tamasika food contribute to inertia and lethargy, amplifying the qualities of tamas. Dietary preparations in Ayurveda. Ayurveda emphasizes prevention over cure, focusing on ideal food choices to achieve and maintaining good health. Traditional Ayurvedic dietary preparations, known as patya, are considered wholesome and soothing to the body. They include manta. Manta consists of only the supernatant liquid from boiled rice. Peya contains an equal portion of solid rice and liquid. Yavahu features more solid rice and less liquid. Vilebi comprises only the solid part of the rice. The qualities of Manda Peya Vilabi. Manda, light for digestion, nourishes the body and increase the digestive fire. Peya, light for digestion, helps to reduce hunger, thirst, tiredness, enhance the digestive fire and cleanses the bladder. Vilebi, good for heart, subside pitta, promote the body corpulence. Krisara Kichadi. To prepare Kichadi, Tandula and Simbidanya are taken in either in equal quantity 1:1/2 ratio or 1:1/4 ratio as per the need. A little amount of snega, saintavalavana, ardraga, hingu, haridra are added to the preparation. The mixture is cooked in a vessel with 6 parts of water to attain a solid consistency. The properties of Krisaras are Vadahara, heavy for digestion and gives strength. Yusa. It is a semi-solid preparation obtained by boiling 1 pot of different type of Dhanya Vishesha. Dhanya Vishesha, Kulata, Yaba, Mutta. These are Dhanya Vishesha. Along with 1/8 quantity of Sundi, Pippali and 16 part of water. The properties of Yusa increase the digestive power, strength and appetite. Takra. It is a liquid preparation prepared by continuously churning the curd for with different ratio of water added. The properties of takra light for digestion, cooling in its effect, and helps in reducing thirst and fatigue. Suba, it is a preparation where any of the Simbidanya, red gram, green gram, etc., are soaked, dehusked, and boiled with enough quantities of water, along with the required quantity of salt, oil or ghee, and other spicy ingredients. The properties of Suba are light for digestion, nourishes the body, and increase the digestive fire. Rasala. To prepare this rasala, the curd is added with the required quantities of sugar, pepper, ghee, and honey. This is churned properly and added with little quantities of karpura for good order. The properties of rasalas are aphrodisiac, increase the strength, appetite, and nourish the body. Conclusions. Ayurveda provides profound insight into the relationship between the food and health. As global interest in traditional medicines grows, efforts to monitor and regulate herbal practices are increasingly important. Ayurveda emphasizes the critical role of diet in maintaining health, highlighting that many health issues arise from the poor eating habits and cooking methods. Among the 3 fundamental supports of life, Agara, Nidra, Brahmacharya, diet is given paramount importance in Ayurveda. By adhering to proper balanced dietary practices, individuals can support their physical strength, complexion, and overall growth throughout life. This approach ensures the body integrity and well-being, as long as one avoids practices detrimental to health. Thank you.
Thank you, Dr. Saravanan, for your energetic, well explained presentation. Thank you so much, Doctor. The journey to parenthood begins long before conception, and Ayurveda offers time tested principle to nurture both partners' health, ensuring the birth of a healthy progeny. Next, I would like to invite Dr. Radhika Singh Bhadauria for her poster presentation on the topic The Ayurvedic Path of Conception, Nurturing Health for a Healthy Progeny. I would like to invite Dr. Radhika Singh.
Good evening to one and all. Myself, Dr. Radhika Bhadoria from PTSR department, going to present my Good evening to one and all. Myself, Dr. Radhika Bhadoria from PTSR department, going to present my topic for poster, that is the Ayurvedic path to conception, nurturing health for a healthy progeny. Ayurveda emphasizes a holistic approach to health, addressing both preventive and curative aspects of life. It highlights the importance of psychological, social, and physical preparation for both partners prior to conception, encouraging lifestyle habits that promote optimal health and mentally prepare individuals for pregnancy and the responsibilities of parenthood. The aim of my study is to have progeny who are healthy and devoid of any congenital or genetic disorders. The first factor is Garbhadan Yogi Ayu. Different acharyas describe different ayus. Acharya Shushruta described for males that is 25 years and for females it is 16 years. Both the partners are full of valor and vigor at this age and fully mature so they can attempt to achievement of conception. Second factor is Vishuddhi through Panchakarma. Acharya Shushrut and Charad described both males and females are advised to undergo Shodhan by Panchakarma like oleation, sedation, emesis, purgation, enema. That is Snehan, Swedan, Vaman, Virechan, Evam Basti. Ovum, Matru or sperm, Pitru is in its best and purest form and devoid of any abnormalities or genetic disorders after doing the Panchakarma. Third factor is Ahar Vihar. Shushruta opines that after purification, the man should use khrut and milk medicated with the drugs of Madhur Varga, that is sweet and anabolic drugs, and the woman should consume oil and masha, a shot of kidney beans. Fourth, the psychological factors. Chanting of Om Jap induces positive energy and provides spiritual belief. Meditation controls mood swings and improves blood circulation. Fifth factor is Garbhani Paricharya. According to the months, different acharyas describe different paricharyas for the women for all the 9 months. The first month, non-medicated milk. For the second month, milk medicated with madhuras. For third, milk with honey and growth. For fourth month, butter one aksh matra. For fifth month, milk with growth. In sixth month, growth prepared from milk medicated with madhur drugs. In seventh month, growth prepared from milk medicated with madhur drugs. In eighth month, Shir Yavagu mixed with growth. And in last, that is ninth month, Anvasan Basti, vaginal tampons of madhur drug. Sixth factor is the Garbha Sanskar. It plays an important role during the pregnancy. A practice that emphasizes nurturing the mother's physical, emotional, and spiritual well being during pregnancy to positively influence fetal development. Garbha Sanskar incorporates various techniques such as maintaining a balanced diet, yoga, and meditation, listening to calming music to create a conductive environment for the growing fetus. So the discussion leads to pregnancy is a significant moment in a woman's life, and Ayurveda recommends a balanced diet for the healthy development of the fetus. For centuries in India, Ayurveda has focused on ensuring a smooth natural delivery, promoting maternal health, strong immunity in the child, and healthy postpartum lactation. Ayurveda provides a comprehensive plan for diet routine and mental well being to support a trouble free pregnancy. It emphasizes that a mother's health is key to the birth of a healthy child. And during this time, a woman needs ample care and attention for her family. This leads to conclusion. Preconceptional treatment aims for a risk-free pregnancy by promoting healthy lifestyles habit. It prepares individuals mentally for pregnancy and responsibilities of parenthood. Asian text emphasizes a balanced diet for providing essential nutrients for a healthy offspring. With these, I conclude my topic. Thank you so much for providing opportunity to present my topic in front of you all. Thank you.
Thank you, Dr. Radhika Singh, for the informative poster presentation. Thank you so much, Doctor. Next, I would like to invite Dr. Shradha for the paper presentation on the topic Guillain-Barré syndrome, Anukta Vyadhi.
Good evening, everyone. Myself, Dr. D. Shweta, second year PG scholar from Department. Introduction. Good evening, everyone. Myself, Dr. D. Shweta, second year PG scholar from Department of Chikitsa from Dr. NRS Convent Ayurvedic College, Vijayawada. My presentation topic is Guillain-Barré syndrome, Anukta Vyadhi. Introduction. Anukta means unsaid or unuttered or unheard. The word Anukta is being explained in Charaka Chikitsa 30th chapter, which refers to concepts which are not specifically explained in classical texts, and the treatment is based on the dosha dushya and nidana of the vyadhi. Here, Guillain-Barré syndrome is not specifically explained in classical texts, hence it comes under Anukta Vyadhi. According to Ayurvedic point of view, the clinical features of Guillain-Barré syndrome closely resemble with either Avaranajanya Vata Vyadhi or Urustamba. This presentation provides integrative aspect of Guillain-Barré syndrome with Ayurveda. The predisposing factors include recent infections, genetic susceptibility, autoimmune tendencies. The main causative factor of Guillain-Barré syndrome is Campylobacter jejuni, which is taken as Agantu Nidhana. It is more prone in Vata Prakriti individuals with Mandagni who follow Mityahara Vihara and leads to the formation of Ama. Onset is acute, rapidly progressive, usually starts in lower limbs and ascends. The Agantu Nidhana, which is the Campylobacter jejuni, enters the body through contaminated water and food, which is the Mityahara Sevana, that is uncooked poultry or unpasteurized milk. It colonizes the human gut, causing inflammation and symptoms of gastroenteritis, which range from mild diarrhea to severe bloody diarrhea with fever and abdominal pain. After few weeks, it leads to serious complication like Guillain-Barré syndrome, which is the immune activation post-infection. The immune activation involves production of ganglioside antibodies. Lipopolysaccharides on the outer membrane of Campylobacter jejuni resembles with the glycosides of peripheral nerve membrane.
So our body recognizes lipopolysaccharides and produce the antibodies. Our own antibodies attack our own peripheral nerve membrane, which resembles with lipopolysaccharides. Here anti-GD1A is a ganglioside antibody. It attacks the nodes of Lanvier. And avarana occurs, which leads to blockage of normal vata gati movement and leading to motor or sensory loss. In severe conditions, even respiratory paralysis occurs. The predominant dosha involved is vata dosha, and as there is involvement of inflammatory responses, pitta dosha is also present, and kapha is responsible for the avarana. The doshas involved are majja dhatu, snayu and mamsa dhatu. The shrotas involved are Majjavaha shrotas, Mamsavaha shrotas and Pranavaha shrotas. The ama may be formed due to Mandhagni, which leads to immune dysfunction and dosha dushti. Roga marga is Madhyama roga marga. Here, because of the agantu nidhana, the dosha dusha sammurchana occurs, which leads to vata prakopa. Either avarana of vata occurs or dhatukshaya of majja occurs. In case of avarana of vata, the vata gati gets interrupted, and in case of dhatu kshaya, the majja dhatu gets diminished, and which leads to motor and sensory dysfunction, leading to the clinical features of Guillain-Barré syndrome. Lakshanas. The main feature involved in Guillain-Barré syndrome is ascending muscle weakness, which is the mamsa kshaya or balahani. There is also areflexia, which is pandahani or chalahani. Sensory disturbances and respiratory distress is also present. As there is involvement of snayu, the snayugata vata features resemble with Guillain-Barré syndrome features, which is kalli, kubjatva, bahya abhyantara ayamam. And even the main involvement is majja. So the asti majjagata vata features also resemble with Guillain-Barré syndrome, that is mamsa balakshayam santata rukka. In case of urustamba, there is lack of control over the functions like standing, pressing the feet on the ground, walking and movement, and feeling as if the limbs are propelled by someone else. The Chikitsa of Anukta Vyadhi is based on the dosha, dusha and the nidhana factor. The pathophysiology of Guillain-Barré syndrome is mainly based upon the avarana. So Charakacharya explained avarana chikitsa in Charaka Chikitsa 28th chapter. Initially, as there is amapachana must be done, then anabhishyanti dravyas must be given, like pramati dravyas like vacha and maricha, which leads to the cleansing of the channels, that is Shroto Shodhana. Next, Vatanulomana must be done, and Kapha Pitta Aviruddha, that is which increase Kapha and Pitta dravyas must not be given. Later, in case of IP management, Yapanavasti, Anuvasanavasti and Rasayana Chikitsa is being given. As there is avarana of vata by kapha, Charakacharya explained Kshapanam and Shoshanam in Urustamba Chikitsa Sthana. Kshapanam is complete extraction and Shoshanam is absorption of the liquid frag. Next, in case of Dhatuksha, that is tissue depletion, if ama persists, we have to do amapachana. After it attains nirama avastha, Santarpana Chikitsa must be done. Next, in IP management, initially amapachana is done. In case of Samakapha condition, Chitrakadivati or Agni must be given. In case of Samapitta condition, Guduchadi Kashayam or Shadangapaniyam should be given. In case of Samavata condition, Hingvashtaka Churnam or Vaishvarnana Churnam must be given. Next, Dashmula Kashayadhara or Dhanyamla Dhara is preferred. Dashmula Kashayadhara or Dhanyamla Dhara, it helps in reducing inflammation, relieves pain and stiffness. It improves peripheral blood flow and helps in ama clearance from shrotas. Next, Utsadana or Lepa. As it has Ruksha or Ushna Guna, it helps in reducing Kapha Avarana, enhances local circulation, reduces muscle wasting by improving Rasarakta Mamsa Dhatu Poshana. Some of the examples of Utsadana or Lepa are Valmika Mritika Utsadana, Ashwagandhadi Utsadana, Vatsakadi Pralepa, Shonakadi Pralepa, Sarshapakalka along with Gomutra. After attainment of Nirama Avastha, then Sarvanga Abhyanga along with Patrapinda Sveda or Shashtikashali Pinda Sveda is preferred. Next, Nudu Virechana is advised for Shota Shodhana. Next, Yapanavasti in case of Nirama Avastha is being given. For example, Mustadi Raja Yapanavasti or Erana Moladi Yapanavasti. It balances Vata dosha, helps in Dhatu Poshana and promotes strength. It nourishes Majja and Mamsa Dhatu. At last, Rasayana Chikitsa is being given as it aims in Dhatu Poshana, Ojo Vardhana and Balya. It also helps in long-term wellness of the patient. Some of the examples of Rasayana are Amlaka Rasayana, Gugulu, Shilajat, Sukumara Gritam, Indukanda Gritam, Dadimada Gritam and Ashwagandhadi Churna. Discussion. The Guillain-Barré syndrome is an autoimmune mediated polyradiculoneuropathy which causes growing paralysis, altered sensation and even compromised breathing. From an Ayurvedic point of view, the clinical features closely correspond with either Avaranjanya Vata Vyadhi or Urustamba. The main dosha involved is Vata dosha, either because of Dhatu Kshaya or because of Avarana by Kapha or Pitta or Ama. The muscle wasting or weakness are the characteristics of Majja Kshaya Lakshana in the Dhatu Kshaya stage, while heaviness, stiffness and loss of mobility are characteristics of Kapha Avrita Vyana or Udhana Vata in Kapha Avarana stage. The Samprapti Katakas consists of disruption of Dhatu Poshana, Vata Prakopa, Kapha Avarana and Marga Varodhana. The main goal of the treatment plan is based on Dosha Dushya and Nidana factors, which is Kshapanam, Shoshanam, Vata Shamanam without increasing Kapha and Pitta dosha, Majja Dhatu Poshana and Rasayana Chikitsa. Conclusion. As Guillain-Barré syndrome is a multifactorial Vata illness that may include Majja Dhatu Kshaya and Kapha or Pitta Avarana. Ayurvedic treatments like Shapanam, Shoshanam, Bhastikarma, Brahmanam and Rasayana Chikitsa can be combined with contemporary supportive care to slow the progression of disease, increase the muscle strength and improve the quality of life. Better results can be obtained with an early stage intervention that emphasizes Avarana Shodhana and Vata Majja Poshana. This demonstrates how Ayurveda can help with both long-term functional restoration and symptom elevation in neuromuscular illnesses like GBS. Thank you everyone.
Thank you, Dr. Shradha, for the very detailed presentation. Thank you so much, Doctor. Up next, I would like to invite Dr. Avinash Vitalrag for the paper presentation on the topic Ayurveda and modern aspect of renal calculi.
Good evening, everyone. I'm Dr. Avinash Uttarwag, second year PG student of Sharla Tantra Department. I'm from Yeshwant Ayurvedic College, Kodul. Today I am going to present Ayurvedic and modern aspects of renal calculi. Introduction. The renal calculi is a hard solid mass of material that forms in the kidney from the substances of urine. Renal calculi develop as a result of various metabolic disorders which affect the fate of calcium and other mineral elements in the body. Stones may be formed in the kidney, urinary bladder, and urethra. In Ayurveda, renal calculi are termed as Ashmari. There are 4 types of Ashmari mainly described. Materials and methods. Descriptions were collected from standard Ayurvedic literature, Samhita, and recent researches. Papers related to topic of concern, modern textbooks, and articles were referred. Recent advances in the field of neurosurgery were studied. Review of literature. Ashmari, the word Ashmari is derived from 2 words, Ashma, stone-like structure, and Arim means enemy. Types of Ashmari according to Ayurveda. There are 4 main types, Vatash, Pittash, Kafash, and Shukras. Here we can see the Swarup of Ashmari as per Ayurvedic contexts are classified into these 4 main types. Types of kidney stones according to modern. Calcium oxalate, calcium phosphate, struvite, uric acid, cystic. Renal calculi types and morphology seen in X-ray film. Calcium oxalate mono round, calcium oxalate diet jagged edges, calcium phosphate similar to oxalate comparatively more dense, Triple phosphate, stack-on shape, cysteine, faintly radiopaque. Interpretation. Here we are going to see interpretation between Ayurvedic and modern types. Calcium oxalate mono, based on its shape, we can interpret it with Vata Jashmari because it is similar to Kadampa Pushpovat Swarup of Vata Jashmari. Calcium oxalate dye, it has jagged edges, so we can interpret it with Vata Jashmari because of its Kantak Chitta Swarup of Vata Jashmari. Calcium phosphate, similar to oxalate, more dense. So we can interpret it with Vata Jashmari because it is similar to Shav Swarup of Vata Jashmari. Cysteine, it is faintly radio opaque. So we can interpret it with Pitta Jashmari because it is similar to Madhuvarna and Pitta Obasa Swarup of Pitta Jashmari. Uric acid, it is feeble shaped, so it can be interpreted with Pitta Jashmari because it has Rakta Pitta Asita Swarup of Pitta Jashmari. Triphosphate, it is a stack-on calculus. It can be interpreted with Kaphaj Ashmari because it is similar to Madhukupushpavata Swarupa of Kaphaj Ashmari. Here we can see the images that shows shape and color of renal calculi that can be related to Ayurvedic Bheda of Ashmari and modern types of renal calculi. अश्मरी हेतु व संप्राप्ति हेतु असंशोधनशील व्यक्ति अपत्यकर आहार सेवन संप्राप्ति हेतु सेवन कपदोष प्रकोपित कपदोष मूत्र समवेत बस्तीमध्ये प्रवेश आणि अश्मरी due to improper purification of body and by following the improper diet and lifestyle kapha gets vitiated and combines with urine reaches in basti to अश्मरी संप्राप्ति घटक दोष त्रिदोष कफ बलवान दुष्य मूत्र स्रोतस मूत्र व स्रोतस अधिष्ठान बस्ती साध्य साध्यत्व कृच Pathophysiology. The formation of renal calculi is a complex process and depends on the interaction of several factors, including urinary concentration of stone-forming ion, urinary pH, urinary flow rate, the balance between promoter and inhibitory factors of crystallization, and anatomic factors that encourage urinary stasis. मूत्राश्मरी पूर्व रूप लक्षण पूर्व रूप ज्वर बस्ती पीड़ा आरोचक मूत्रकृच्छ बस्ती शीर मुष्क शेप वेदना बस्त गंधी मूत्र सामान्य लक्षण नाभि बस्ती सेवनी मेहन वेदना मूत्रधारा संघ सर्वदेह मूत्रता मूत्र विकिरण कोमेत प्रकाशाविल मूत्र प्रवृत्ति सिक्तामय मूत्र प्रवृत्ति क्लिनिकल मैनिफेस्टेशन severe abdominal or flank pain frequency and dysuria oliguria and anuria in obstruction hematuria burning sensation during urination. Here we can relate Vata Jashmari to related calculus on the basis of lakshana or type of pain it causes. Pitta Jashmari can be related to vesical calculus. Kapha Jashmari can be related to fixed renal calculus. Diagnosis is based on investigations like urine analysis, X-ray, KVB, ultrasonography, intravenous pyelogram, and cystoscope. Here are some images of X-rays and UHG that shows renal calculi in it. X-ray characteristics of stones: radio-opaque, poor radio opacity, and radiolucent. Radio-opaque renal stones are calcium oxalate dehydrate, calcium oxalate monohydrate, calcium oxalate phosphate. Poor radio opacity, magnesium ammonium phosphate, cysteine. Radiolucent, uric acid, xanthine, ammonium utrate. साध्यत्व व चिकित्सा साध्य साध्यत्व अंतक समान घातक तरुणावस्था औषध साध्य प्रौढावस्था शस्त्रक्रम साध्य चिकित्सा सूत्र स्नेहन उत्तर बस्ती व शस्त्रक्रम संशमन चिकित्सा. In renal calculi, we can give different औषध चिकित्सा according to its space. In Vata Jashmari, we can give Pashan Bedadikrut Ushaggan Siddha per Shar Parpati 250 mg with Anupan of Madhu. Chandra Prabhavati 250 mg TDS, Sahachar tail 20 to 40 drops in Apankar. In Pitta Jashmari, Pitta Raushad Siddha Shar Yavagu Yush Kashay Prayog. Virtadikwat 15 ml TDS. Shuddha Shilajatu 250 mg TDS. Kokshuradi Gugul 500 mg TDS. Shatavrayadi Yog. In Kapha Jashmari, Varunadi व Ushagganadi Siddha Ajagruta. Kokshuradi Gugul 500 mg PD. Apamarga 50 mg. with Anupan of Kadali Kandaswaras. Chandraprabhavati 500 mg TDS. Padanshatradi Kashay 50 ml TDS. Shastra Karma. Akriyayam dhruvo mrityu kriyayam jaya bhavet. Tasmat prachaya kartavyam ishvara sadhukarina. Susrut Chikitsa. Here we can see indications for Shastra Karma. Modern treatment. Urolithiasis management, conservative hydration, analgesia treat the underlying cause, facilitating stone passage, antispasmodic and calcium channel block. Surgical management, obstruction relief, urethral stent insertion, percutaneous nephrostomy, definitive surgical management, ESWL, retroscopy, PCNL, open, laparoscopic and robotic pylolithotomy, urolithotomy and cystolithotomy. Indications for active stone removal. Stones with diameter exceeding 6 to 7 mm. Persistent pain despite adequate medication. Persistent obstruction with risk of impaired renal function. Stones with urinary tract infection. Risk of pyelonephrosis, urosepsis. Bilateral obstruction. Obstructing calculus in solitary functioning kidney. Patya. You should drink at least 2 to 3 liters of water every day. Barley water, tender coconut water is more useful. Consuming the green gram, old rice, and wheat yolk char juice of Kushmanda is useful. Vegetables prepared from the leaves of Vrana, Pashanveda, Sahijana, Bokshura, Shaliparni, etc. Avoid Amla Vishtambi Guru Ruksha in excess, and also avoid Viruddha Ahara and Vidahi Annapana Sevana. Conclusion: Ashmari is very much prevalent condition having very high recurrence rate and it has large impact on human life. As Acharya Sushruta mentioned, Ashmari is like a messenger of death that is human. So it is necessary to diagnose and treat the Ashmari as early as possible. Prevention of disease is only possible when cause is established. Discussion: the term Basti mentioned Samprapti cannot be referred as urinary bladder, but it contextually refers to entire urinary system. The specific cause of Ashmari is mentioned in the Harit Samhita is Matrika dosh, suggesting the hereditary susceptibility of an individual to the disease. So analysis of the family members with or without stone demonstration that state the hypercalciuria, that is increased urinary calcium level in urine, is passed from generation to generation. Thank you very much.
Thank you, Dr. Avinash Vitalwag, for the paper presentation. Dear participants, we have all heard of Prameha, a condition deeply discussed in Ayurvedic classics and often compared to diabetes in modern science. Up next, I would like to invite Dr. Gode Leela Sharnya for the paper presentation on the topic A Clinical Case Presentation on Prameha.
Good evening, everyone, and respected panel. Here I am myself, Dr. G. Leela Sharanya, third year PG Scholar, Department of Chikitsa from Dr. NRS Government Ayurvedic Medical College, Vijayawada from Andhra Pradesh. Here my topic is like a clinical case presentation on Prameha. Prameha, we all know that it is a current global issue which is receiving greater attention, and we are comparing like with diabetes mellitus type 2. It causes substantial problems and predicted to remain a major health issue. Among the top 5 nations with the highest prevalence of DM is in India only. According to IDF Diabetes Atlas, of 10.5% of the adults aged 20 to 79 have diabetes, and nearly half of are not aware of that they have diabetes. And there is correlation between Ayurvedic prameha and symptoms are signs and symptoms are indicators of the diabetes. Ayurvedic prameha management is both promotive and preventive curative. We all know that Ayurveda is like promotive, preventive, and curative, right? Here my topic is regarding to a patient who is 73 years old male and has known history of diabetes from 35 years and came to our OPD with complaining of numbness and pains in all over the joints of the body associated with burning sensation of the soles for 8 months. And we advised like Shodhana and Shamana Aushadhis along with proper Patyahara Vihara for 1 month. There was very marked reduction in signs symptoms like burning sensation, numbness, and pain in all over the joints. We all know that Prameha is a Shleshma Pradhana Tridoshaja Vyadhi, as which is characterized by frequent and turbid urination. It is divided into 3 types based on doshas like Vata, Pitta, Kapha, and Vataja is 4 types, Pittaja is 6 types, and Kaphaja is 10 types, and Avasthanusara Beda of the Vyadhi. Based on Chikitsa aspect, it is classified into Sthoulya Prameha and Krusha Prameha. Clinical features of Prameha is correlated to diabetes. And here the case presentation is like his Pradhan Vedana, a patient who is complaining of numbness and pain all over the body in the joints and associated with burning sensation of the soles for 8 months. And he has a history of uncontrolled diabetes from 35 years. He had no history of any hypertension. He is using Novomix 30 flex pen and a Vidagliptin 50 mg. His family history like mother and father were also said to be diabetic, and his personal history like ahara, mixed diet, bowel, regular appetite, good sleep, disturbed and micturition, free flow. And his samanya pariksha like his appearance is fair and pulse rate 75 bpm, respiratory rate 17 bpm, and BP 130 by 80 mmHg, and weight 90 kgs, height 172 centimeters, bilateral air entry present. On examination, bilateral air entry is very clear, and S1 S2 here, and he is very conscious and oriented. And his prakriti is like Pitta Kapha, and other and Sara Sattva, Samhamana, Kosta, Pramana, Ahara Shakti, Jarana Shakti, Vyayama Shakti is like Madhyama, and his Agni is Vishama Agni, and his Nadi is like Vata Kapha, and Mutra 5 to 6 times per day, and Mala 1 time per day, and Jihva Sahama Yukta, and Shabda Spashta Sparsha Samasitoshna, and Drik Prakrita Akriti Madhyama. And we advise that Panchkarma is like we took reference from Charaka Siddhisthana 12th chapter Uttarbasti Siddhi, Madhutailadi Apanvasti. Usually in Prameha, Panchkarma is Panchkarma is not advisable, right? But we tried Madhutailadi Apanvasti, which is based upon Charaka reference. Here Madhutailam Chatuprastham Shatapushpam Ardhafalam Saindava Ardhakshaya Bastirdi Punaha, and Brahma, and the actions are like Brahmana Balavarnakara and Nirupadrava Vurushna Tamo Rasayana and Krimi Kushta Do Udavarta, Gulma, Arshas, Pradna, Pliha, Mehahara. So I took reference like because of Mehahara property is there, right? So I took this for case study, and for I want to try on because he is uncontrollable diabetes, like right. So I want to try Yapanvasti. So here, based on reference, where Acharya advised like 4 prasruta of madhu and taila should be added with half pala of paste of shatapushpa and half aksha of rock salt used for basti. This is very beneficial like Deepana, and these have Brahmana property, Balavarnakara and Nirupadrava and Vrishya, Andrasayana, and cures Krimi, Kushta, Udavarta and Vata in abdomen, and Gulma, Arshas, Pliharoga, Prameha. So what we advised like we used here they took for we took for Dhanvantari Taila and for Yapanvasti, and we given Shamana Aushadhi like Gudichu Churna, Panchanimba Churna and Rasna Saptaka Kwarta Churna combination along with hot water orally 2 times per day, and advised his allopathic medicine to continue. We after first sitting, we did treatment on 13 February 2025. We advised to take blood tests like random blood sugar, fasting and postprandial and urine sugar. The values are like before and after good changes are there. I observed like that. Random blood sugar is like from 282 after treatment 260 and fasting blood sugar 314 and after treatment 215. Postprandial sugar is not good in first setting. 222 mg per dl in before treatment, 237 mg per dl after treatment, but urine sugar like 3 plus and after treatment 2 plus. And I also did a second setting also, and his fasting blood sugar 217 mg per dl and after treatment 170 mg per dl, postprandial 274. Here result is like he result somewhat good, and after treatment 232 mg per dl. Urine sugar by before treatment 1 plus and after treatment there is no urine sugar. And here treatment recommendation, why I take like Acharya based on various levels of manifestation. The choice of therapy is based on stage determines the effectiveness of the treatment. According to classics, the primary causes of prameha are kapha dosha, medo dhatu and kleda. When kapha and pitta dosha are reduced and illness become vata pradhana prameha, vata dosha is worsened. In the present study, Thaila was selected because to eliminate deranged vata. Madhu selected for kapha derangement. So Madhutaila the Apanvasti has Brahmana and Deepana properties, right? So it cures Vata derangement, and Angamarda reduced due to Vata Shamana and polyuria, numbness, pain in all over the body joint, associated burning sensation is also relieved. This approach infers Brahmana treatment is to be followed till the subsidence of the Vata Lakshanas, followed by treatment strategies as per predominance of the doshas. Conclusion is like Ayurveda has highest value individualized medication. Prameha in Prameha Madhutailati Apanvasti as determined noteworthy outcomes in terms of subjective well-being in the study. After completing entire course of treatment, patient experienced notable elevation of the symptoms like Prabhuta Mutrata, Pipasa, Karapada Daha, Karapada Sukti, Avila Mutrata, etc. Urine sugar, FBS and PPBS changes are very positive results, and it was taken addition to his previous medication we told to continue. During this time, no herb drug interactions are also observed, and then it gets said to be Madhutailadi Apanvasti when combined with traditional anti-hyperglycemic medication effectively reduces the signs and symptoms. Thank you.
Thank you, Dr. Gode Leela Sharanya, for the excellent case presentation. We know that Gokshira, a well-known Ayurvedic herb, holds a special place in Garbhani Paricharya for its nourishing and strengthening qualities during pregnancy. Next, I would like to invite Dr. Mayuri Kande for the paper presentation on the topic use of Gokshira in Garbhani Paricharya. I would like to invite Dr. Mayuri Kande for the paper presentation. Dr. Mayuri. Hello, Dr. Mayuri Kande. Good evening, doctor.
Good evening, sir. Sir, I'm just finding little difficulty in sharing screen. Can you please play my PPT?
Sure, doctor. We will share for you. Just a moment, doctor. Doctor, please start the
you, sir.
session.
Good evening, everyone. Good evening, everyone. Myself, Dr. Mayuri. I am PG scholar, JRC from the Siddhakala Ayurveda Mahavidyalaya. Today, I am presenting use of Gokshur in Garbhini Paricharya. Next slide, sir.
Is the screen is visible, doctor?
Yeah, no, sir. Yes.
Please start the session, doctor.
Yes, sir.
Dr. Mayuri,
Yes, sir.
please start the session, doctor.
Okay. Importance of Garbhini Paricharya. Garbhini Paricharya, the antenatal care, specifically dietary regimen, vihar, normal daily activities, and dietary regimen, garbhopghatakar bhavas and substances which are harmful to fetus, as well as garbhasthapak dravyas, which are substances beneficial to maintenance of the pregnancy, are main components of the Garbhini Paricharya. Month-wise diet has been described by various acharyas, from which Acharya Shushrut has described month-wise dietary in a way. In first month, has described. The same way Charak Acharya as well as Ashtanga Sangraha has noted that medicated milk plain. In second month, milk medicated with the Madhura Rasa drugs. The same way Acharya Shushruta and Acharya Ashtang Vagbhata has also described. In third month, milk with honey and grita has described by Acharya Charaka. Acharya Shushruta has also described the same as first month, which is Madhura Shita liquids, which is Madhura Shita Dravya, Dugdha, milk with honey and grita. Acharya Vagbhata has described, and Kshira, Harit Samhita has described Kshira only. Uh, Grita prepared with the butter extract from the milk has described by Acharya Charak, and Acharya Shushruta has described in fifth month cooked shastika rice with milk, jungle mounsa rasa with dietary food mixed with the milk and grita. The same way, Ashtang Hridaya has described as like a charak, which is grita prepared with buttermilk, and Acharya Harit has described payasa. In sixth month, Shushruta has described the grita or rice glutaminated with the gokshura, which is my topic today. The Charaka has described in 6 month grita prepared from the milk medicated with the madhur drugs. And Acharya Hello.
You are audible, doctor. Please continue, doctor.
Yes, sir. Gokshura, yes, guna and proximity. The gunas are guru and snigdha. The gokshura's virya is shita vipaka. Madhura doshagnata is vatahara. The chemical components are diogesin, its acetate, glutenin, astragalin, diosin, gracilin, gokshura. Various studies which are done on the gokshura articles have published. They show antimicrobial, anti-helminthic, cardiotonic, anti-inflammatory, hypolipidemic action, immunomodulatory, antispasmodic, analgesic, anti-diabetic, anti-tumor. These are all actions of Gokshura. Antioxidant, CNS modulator properties. Considering its therapeutic values, a review has been done to gather complete information on different aspects of the Gokshura. The importance of 6 month is the 6 month of pregnancy fetus derives relatively more accumulation of energy and complexion. Hence, pregnant woman suffers loss of strength and complexion.
Dr. Mayuri, can you hear me? Next, I would like to invite Dr. Soumya Yalvargi for
Hello.
the presentation. Next, I would like to invite Dr. Soumya for the paper presentation.
Yes, sir.
Good evening, doctor.
Good evening, sir. Don't meet. How do I share my screen?
Just click the share screen option, doctor.
Share screen is there, but it's not working, sir. Schedule and written meeting is only there. Yes.
No screen is visible, doctor.
So I can't hear you.
Your screen is visible, doctor.
Okay. Thank you, sir. Thank you so much. Good evening, everyone. Myself, Dr. Soumya Alburgi, and I'm pursuing third year PG scholar in the Department of Samhita and Siddhantam, and I'm from Ilkal College. My topic is a review on Naistika Chikitsa. Let me begin with the introduction first. A life according to Ayurveda is not just only limited to body. I can't see it. A life according to Ayurveda is not only limited to body or physical symptoms, Sharirika, but also gives a comprehensive knowledge about social and spiritual and social health, which is Indriya, Indriyartha, and Atma. Ayurveda has unique approach in diagnosing and categorizing. I can't say this. Ayurveda has unique approach to diagnosing and categorizing diseases. There are wide range of treatments modalities which helps in curing broad spectrum of diseases. Ayurveda has always emphasized the importance of treating the mental aspects for complete relief. Acharya Charaka explains Upada is one of the cause of disease. It makes a person submerged in the self-made web of miseries which leads to cycle of rebirth. Naistika Chikitsa helps in attaining salvation, which is moksha. Absolute eradication of miseries is called as an moksha. A physician who practices Naistika Chikitsa is endowed with Brahma Sattvam with the help of Satya Buddhi as per Acharya Charakam. My aim of this presentation is to understand the Naistika Chikitsa to get rid of from the miseries and to attain mokshas. Review of literature will be from Charaka Sharirasthana first chapter, which is Katita Purushiya Adhyaya. The main cause for the dukkha are upada. Upada is called as in dukkashraya. Upada hi paro hetu dukkha dukkashraya pradaham tyagaha sarva upadanam cha sarva dukkha vyapohakaham koshakaro yatha yashuna upadatte vada pradanam upadatte tatho abhyam artebhya trushnam ajnyaha sada aturaham yastva agni kalpanartamcha yo abnyam तेभ्यो निवर्तन्ते अनारंभाद संयोगात दुःखनोपतिष्ठति, which is from Charakasharirasthana first chapter. Upada gives rise to dukhas, which is the primary cause to make individual dwell into web of Janana Marana Chakra. Desires of materialistic world leads to anger, lust, hatred, and enmity. Ashtanga Sangra also begins with the Ragadi Roga, which is a cause for Upadas. One example he has given is a silkworm produces and weaves around in a silk threads, which would cause death. Similarly, an ignorant person bound with worldly miseries always provides for himself. Upada is Rajatama, which are Manasika doshas, among which one should aim at developing the Sattva Guna as it can help to keep mind healthy. Increased Rajaguna disturbs the coordination between mind and body, causing unnecessary thinking. Increased Tamaguna generates negative thoughts. Upada gives rise to Dukkha, which is primary cause. Upada is surrounded by Ichha, Dvesha, Moha. Their pravritti leads to Ahankara, Sangham, Samshaya, Abhiplava, Abhyavapata, Viratyaya, Avishesham leads to Dukkha. This Nevritti leads to Sukham. Sukha indirectly gives to Moksha, which is called as a Naishtiki Chikitsa. Now, Naishtiki Chikitsa. Yuktim etam puraskrityam trikala vedana bishak hanti yuktam chikitsatu naishtiki ya vina upadam. Absolute eradication of miseries. Elimination of upada is free from rogas. Devoid of raga, dvesha, trishna, icha, moham. Chikitsa, which is devoid of upada, is called as an Naishtiki Chikitsa. It helps in relieving the trikala vedanas. A person keeps him out of desires and materialistic attachments. A wise person abstains from object of senses, self-detached from raja and tama. How to attain Naishtiki Chikitsa? First one is Satya Buddhi. Sarvakaranavad dukham swam cha anityam eva cha na cha atmakritakam tadadi tatra cha utpadyate swatham. Yavanna utpadyate satya buddhi taddaham yatham naitanmayati vijnayajnaha sarvam ati vartate. Anything that causes misery is always strange and ephemeral. It is not produced by Atma, but one has got a real feeling of its ownership until one has got real knowledge to its effect. As soon as one knows it, person can get rid of from miseries. Benefits of Satya Buddhi is in Naishtiki Chikitsa. It helps in elimination of psychological symptoms like Kama, Krodha, Lobha, helps to explore the knowledge of Satya Nitya Vishayas, imparts the Samyak Jnana, aids in attaining mokshas. Tattva Smriti. Tattva refers to Darshana or Shastras which are responsible for Purusha Utpatti. Smriti refers to Anubhava. Smriti Karanas are Vakshante Karana Ashto Smriti Rupajayate Nimitta Rupa Grahanat Sadrishyat Saviparyayat. सत्व अनुबंधात् अभ्यासात् ज्ञान योगात् पुनः श्रुतात् दृष्टश्रुत अनुभूतानां स्मरणं स्मृतिरुच्यते. Karanas for smritis are nimitta grahana, rupa grahana, sadrishya, saviparya, sattvanubandha, abhyasa, drushta, shruta and anubhuta. How to attain moksha? Mokshana refers to Vedana Nivritti. Yogena mokshecha sarvasam Vedanam vartanam moksho nivritti nisheshaha yoga moksha pravartakaha. Moksha sadhakas are attained by practicing Adhyatma Jnana, Sadvritta, Achara Rasayana, Yoga, Samadhi, Dhruti Smriti, Vedana Nivritti, Kama Krodha Varjitam, Satsanga Seva, Jnana, Medhya, Pradnyam, Siddhi, Atma Shuddhi, Brahmacharya and Vijane. By this, I want to conclude my presentation as Ayurveda is regarded as the science of a life rather than mere symptom of medicine, and practice involves the care of physical, mental and spiritual health of human beings. The norms of Ayurveda are based on Hitayu and Sukhayu. Naishtiki Chikitsa provides absolute health, which may be considered as an Adhyatma Chikitsa, a new approach to explore the three-dimensional health education in preventive, promotive and health has been done, and there is a role of Adhyatma Jnana in state of preventive health in the form of Sadhrutta, promotive in the form of Achara Rasayana, Yoga absolute through Moksha Marga via Naishtiki Chikitsa. These are the references, and thank you so much.
Thank you, Dr. Soumya, for the well-explained presentation.
Thank you, sir.
Next, I'd like to invite Dr. Sanjana is for the paper presentation on the topic Shatachavrana, cellulitis. Dr. Sanjana, are you there? Hello, Dr. Sanjana, are you there?
Yes, sir. Good evening.
Good evening, doctor. Please share the screen, doctor.
Sir, I'm not able to share, sir. Kindly do share.
Sure, doctor will share for you.
So, namaste. Good evening to everyone. Myself, Dr. Sanjana S., finally a PG scholar from the Department of Shalya Tantra, Sri Kalabhairaveshwar Swami Ayurvedic Medical College Hospital and Research Center, Bangalore. So, today I'll be presenting a case of Dushtavrana. So, next slide, sir. Hello.
Just a moment, doctor.
Okay. So, the patient details a female of aged 65 years of middle class who was married, and her occupation was homemaker, was admitted in our hospital on 25th September 2024. So the patient's main complaints was she had a complaint of blackish discoloration in the tip of the middle finger of the right hand since 1 week, and swelling of the right hand since 5 days. So next slide. Actually, I have 66 slides here, so I'm converging and doing it. So, Pradhana Vedana was swelling in the tip of the middle finger of the right hand since 1 week, and Anubandha Vedana was increased body temperature since 3 days, and complaints of numbness in the upper limb since 1 year, and Vedana Vrittanta. So patient is a known case of type 2 diabetes mellitus and hypertension since 15 years and was on regular medications. And patient is a known case of diabetic neuropathy since 1 year. And patient reveals a history of a wound which is caused due to the contact with the steam and hot surface of the cooker in the right hand region. And she noticed gradual swelling in the right hand region. And she neglected the wound for 3 to 4 days. And she later developed redness, blister, and pricking type of pain, and patient was unable to bend the fingers of the right hand, and gradually she developed fever since 3 days. And since she was not able to lift any object, she consulted a local clinic and she was given some medications, the details of which were not known. And Puravyadi Vrittanta, she was on regular medications such as tablet Telmikind H1OD and tablet Jalra M1BD. Vaiktika Vrittanta, diet was mixed diet, appetite good, sleep was sound sleep, picturation 5 to 6 times in a day and 1 to 2 times in a night, and bowel was hard stools, and habits coffee, tea twice in a day. Kautambika Vrittanta, all the family members were said to be healthy. Rogi Pariksha, build was well built, nourishment well nourished, pallor, icterus, cyanosis, clubbing, lymphadenopathy was absent, edema was present in the right hand, and tongue was coated. Temperature was febrile, that is, during the time of admission, it was 100.1 degree Fahrenheit, and pulse was 84 beats per minute, BP 140 by 80 mmHg, respiratory 16 cycles per minute, height was 165 centimeter, weight was 90 kg, BMI was 34 kg per meter square, gait was normal. Ashtasthana Pariksha, Nadi 78 beats per minute, Mutra 1 to 2 is in at night, Mala Vibandha, Jiva Liptata, Shabda Sparsha Druk Akriti was normal, and then Dashaveda Preksha, Prakriti was Kapha Pitta, Hetu was Abhigata due to the contact burn, and Dosha, Tridosha, Dusha, Tvak Rakta Mamsa Meda, Desha Sadharana, Kala Visarga, and Bala Madhyama. Sara Samhanana Pramanas was Sara Samhanana was Madhyama, Pramana Pravara, Satmya Vishram Vyamishra Satmya, Sattva Pravara, Ahara Shakti, Abhyavarana, and Jarana Shakti was Madhyama, Vyayama Shakti was Madhyama, Vaya was Madhyama. This was systemic examination. Cardiovascular system was all normal. Respiratory system inspection, shape of the chest was bilaterally symmetrical, chest movement symmetrical, palpation trachea centrically placed, and percussion auscultation was normal. Gastrointestinal system all was normal. And nervous system, higher mental functions such as consciousness, orientation, memory, all was intact. Hallucination was absent, speech disturbance was absent, and handedness was right. Motor system, muscle bulk was normal, muscle tone, muscle power, reflex, all the plantar reflex was normal. But the sensory system was deranged. That is, in upper limb and lower limb, touch was hypoesthesia in both right and left hand. Pain was hypoesthesia in the right hand, and whereas it was normal in the left hand. Vibration was normal in both hand, and temperature was hypoesthesia in the both the hands. Muscle strength, that is, wrist movements and finger movements of the right hand was restricted due to the gross swelling. So during the time of admission, the patient presented with such history as depicted in the photo. So there was a necrotizing tissue which was seen in the tip of the middle finger of the right hand, and tenderness, bleeding, slough, discharge was absent. This was the image of the dorsal and the ventral portion I've depicted. So on examination, there was swelling, redness, wound, and blackish discoloration was noted. So investigations which was done on 25th September, which showed HB was 11.3 and total count was pretty much raised of about 20,500 cells per CUMM. Rest, she was uncontrolled diabetes mellitus. So GRBS was 395 and the ESR was elevated up to 46 mm per hour. Creat levels and electrolytes levels were normal. This was the chest X-ray beaten. And a repeat CBC was done on 28th September, which showed HB was 11.2 and total count was 15,000 cells per CUMM. Next slide, sir. So it is a comparative chart which showed after the course of antibiotics, the WBC count was reduced from 20,500 to 7,700 on 4th of 10th. Roga Pariksha. So Nidana was Abhigata, Purva Rupa was Vispota and Dakshina Hasta, Rupa was Shofa, Vedana, Shravada, Vranasthana. Samprapti, due to Nidana Tridosha Prakopa, there will be a sthana prakopa of the Tridoshas, due to which there will be sthana samshraya in the Dakshina Hasta. Dosha Shofa Spota occurs, and which initially was a cellulitis case, but patient approached after 15 days to us. So as Acharya Sushita says, any Vrana after the duration of 7 days, it leads to Dushtavrana. So I have considered as Dushtavrana. And Samprapti Gataka, Dosha Tridosha, Dusha Tvak Rakta Mamsa Meda, Ama Jatragnijanya, Datvagnijanya, Srotas is Rasavaha Raktavaha Mamsavaha. Shrota Vikriti is Sangha and Vimarkakamana. Udbhavasthana is Anguli. Sancharasthana is Dakshinahasta. Vyaktasthana is Hasta Pradesha. Rogamarga is Bahya. Sadhya Sadhyata is Krichara Sadhya. So differential diagnosis, Raynaud's phenomena, abscess and scars with cellulitis have been considered. Vyavachedaka Nidana, Plushtadagda and Shatajavrana. So since it was a wound which is caused by a kshata, so I have considered as Shatajavrana, that is cellulitis. So treatment management, diabetic management and a wound management was done. Diabetic management was done with the help of insulin or OHA, and diet and lifestyle correction was advised. And wound management was done with the help of wound debridement, antibiotics followed by analgesics. So Chikitsa Vrittanta is eto gatim vidyat utsango yatra yatra cha tatra tatra pranam kuryat yata dosha na tishtati, as mentioned in Sushruta Sutrasthana 5th chapter 12th shloka. Vedana karma was done and Vrana Shodhana followed by Vrana Prakshala with Panchavalkala Kashaya and Vrana Ropana, that is dressing with Sharataila, was done. Treatment on 25th September 2024, wound debridement was done under local anesthesia. So the necrotizing tissue which was seen in the tip of the middle finger was excised, followed by the excision of the nail was done. And incision number 1 was the pus which was collected in the dorsum of the right hand, that is at the base of the third metacarpophalangeal joint. The cruciate incision was taken and all the pus collection was drained. And incision number 2 was on the palmar surface. A stab incision was made on the proximal phalanx. I'm sorry. Incision number 3 at the base of the thenar prominence. Incision was made and the collection was drained. And the post-operative management was done with the help of injection Pepzo and injection amikacin was given for 5 days. And orally tablet Nishamlaki, Avipatikara Churna and Punarnavadi Gugulu was advised for a duration of 1 month, sir. Next slide, sir. So our main intention of presenting this case was the patient approached a local hospital in which they said it need to be amputated, but we took this challenging case and treated the entire case within 40 days, sir. So day 1, this was the wound image. This was the day 2 after debridement, in which excision was nail was done. Next, sir. So this was on day 8. This was on day 40. On OPD basis, the wound was completely healed, and the patient could do the movements of the right hand, and swelling was reduced. Redness, warmth, swelling, tenderness was all reduced, and patya was patya is Shali Goduma, Mugda, Saindava, Dadima, Gruta. Patya is Tila, Masha, Kshira, and Viharas like Patya is Chakramana. And proposed line of treatment is Vrana Prakshalna, Nagrodadi Gana Kashaya can also be used. And daily dressing can also be used with the help of Ropana Taila. And Kaishora Gugulu 2 video can also be advised. Thank you.
Thank you, Dr. Sanjana, for the well explained case presentation. Thank you so much, Doctor.
Thank you, sir.
Next, I would like to invite Dr. Shahana HS for the paper presentation on the topic Saptopakrama in Vrana Shobha. Dr. Sahana, are you there?
Yes, sir.
Good
I am
evening,
here.
doctor.
Good evening, sir.
A minute, sir. I'm sharing it.
Just a minute, sir. I am sharing the screen.
Okay, doctor.
Hello.
Sir, it's loading. It may take 2 minutes.
Okay, doctor. Doctor, if you have any problem with screen sharing, we will share for you, doctor.
Yes, sir.
Yes, sir.
Okay, doctor. Please start the session.
Okay. Myself Sahana from Kalabhaireshwara Ayurvedic College, Bangalore. My topic is Saptopakrama in Rana Shofa, guided by Dr. S.V. Shailaja ma'am. Contents are introduction, Rana Gatra Vichurane, Ranayatiti Ranaha. Destruction or damage to the tissue of the body part is termed as Rana. Rana has been given major and primary importance in Shalya Tantra, as we know. Acharya Shushruta explained various measures for management of Rana in brief. He mentioned basic line of treatment for Rana Shofa as Sapta Upakrama, which is also used in Rana as Shashti Upakrama, which are detailed variants of Sapta Upakrama. In Namapakvashaniya Adhyaya, Shushruta Sutra 17th chapter, he stated Saptopakrama Chikitsa, which should be performed according to stages so as to avoid complicating to next stage of Rana Shofa. Shushruta stated in Shashti Upakrama for treating Rana, which are expansion of Sapta Upakrama. Rana Shofa definition. Shofa Samuttana Granthi Vidrati Alachi Prabrutayah Prayena Vyadayo Abhita Anekakrutayah Tairvilakshanaha Prutugratita Samo Vishamova Tvagvam Mamsastai Dosha Sangataha Sharireka Shofa Ityuchate. Shushruta Sutra 17 chapter 3rd shloka. The various disorders like Granthi, Vidrati and allergy usually presents with Shofa, but having little unlikely from them, spreading, nodular, equal or unequal, seated in Tvacha, or Mamsadhatu with vitiated doshas present in one part of the body is called as Rana Shofa. Saptopakramas. Ado Vimlapanam Kuryad Dvitiyam Avasechanam Trutiyam Upanaham tu Chaturte Pataka Patana Kriyam Panchamam Shodhanam Kuryad Shashtam Ropanamishyate Ete Krama Ranasyoktaha Saptamam Vaikrutapaham. Vimlapana. Shushruta Chikitsa first chapter 22nd shloka says that Stiranam Rujanam Mandam Karyam Vimlapanam Bhavet Abhyajya Svedayitva tu Venu Nadyah Tataha Shanaihi Vimardayet Bishak Prakstalena Angushtakena va. According to Shushruta, in case of Sthira Mandaruja Ranashofa, after Snehana and Svedana to the part, Pidana should be done with bamboo tube or palm or sole or thumb. This massage aids softening of the swelling. Purpose of this Vimlapana is Prakupita Dosha Vilayana and countering Vata Dosha. Various Acharya's opinion includes Dosha Vilayana by using procedures as Lepa, Abhyanga, Sveda, Bahya Parimarjana, Tarpana, Pariseka, etc. Avasechana, second Saptopakrama. Avasechana may be considered in different ways as Rakta Visravana, Sharira Dosha Nirharana, and Parisheka. Rakta Visravana, Shushruta Chikitsa, first chapter, 27 to 30th shloka says that Vedanopashamanarthaya Tata Pakashamaya cha Achirotpatite Shofe Kurya Shonita Mokshanam Sashofe Katine Dhyame Sarakte Vedanaviti Samrabde Vishame Chapi Rane Visravanam Mitam Sa Vishe cha Visheshena Jalaukavacharan padaiस्तता वेदनायाः प्राशान्त्यार्थं पाकस्याप्राप्तये तथा. This is about Rakta Visravana. In case of Shofa of recent onset, Rakta Mokshana should be restored in order to mitigate the Vedana and Paka. Even in Rana associated with Shofa, which are Katina, dark in color, containing Rakta, Vedana Yukta, or deep-seated Rakta Avasechana should be done. In case of Shofa associated with Visha, Rakta Visravana should be done by using leech or by Shastra. Rakta is undergone Vikruta in Shofa. By removing it, Vikara will goes off. Dosha Avacheshana. Removing overall body doshas helps in ultimately downsizing impurity load at the wound and improves the prognosis. Even in general, Shushruta has explained importance of Sharira Shodhana for Ranita. For this purpose, it can be carried out by Vamana, Virechana, Basti, Uttara Basti, Nasya, Shiro Virachana, Dhuma, Kavala, etc. Parisheka, pouring medicated liquids or decoctions over affected area which aids to remove impurities. According to dosha predominance, drugs used are in Vata, Dashamuladi, Bhadradarvadi, Vidari Gandhadi, Mamsarasa can be used. In Pitta, Sharkarodaka, Ikshurasa, Kshira, Chandanadi, and in Kapha, Taila, Mutra, Ksharodaka, Pipalyadi can be used. Purpose of Avasechana, Prakupita Dosha Shamana, Dosha Nirharana, Vedana Shamana, and Shota Upanaha, third Saptopakrama, Upanaho, Vachakinva Shatahve Devadara Darubhi, Danyehi Samastai Gandhaischa, Rasna Yerenda Jatam Mishaihi, Udrikta Lavanaihi, Sneha Chukra Takrapaya Luptaihi, Kevale Pavane, Shleshma Samsrishte, Surasadibihi, Pittena Padmakadaistu, Salvanaikya, Punaha Punaha. All of the above said drugs should be taken and eat together form warm utkarika of this combination and should place over swelling followed by bandaging. This is said by Ashtanga Hridaya 17th chapter. For kapha dominance use Surasadi Ganadravya and for pitta use Padmakadi Ganadраvyas. Shofayor Upanaham tu Kuryad Ama Vidagdayoho Shushruta Chikitsa first chapter. In unsupurated or partially suppurated inflammation, Upanaha, application of poulticers are advised. Due to this, inflamed swelling either subsides or suppurates quickly. Purpose of this is Shota Shamana in Nama Avastha and Paka Abhimukata in Pachyamana Avastha. Fourth Upakrama, Patana. If inflammation and swelling doesn't reduces even after use of above three procedures and when it gets suppurated or liquefied, then Patana Kriya should be performed. Disadvantages are if it is done in Amavastha by mistake, then it may cause injury to Mamsa, Sira, Snayu, Asti, Sandhi, injuries to different body tissues with various complications as blood loss, pain, etc. Ignoring or missing the suppurative stage may causes spread of pus to surrounding normal tissue and may result in formation of nadirona. Hence, it is important to recognize the stage first and then treat accordingly. Procedure of Patana, it has to be done in Pakvavastha. Different kinds of Shastrakarma can be used to open the cavity and suppurative contents inside are drained out well by Pidana. And cavity is cleaned with Kashaya. This has to be performed with proper Purva and Paschat Karma. Purpose, training doshas, avoiding sinus formation and further progression to gangrene by timely removal of pus and debris. After Patana Kriya, Rana Shofa gets converted into Rana and then it is treated with next Kramas, Shodhana, Ropana and Vaikrutapaha. Shodhana, fifth Upakrama. Cleaning wound post-incision with medication so as to remove pus, debris, promote favorable environment for healing. Procedure: Shodhana is done by using kashaya of Shodhana dravyas as well as using them in other forms like Kalka, Rasakriya, Churna, Varti, Grita, Taila, Dupana, etc. Shrita Sutra 37 chapter says this. So these are used locally by pouring liquids or applying pastes or other forms over wound. Drugs used are Shankini, Jati, Karavira, Suryavarta, Trifala, Daroharitra, Nimbapatra, Bala, Darba, Aragvadadigana, Negrodadigana, Surasadigana, Trikatu, Karanja, Manjishta, Triurut, Chitraka, Danti, Panchavalkala, etc. Mostly dravyas with properties as Kashaya, Katu, Amla, Lavana, Rasa, Tikshna, Ushna, Ruksha are used. Purpose: cleaning of wound, reducing local dosha dhatu dushti, reducing toxins and microbial load, discharge debris in wound, promotes healing. Ropana, sixth upakrama. Measures for healing of wound by promoting healthy granulation. Procedure: Ropana is done when wound gets into Shuddha Avastha after achieving a clean wound. It is done by use of application with 7 Ropana Kalpanas, Kashaya, Varti, Kalka, Grita, Taila, Rasakriya and Churna. Drugs used are with the properties like Madhura, Kashaya, Rasa, Snigdha, Shita, Balya, Jivaniya drugs. And examples: Nyagroda, Udumbara, Plaksha, Madhu, Chandana, Manjishta, Durva, etc. Purpose is healing of the wound by promoting granulation. Vaikritapaha. This is the 7th upakrama. Even after complete healing of Vrana, restoration of normal color shapes and shapes are essential. Sometimes there is abnormal pigmentation, depression or elevation, hair loss, etc. So Vaikritapaha is a measure which helps in restoration. For this, Krishna Karma, Pandu Karma, Roma Sanjanana and Roma Parana is explained. Krishna Karma, Krishna Chikitsa first chapter 90th shloka, Drudatvatu Shuklanam, Krishna Karma Itam Bhavet. White scar the results after healing of those wounds which cure with great difficulty, Krishna Karma are advised. Shrita Chikitsa first chapter 98 to 93rd shloka says that Ballataka seeds are soaked in urine, cow's urine, followed by cow's milk, each for 7 days. After that, seeds are cut into two and filled into an iron pot. Another mud pot is to be buried in the ground, and the pot containing balataka kept over it, joining and sealing the mouths of both with mud splash. The seeds are then cooked by fire or of cow dung heaps. The oil of balataka seed are trickled slowly in lower part. Hoof of domestic animals and a mashi margins are burned by fire and then powdered nicely. Then it is mixed with and the Pandukarma whitening, Shushta Chikitsa first chapter 94 shloka. Pandukarma are advised in those cases in which after improper healing of wound, a dark color scar has resulted out of Rana. Rohini Phala, Kapitta Phala, etc. with other drugs are processed and used in these cases. Shushta Chikitsa 1 bar 95. 97 to 98. Evacuated shell of Kapitta fruit is filled with urine of goat, added with powder of Kasisa, Rochana, Tutta, Aritala, Manashila, bark of Renu, Rasanjana and Arjuna. The shell are buried in the ground for 1 month. After 1 month, it is taken out. The paste inside is applied over the wound area. Roma Sanjanana, Shushita Chikitsa, first chapter 101 to 102 shloka. Basma of Astidanta mixed with Rasanjana is helpful to grow hairs even on the palm. Cassis and leaves of Naktamala are macerated in the juice of Kapita is best for growth of hairs. Roma Apaharana in the Vaikrutapaha, Shrista Chikitsa 104 to 106 says that due to presence of hair, wounds are not healed properly. In that case, hairs are removed by razor, scissor, etc. 2 parts of Basma of Shanka, 1 part of Aritala macerated in vinegar is best to make the hairs fall off. Oil of Balataka mixed with latex of snowy is helped as one of the best preparation. As of Kadali and Dirgaranta with Haratala salt and seeds of Shami in the form of paste prepared in cold water are used to depletion of hairs. And the discussion, Ayurveda do have extensive knowledge about Rana Shofa and Rana with different stages. Acharyas have keenly described treatment necessary according to the dosha stages of Rana Shofa. For easy and practical understanding of treatment options, Shrita has simplified them into Saptopakrama. These can be opted extensively from Shashti Upakrama as they originate from Sapta Upakrama. Incorporating these treatment options in treatment of wound would definitely offer cost-effective ways of wound treatment, which is still sometimes complicated in surgical practice. Conclusion: Vaidya should rightly diagnose the condition and necessary steps should be taken for managing the Ranashofa as its earlier stage so as to prevent further progression in complications. Appropriate treatment modality has to be selected in specific avastha, considering the dosha and lakshana based on yukti of the Vaidya. Thank you. Thank you so much, sir.
Thank you, doctor. Thank you for the insightful presentation.
Thank you, sir.
We know that PCOS is a condition that continues to challenge modern medicine, but Ayurveda offers a unique perspective through the concept of Shradha, obstruction of body channels. Next, we have a poster presentation. I would like to invite Dr. Rutuja Jadhav for the poster presentation on the topic Shradha in PCOS and Ayurvedic insight. Dr. Rutuja, are you there?
Yes, sir. Yes. Sir,
Good
can
evening,
you
doctor.
present my poster? Good evening, sir. Sir,
I'll
can you
share the
present my
screen,
poster?
doctor. I'll share the screen,
Yes, sir.
doctor. Just a moment.
Okay.
Please start the session, doctor.
Good evening, everyone. I'm Dr. Rutuja Jadhav, second year PG student from Department Sri Rog and Evam Prasuti Tantra from Dr. D.Y. Patil Ayur, College of Ayurveda, Pune. Today, I will be presenting us on Srotarod in PCOS and Ayurvedic insight that PCOS or polycystic ovarian syndrome is a complex endocrine disorder affecting women of reproductive age. Modern science primarily explains PCOS as a result of hormonal imbalance and metabolic dysfunction. However, Ayurveda provides a deeper cause understanding through the concept of Srotarod, which means obstruction or blockage in body's function channels. In the context of PCOS, this blockage mainly affects the Artava Srotas, responsible for menstrual and reproductive functions. Definition of PCOS. PCOS is a condition with multiple small cysts in ovaries, irregular menstrual cycles, and features of the hormonal imbalance like hirsutism and infertility. The underlying pathology is Srotarod, that is blockage of Artava Srotas due to kapha and meda adveshta, along with the ama accumulation. This blockage disturbs upon vayu, impairs ovulation, and lead to classic symptoms of the PCOS. Causes of Srotarod in PCOS. Uh, Aharaj, Viharaj, and Mansik Nidan. Aharaj Nidan, excessive intake of heavy, oily, guru and junk food, lack of digestive fibers, leading to armor formation. Viharaj, Viharaj Nidan, sedentary habits, prolonged sitting, lack of exercise, excessive sleep, especially Devaswa. Mansik Nidan, emotional stress and anxiety, disturbs Vat and Apan Vayu. Chronic stress due to this also disturbs hormonal regulations. All these factors aggravate kapha and meda, while while weakening Agni, resulting in arm formation and obstruction of the srotas. Root pathology in PCOS, med dhatu vruddhi and arm accumulates. Kapha aggravation causes heaviness and sluggishness in the artava slitus. This obstruction leads to hormonal imbalance, anovulation, failure of the ovulation, arrest of follicular growth, formation of the ovarian cyst. Srotorod lakshana, irregular menstruation, amenorrhea or scanty flow, that is mastardo, weight gain, hirsutism and acne, infertility, ovarian cysts detected on the USG. Ayurvedic view of PCOS via Srotorod. Kapha and meda accumulation in Artava Srotas hinders Apan Vayu normal downward movement. When Apan Vayu cannot function properly, ovulation fails. As a result of as a result, follicles do not rupture, cyst formations, and this leads to menstrual irregularities, hormonal imbalance, and fertility followed by them. Then Samprapti Ghatak in PCOS. Dosh involvement in PCOS is Kapha, Vata, and Pitta. Visheshan. Dushta involvement in PCOS, Rasa, Rakta, and Meda. Srotas involved in PCOS are Artava and Medava Srotas. Agni involved in PCOS is Mandagni, which leads to arm formation. Srotorod is a kapha and may the obstruct artava slotas. Then Chikitsa Siddhant, aim of treatment to remove the Srotorod, balance the activated doshas, improve Agni, and normalize artha production and function. Shodhan Chikitsa, Vaman for kapha, Virechan for pitta and meda, Basti for apanvayu and vata regulation, especially pitta kshira basti. रसायन and गर्भ संबंधी द्रव्यास are अश्वगंधा, शतावरी, गुडुची, फलगृत, शतपुष्प चूर्ण. And then ahar and vihar, light kaf meda, pacifying diet, regular exercise and yoga. Avoid devaswap and stress. Discussion. In PCOS, kapha, meda and arm cause obstruction in artha srotas, which leads to anovulation, irregular cycles and infertility. Ayurveda's management focuses on Srotoshodhan, that is removing blockages, Agni Deepan, that is enhancing metabolism, and dose balancing. By addressing the root cause, Ayurvedic treatment improves hormonal balance naturally and supports ovulation and enhances the reproductive health. Conclusion. To summarize, the Ayurvedic concept of Srotoshodhan offers a holistic explanation for PCOS pathology. Treatment focuses on removing obstructions, improving Agni, balancing doshas, and restoring normal artha function. This not only addresses symptoms but also corrects the root cause, making it sustainable and natural approach. Treating Srotorod is the key to breaking the cycle of PCOS. By integrating Ayurvedic principles with lifestyle modification, we can achieve long-term hormonal and reproductive health. Ayurveda not only offers symptomatic relief but also works at the root level, which is the truth, true strength of the science. Done, sir.
Thank you, Dr. Rutuja. Thank you for the poster presentation.
Thank you, sir.
Next, I would like to invite Dr. Srishti for the paper presentation.
Yes, sir.
Good evening, doctor.
Good evening, sir.
Just a minute, sir.
Okay, doctor. Hello, Dr. Srishti, can you hear me?
I'm not able to share it. It's not supporting at present. Can you share my PPT?
Sure, doctor. Please start the session, doctor.
Okay. Hello, everyone. My name Dr. Srushti. I am from MD second year Panchkarma scholar. I am here to present my case report entitled as Management of Visphotaka with Panchakarma under the valuable guidance of Professor Anup Thakur sir, Department HOD of the Department Panchakarma, ITRA Jamnagar. Next slide. Introduction. In Ayurveda, Visfotak is mentioned in Shudra Rogas, which is characterized by Agni Dagdha Nibhas Phota, that is, which is feels like burning sensation or burnt by fire, and Jwara, and it is spread all over the body, mainly due to Pitta and Rakta doshas, which is aggravated by Vata dosha. Visfotak can be compared to pemphigus vulgaris due to its resemblance in signs and symptoms. Pemphigus vulgaris is an autoimmune disorder that involves blistering and erosion of the skin and mucous membrane. The estimated prevalence of Visfotak in India is found to be 20 to 30%, while 35 to 40 age group of people are commonly affected. Mainly, female are more prone to this disease. Nidan like incompatible food items, restriction of producing vegas, that is vega varot, immediate exposure of hot after cold, of of treatment chosen with the usurper as it was applicable for the disease. The following case was reported at our OPD with symptoms of blisters and papules over the face, chest, bilateral hands and arm, and feet with burning sensation and discoloration. The details of the patient are as follows. Age was 25 years, sex female, religion Hindu, unmarried, occupation student, address Jamnagar, and the date of admission and date of discharge and OPD number are as follows. Patient presented with chief complaints like reddish, blackish papules and blisters all over the face, bilateral hands, arms, chest, and feet since 6 months. Associated complaints were constipation since 1 year and burning sensation all over the body with discoloration. Aggravating factors were summer and rainy season, having spicy and oily food, and patient had taken steroids for pimples over the face. Relieving factors and were not found, and history of past illness was also not significant. Family history was not significant. Personal history: appetite was poor, bowel habit. Patient had passed once a day, having hard consistency and non-satisfactory. Micturition 5 to 7 per day. Sleep was adequate and sound. Addiction was no any. Diet was vegetarian. And height, weight, and BMI was as follows. The menstrual history was regular. General examination and examination was general tongue was white coated. Pulse rate was 76 per minute. BP was normal, and respiratory rate was also normal. On skin examination, distribution was found on face, bilateral hands, chest, feet. Color of the papules was reddish with blackish discoloration. Margins were round. On palpation, the surface was smooth. Temperature was warm. There was no tenderness, and borders were elevated. The treatment was given as follows. First of all, Deepan Pachan was done for 5 days in the with Musta Churna in the dose 5 gram twice before food. After that, Anupan Panchtiktakwat. It was given for 5 days, and after 5 days, there was slight relief in constipation and appetite was improved. After Deepan Pachana, Snehapan was started with Goghrita in the dose 30 ml, 60 ml, 90 ml, 110 ml, and 140 ml. Anupan Ushna Jala. It was given until Samyak Snigdha Lakshan were found. After that, there was slight relief in burning sensation and passing of flatus. After that, Sarvanga Abhyanga and mild Nadi Swadan was given. Abhyanga was done with Balatil. It was done for 4 days, that is during the Vishram Kal of Virechan Karma. Then on the day of Virechana, it was given with Avipatti Churna 30 grams with Patol Katu Rohinadi Kashai, Anupan Ushna Jala. And after Virechana, there five. As per Virechan Vegas were 15. After the Virechan Karma and the Sansarjan Kram, Raktamokshan was done. 20 to 30 ml blood was drawn out in each sitting. Such 2 sittings were done with a period gap of 7 days between each sitting. After Raktamokshana, there was marked relief in discoloration over hands, chest, and feet, and also marked relief in papules over the face and chest. After Raktamokshan sittings were done, patient was discharged, and patient was given Nitya Virechan with Patol Kotuk Rohini Adi Kashai in the dose 10 ml twice a day before food with lukewarm water for 14 days. And after the follow-up, the patient was seen once again, then there was marked improvement in all above symptoms. The overall effect which was seen after the follow-up is mentioned as follows. In the papules over the face were present before the treatment and they were absent after the treatment. Blisters over the bilateral hands and chest and feet were also absent after the treatment. Discoloration, there was marked improvement in it. Burning sensation all over the body, it was absent after the treatment. Constipation, It was present in the form once per day but not satisfactory. But after treatment, it was once in a day and satisfactory. There was also associated heaviness in abdomen, which was absent after the treatment. These are the pictures of before and after treatment. See the blisters over the arm, and discoloration was also gone and blisters were also gone after treatment. Yes. And Tikta Rasa Pradhan. The Karma, Dipan Pachana, Rochana, and Ampachana. It mainly affects on Pitta Kapha Shamana. Then Gogrut. Gogrut is Sheet Viryatmak, Madhur Rasa Pradhan, Snigdha Mrudu, Shlakshna, and Guru. Its karma is Daha Shamaka, Swara Varna Prasadana. And it mainly acts on Vata Pitta Shamana, Agni Deepana. It is good for Rasa, Shukra, and Ojasa. Then Avipatti Churna. It is Lagu Rusha and Anushna. Karma is Ridya, Rechaka, and Visha Shamaka. It is Tridosh Shamak, but mainly Pitta Shamaka. Patol Katurohini Adi Kashai. It includes Patola, Katurohini, Guduchi, Chandana, Madhusrava, and Patha. This combination mainly is Tikta Rasa, Lagu Gunatmaka, and Anushna. Its karma is Rakta Prasadaka, Pedana, Visha Shamaka, and Pandu Kamala Nashana. It is given in the Ashtang Hruday 15 Sutrastan 15 chapter. Its effect is mainly Tridosha Shamana, mainly Pitta Kapha Shamaka. Discussion. To start with Deepana Pachana, in this case, the patient was of Pitta Prakruti and Sukumara. So I preferred Musta Churna along with Panchatikta Kvata for Deepan Pachan. Both the drugs, due to its sheath virya, pacify the burning sensation, and Deepan Pachan properties also cures the constipation and heaviness of abdomen. After Deepan Pachana, Shodhanartha Snehapan with Gogrut was done. As it has Shita Virya, Snigdha Guna, and Madhur Vipaka, it helps in relieving the burning sensation. It also Shodhanartha Snehapan be by Virechana Karma. In Virechana, Pitta Virechan was done. No, previous slide, please. In Virechana, Pitta Virechan was done and also Kapha Shaman and Vadanuloman occurred. As the disease was Kapha Pitta Pradhana, there was complete relief in burning sensation all over the body. Through Virechan Karma, patient was supposed to bring Madhyam Shuddhi, so she got 15 Vega. So all the doshas could not be removed. Next slide. After after that Rakta Mokshan was done, there was it shows it causes the Shodhana of Rakta and the elevated discoloration and papules. Rakta Mokshan is followed by Nitya Virechana with Katuka Rohinyadi Kashai, which causes the daily basis Shodhana of the remaining vitiated Pitta. Thus, it helps in detoxifying the Rakta, resulting in marked improvement in all the symptoms. So, Dipan Pachana, Snehapan, Virechan, and Raktamokshan and Nitya Virechan with Patol Katukarohi Nadi Kashai as a whole showed complete relief in papules, burning sensation all over the body, and heaviness in abdomen and constipation. So, after that, the patient was advised to take Manjishtadi Kwatha for remaining patches, and diet was advised as per the Kushta Roga Nidana. Thank you.
Thank you, Dr. Srishti. Thank you for the very detailed, insightful presentation. Thank you so much, Doctor.
Thank you, sir.
Next is a paper presentation. I would like to invite Dr. Hina Kayar for the paper presentation on the topic Paduka Visha.
Good evening, all. Today, I'm going to present about Patakavisha. In this presentation, I'm going to discuss about the Ayurvedic aspect of Patakavisha and then modern aspect as contact dermatitis and footwear contact dermatitis, differential diagnosis and treatment. Then, footwear dermatitis is a very common diagnostic and therapeutic challenge in dermatological practice of India. The reported prevalence of footwear dermatitis in worldwide ranges from 0.2 to 24.2 percentage, and in India, it's about 11.7 percentage. The prevalence and incidence rates are increasing annually, which is emphasizing the need for accurate diagnosis and effective management to ensure complete recovery. From an Ayurvedic perspective, footwear contact dermatitis can be correlated with the Padukavisha. So Padukavisha or footwear is one among the Garadhisthana, which is explained in Ayurveda in Agata Tantra. The Garadhishthanas are the possible modes through which Garavisha can enter the body. And according to Acharya Shradha in Kalpasthana, he explained the Garadhishthanas as Anne Pani Dantakashte Tada Pinge Avalekane Utsadane Kashayecha Parikshege Anulepane Strastru Vastreshu Shayyasu Kavachaparaneshusha cha then Paduka Padapedeshu Krishteshu Gajavachinam. This Paduka we are going to explain today. Then Padakavisha, the symptoms of poison footwear, as explained by Acharya Sustruda and also Acharya Sharaka. According to Acharya Sustruda, the symptoms are Shofa, Shrava, Swapa, and Spoda, which is common for Paduka, Padapeda, Ubhadanath, and all. Then according to Charaka, the symptoms are Karacharanadaham, Todam, Clamam, and Avipaka, which is seen in case of poisoning by earth, shoe, elephant, horse, bed, and seat. It is a picture of such case. All symptoms are present here. Then it is a reference from Kerala Chikitsa Kriya Kaumudi. The same symptoms explained by Acharya Sustrata is also mentioned here. Neeru Padathil Vandidum, swelling will be there. Pindaputti Ulichidum, exudation will be there. Pulagangal Purapedam, then blisters will be there. It is seen in Kundum Matumundaki, Tuladai Chirupilum, Padapedathilum Petal, Undaumi Vepkim. Then here the treatment is mentioned as Vishabhyanga Pradikriya. Abhyanga Visha treatment should be adopted here. Then Paduka Visha can be clinically correlated with contact dermatitis of foot, which is also known as footwear contact dermatitis or shoe contact dermatitis. With more specification, we can call this as allergic contact dermatitis of foot. Then coming to what is contact dermatitis. Contact dermatitis is a skin condition resulting from direct contact with irritants or allergens. It causes inflammation, redness, and itching. Footwear dermatitis or contact dermatitis of foot is defined as dermatitis on the feet caused by any footwear consisting of multiple different materials. Contact dermatitis may be due to allergic or irritant dermatitis. The causes of shoe contact dermatitis or the risk factors which increases the cases are heat, friction, occlusion, sweat, atopy, or allergy. The allergy may be due to material itself, such as leather or rubber, or may be due to other constituents such as adhesive, decoration, sprays, insole, and other products applied to the shoes. There's a list of common allergens. Potassium dichromate, cobalt chloride, all those things are considered as common allergens. And the features, the clinical features we see in case of contact dermatitis of foot is typically symmetrical rash with volar or dorsal aspect of the feet is affected. The toe, flexural creases, and instep often being spared. The allergy can be developed after an exposure to long period exposure or can suddenly become allergic to a substance after months or years of exposure. The symptoms, which is very similar, which is explained in our Ayurveda Shastras, that is swelling, redness, blisters or cracks in the skin, burning, itching or pain will be there. And the diagnostic tools, which is the main one is clinical history. Take the appropriate history of the patient and then physical examination. Examine for the features and symptoms and patch test. Patch test is a method used to determine whether a specific substance causes allergic inflammation or skin. There will be a patch like sticker will be there and which is patched on the skin after 48 hours. Remove the patch, search for any allergic reactions. If allergic reactions is present, that shows a positive test. Patients with contact dermatitis are re-exposed to the suspected allergens under controlled condition to confirm the diagnosis, which is happening in this patch test. And the differential diagnosis in modern, it is atopic dermatitis, hyperkeratotoxic eczema, psoriasis, fungal infection, bacterial infection, and lichen planus. Coming to Ayurveda part, Vipathiga and Alasa, one of the Shudra Kushta, we can consider in case of differential diagnosis. And the treatment, which is explained in modern is avoiding the triggers, identify and avoid shoe, which is made up of materials or containing substances, trigger an allergic or irritative reaction, change the footwear habits, and the topical treatment, which contain hydrocortisone creams or ointments, and antibiotics or antifungals are given in case of suspected infection. Regular moisturizing is needed, and maintain the food hygiene is also important. The treatment in Ayurveda, which is similar to Abhyanga Vishapradikriya, which is mentioned for the treatment as Pataka, Upadana, Padapeda, Aparana, and all. Then the treatment is Tatra Shitambu Siktasya, Kartavyamanulepanam, Shantaram Tagaram Kushtam, Ushiram Venupatrika, Somavalli Amrita Shveta, Padma Kaliyakam Tujam, Kapittarasa Mutrapyam, Panamita Srivichari, pouring cold water on the body and applying paste of Shantana drugs containing Shantana Tagara and etc. The drinking water processed with these drugs is also recommended. The same is explained in Kerala Vishajilsa also. Then the commonly given Agata Yoga. In OPD and IPD basis, we are commonly giving the Agata Yogas like Fodhara, Nalpamradi Churnam and Katramachadi Churnam in Paitika conditions, Arangodadi Churnam in Kabacha conditions, Tribala Churnam in Kevalavatika conditions, and internally Padala Katroniadi Kashayam, Nili Tulasiadi Kashayam, Dushivishari Gulika and Vilwadi Gulika can be given. And as a leba, Chandranadi leba, which is mentioned in Sustukalpasthana, also can be given. And then coming to the conclusion part, footwear dermatitis is often a misdiagnosed type of contact dermatitis caused with the contact of certain allergens in the footwear. It can be correlated to the condition Paduka explained in Ayurveda. The mainstay treatment involves avoidance of footwear in modern medicine, application of topical creams or the lesions. Ayurveda not only advocates avoidance, but also offers a well-established treatment for Paduka enabling individuals to restore the skin health and boost immunity. And thank you. Thank you for giving me an opportunity to present. Thank you all.
Thank you, Dr. Hina, for the well-explained presentation. We know that wound healing is not just a biological process. In Ayurveda, it is an art rooted in centuries of wisdom, combining herbs, techniques, and traditional care. Next, we have Dr. Priya with a review of wound healing formulation in the Ayurvedic system of medication. I would like to invite Dr. Priya for the presentation.
Myself, Vaidya Panduranga Vevhare. I'm a PG second year student of Shalyatantra. Institute name is Ashwin Rural Ayurved College and Hospital Manchihil, Sangamner. My guide name is Vaidya Matin Sheikh sir. My paper presentation topic is Review of Wound Healing Formulation in Ayurvedic System of Medication. Abstract: most of the studies involve multiple formulation as comparative groups, while few studies attempted and evaluating efficacy of single formulation or single drug in the management of wounds. Some studies attempted on evaluating the impact of Panchakarma procedures on Dushtavrana. Some studies were carried out by using parasurgical procedures like Agnikarma and Kshatrakarma along with internal oral medication. The studies were found to be a combination of drug formulation, and the procedures mentioned under Shashti Upakrama, 60 measures for wound healing by Acharya Sushruta. The aim of the management of wound was the removal of contaminated, devitalized tissue or necrosed tissue and foreign bodies to achieve adequate hemostasis and apposition of the wound to prevent infection and complication to initiative early healing. It was observed that the use of the leper, avachurnan, and parasurgical procedures, raktamokshana such as Jalaukavacharan, and a few other procedures like Shalana reported positive outcome in wound healing. Some of the studies were intended on Agnikarma and Kshatrakarma in Dushtavrana with encouraging results. Introduction: Vrana is a huge topic which described in many chapters of Sushruta Samhita. Detail about the Vrana from its pre-stage Vranashota to the management Shashti Upakrama is mentioned in Sushruta Samhita. Sushruta has explained Shashti Upakrama, 60 initiative in management of various types of Vrana. This includes procedures for internal purification of body as well as various formulations for Vrana Shodhana, that is cleansing of wound, and Vranaropana, wound healing. Vaikartapahan is one among these 60 procedures mentioned for scar reduction, which is peculiarity of wound management in Ayurveda. Further, while describing the type of wound, he mentioned the term Dushtavrana, which occurred due to the involvement of internal doshas or improper treatment of Agantuzavrana may turn into Dushtavrana. This chapter is a comprehensive review of wound management in Ayurveda and will prove a ready reckoner for researchers who are working in field of wound healing. Material and methods. Material and methods are from classical textbook of Ayurveda like सुश्रुत संहिता, चरक संहिता, अष्टांग संग्रह, अष्टांग हृदय, माधव निधान, शारंगधर संहिता, भाव प्रकाश, योग रत्नाकर, and Harita Samhita were studied. Online database like Google, PubMed, ResearchGate, etc. were searched. The keywords searched were wound management and wound healing, and wound care, etc. Compound formulation used in wound healing. स्वरस, घृत, धूपनयोग, क्षार, मलहर, चूर्ण, तैल, रसक्रिया, लेप, अर्क, वटी, क्षीर, पंचकर्म, parasurgical procedure. Conclusion: a suitable drug list of or drug formulation for the management of Vrana would stand against the commonly used medication. This review has considered many classes of drug or drug formulations, dealt with many research work undergone in different research institute of India. It is significant to note that each Ayurvedic formulation or single compound has its own mechanism of action that individually stimulate wound healing. In the era of globalization and evidence-based medicine, the systematic documentation of such information by compiling the studies from different parts of the country will benefit the researcher for further critical analysis and to design new studies. This review suggests that wound healing using Ayurvedic drugs and procedures are safely in different doses form. The systematic review also create a concentrated platform for future researchers and Ayurvedic practitioners where unpublished trials are easily available with regards to Ayurvedic wound healing treatment. This is all about review of wound healing formulation in Ayurvedic system of medication. Thank you.
Thank you, doctor. One more poster presentation is there. I would like to invite Dr. Priya for the poster presentation on the topic urolithiasis.
Hello everyone, myself Vaidya Priya Panduranga Vevhare. I'm PG second year student of Shalyatantra. Institute name is Ashwin Rural Ayurvedic College and Hospital, Sangamner. My guide name is Vaidya Mateen Sheikh sir. My poster presentation topic is urolithiasis. Urolithiasis is one of the most common urological disease worldwide that affects approximately 12 to 15% of the Indian population. Males are 2 to 3 times more commonly affected than females. Peak incidence occur between 30 to 50 years of age. Most commonly, calcium oxalate stones are found, but women are at higher risk of infection stones, that is true white stone, due to recurrent UTIs. Urban areas show higher incidence due to a diet rich in processed food, sedentary lifestyle, and metabolic diseases. Rural populations still face risk primarily from dehydration, untreated UTIs, and high oxalate-rich diet. 50% recurrence within 5 to 10 years after the first episode, and 72 to 80% recurrence within 20 years. Accounts for 15 to 20% of all urological admissions in India. High costs are associated with surgical intervention like ureteroscopy and PCNL. Types of kidney stone: calcium stones, that is calcium oxalate and calcium phosphate, struvite stone, uric acid stone, cystine stone. Percentage of kidney stone types: calcium stone 80%, mostly calcium oxalate or calcium phosphate. Struvite stone 10 to 15%, uric acid stone 5 to 10%, and cystine stones are less than 1%. Types of Ashmari according to Ayurveda: Kafaj, Vataj, Pittaj, Shukraj. Samprapti of urolithiasis: आहारज and वियारज निदान, अग्निमाद्य, कफप्रधान त्रिदोष दृष्टि, कफप्रधान त्रिदोष enters मूत्रवह स्रोतस, दोष दुष्य samurchana, and vata dries of kapha and pitta present in mutra, which forms urolithiasis. Ahara, pathya and apathya. Ahar pathya: यव, पुराणशाली, आंध्ररस, पुराण कुष्मांड, लता, गोखरू, वरुणस, साग, पाषाणभेद, यवक्षार, शालपर्णी. अपत्य: आम्ल, विष्टंबिहार, वृक्ष, गुरु अन्नपान, विरुद्ध अन्नपान सेवन. चिकित्सा: चिकित्सा अकॉर्डिंग टू आयुर्वेद: शमन चिकित्सा, शोधन, क्षार कर्म, विद्ध कर्म, diet and lifestyle. According to modern, which includes analgesic, non-steroidal anti-inflammatory drugs, antispasmodic, hydrotherapy, and some surgical intervention. In conservative management includes hydration, pain relief, dietary changes, medical therapy like alkalization of urine, citrate therapy, surgical intervention like ureteroscopy, PCNL, that is percutaneous nephrolithotomy, for large kidney stone, prevention, adequate hydration, balanced diet, and treatment of metabolic disorders. Thank you.
Thank you, Dr. Priya, for the insightful paper and poster presentation. Next is another paper presentation. I would like to invite Dr. Niduja Sanjay Dave for the paper presentation on the topic related to Shatkriya Kala. Dr. Niduja, are you there?
Good evening, respected chairperson, esteemed faculty members, and my dear colleagues. I am Dr. Nituja Ithape, PG scholar from Department of Rog Nidan and Vikruti Vigyan from CRC College, Nigadi, Pune. Today, I will be presenting on the topic Understanding Lifestyle Disorders through the lens of Shatkriya Kala. This presentation aims to bridge classical Ayurvedic concept with modern understanding of the disease progression, particularly in relation to lifestyle disorder, which are rapidly increasing in prevalence. Introduction. Lifestyle disorders or non-communicable diseases have become a major global health challenge. Conditions such as diabetes, hypertension, obesity, and cardiovascular diseases are on the rise due to sedentary habits, unhealthy diets, and stress. Ayurveda offers a unique perspective on disease development through the concept of Shatkriya Kala, the 6 stages of pathogenesis, which can be applied to understand and manage this disorder effectively. Today, we will explore how this ancient framework can guide preventive and therapeutic strategies. The objective of these studies are first to understand the concept of Shatkriya Kala as described in Ayurveda classic textbooks, to correlate the 6 stages within the onset and the progression of the modern lifestyle disorder. Third, to emphasize the importance of early detection and intervention in preventing the full blown manifestation of diseases. Through this, we aim to show that Ayurveda's preventive approach remain highly relevant in today's healthcare system. Now let us study the Shatkriya Kala. The term Shatkriya Kala literally means the 6 opportunity for intervention. As described by Acharya Shushruta, it represents the 6 stages of disease development, starting from the accumulation of dosha to the manifestation of disease specific symptoms. The stages are first Sanchaya, which is accumulation. Second is prakopa, aggravation, prasar, spread of disease, sthana samshraya, localization. Fifth is vyakti, manifestation of the disease. And sixth is bheda, which is complication or differentiation. Understanding these stages helps a physician identify disease processes early and apply preventive measures at the appropriate stage. Now let us study each stage of Shatkriya Kala. First is Sanchaya. Sanchaya or accumulation is the initial stage where doshas begin to collect in their own sites without causing over symptoms. In lifestyle disorder, this may correspond to the subtle changes. For example, mild weight gain due to the lack of exercise or slightly elevated blood sugar level without crossing the diagnostic threshold. If detected here, lifestyle modifications such as dietary adjustment and regular physical activities can completely reverse the trend. Second, Prakop. Prakop means aggravation. Occur when accumulated dosha become excessive and begin to disturb normal physiology. In modern terms, this could be prediabetes, borderline hypertension, or early fatty liver changes. Symptoms are still reversible at this stage if interventions are strong and timely included panchakarma procedure, detoxification therapies, and focused lifestyle counseling. Third, prasara. Prasara refers to the spread of vitiated doshas beyond their original site into the circulation, affecting other tissue and system. Clinically, we might see early systemic effects such as insulin resistance impacting multiple organ system or dyslipidemia, affecting vascular health. At this stage, without corrective measure, the disease process gains a momentum. Fourth, Sthana Sanshraya. Sthana Sanshraya is the stage where the vitiated dosha localize in specific tissue or organ, interacting with defective dhatus, leading to the formation of dosha dusha samurchana. This stage often presents with a vague prodromal symptoms. For example, tingling in the extremities in pre-diabetic neuropathy or early stiffness in joints in lifestyle-related arthritis. Ayurveda emphasizes that intervention here can prevent the disease from fully manifestation. Fifth stage is Vyakti. Vyakti marks the clear manifestation of the disease. At this point, allowing the definitive diagnosis, such as type 2 diabetes, hypertension, or obesity. Although treatment at this stage is still possible, complete reversible becomes more challenging. The goal shifts to disease management, control, and prevention of the complication. And the last stage, Bheda. Bhed is a final stage where complications develop and disease differentiate into various subtypes. For example, uncontrolled diabetes processing to retinopathy or neuropathy or cardiovascular complication. Management here focus on preventing further deterioration and improving quality of life. This stage serves as a reminder of the cost of delayed intervention. Here we have a comparative chart mapping Shatkriyakal stages with pathophysiological progression of type 2 diabetes mellitus through the lens of Shatkriyakal. This correlation not only strengthens the scientific basis of Ayurvedic concept but also provides a particular tool for integrated medical approaches. Ayurveda emphasizes Nidan Parivarjana, that is, avoidance of causative factors, as the foremost preventive strategy. Along with this, Dinacharya, Ritucharya, appropriate ahar, and regular exercise form the foundation. Early stage interventions may include Shodhan therapies, Rasayan, and counseling. The integration of the modern diagnostic tool with Ayurvedic perspective strategize can provide a comprehensive patient-centered approach to lifestyle disorder management. In conclusion, Shatkriya Kal offers a timeless framework for understanding disease progression. Applying this knowledge to lifestyle disorder allows for early detection, effective prevention, and better patient outcome. As physicians, our focus should be on catching disease progression at the earliest possible stage, where complete reversal is achievable. Thank you everyone for peaceful listening, and also to the organizing committee for giving me this opportunity to present. Thank you once again.
Thank you, Dr. Nidhuja, for the paper presentation. Next, I would like to invite Dr. Sunil Adi for the paper presentation on the topic role of Panchakarma in the management of infertility. I would like to invite Dr. Sunil for the presentation.
Good evening everyone. I am Dr. Sunil Ade, MD Scholar, Department of Rog Nidan एवं विकृति विज्ञान, PDAS College of Ayurveda and Research Center, Nigdi, Pune. My guide is Dr. Ragini R. Patil ma'am. Ma'am is college principal, HOD and professor of our department. My topic is role of Panchakarma in the management of infertility and Ayurvedic perspective. Abstract. Infertility affects a significant portion of reproductive age individual globally. Ayurveda, through the Panchakarma therapy system, offers a holistic and individualized approach targeting the root causes of infertility. This paper explored how Panchakarma procedure, particularly Basti, Uttar Basti, play a vital role in detoxification, dosic balance, and revitalization of reproductive tissue. A review of classical references, modern studies, and clinical cases highlight the relevance and efficacy of Panchakarma in managing both male and female infertility. Introduction. Infertility is defined as the inability to conceive after 1 year of regular unprotected intercourse. Modern causes include ovulatory dysfunction, tubal factor, low sperm count, idiopathic reasons. In Ayurveda, this condition is referred to as a Vandetva, and it is attributed to imbalance in Vata, Pitta, and Kapha doshas, Artha Dushti, Shukra Dushti, and Agnimandya. Panchakarma, the detoxification and purification branch of Ayurveda, aim to remove accumulated doshas and toxins, enhancing reproductive function. Its role in its role in infertility management, grounded in Ayurvedic texts and supported by clinical evidence. Methodology. This paper follows a qualitative review methodology comprising clinical literature review, Charak Samhita, Shushruta Samhita, Ashtang Hridaya for theoretical basis, analysis of dosha involvement and Shodhan Chikitsa for Vandetva, clinical practice guidelines, Ayurvedic, protocol for Purva Karma, Pradhan Karma and Pachat Karma, Panchakarma techniques, Virechan, Basti, Uttar Basti and Nasya, research and clinical studies, selection of published studies from Ayurvedic journals, case reports and clinical trials involving Panchakarma procedure in infant results, therapeutical finding and clinical outcomes. Therapeutical finding, Panchakarma helps eliminate ama, balances three doshas and revitalize Shukra Attarodushti. Basti is the most effective in managing Vataj Vandetva. Uttar Basti directly act on reproductive tract, improves ovulation, endometrial thickness, and tubal potency. Clinical outcome from literature. A 2018 study on Satavari Tel Uttar Basti shows 70% ovulation rate and 40% conception rate in women with ovulatory cycle. A study using Shirabasti in male improves sperm count and motility significantly. Virechan and Nasya also shows benefits in cases with associated Pitta and Kapha disorders. Discussion treats root causes holistically. Mechanism, Shodhan removes toxins, Basti nourishes uterus and Uttar Basti also target uterus. Advantages, natural, safe, integrate with ART as a assisted reproductive technique. Challenges, require compliance, skill exclusion, more randomized control trials needed. Conclusion, Panchakarma offers effective infertility treatment. Basti and Uttar Basti shows significant results, supports root causes based holistic healing, need more standardization and clinical evidence. References, Charak Samhita, Chikitsa Sthan, Sushrut Samhita, Shari Sthan, Ashtang Hridaya, Sutra Sthan, WHO guideline on infertility 2021. Thank you.
Thank you, doctor. Thank you for the paper presentation. Next, I would like to invite Dr. Ganesh Babruan Patil for the paper presentation. I would like to invite Dr. Ganesh Babruan Patil.
Good morning, everyone. Myself, Dr. Ganesh Patil, PG second year student of Komar Bharati Department from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today I am going to present a paper on the breastfeeding, the foundation of infant nutrition and the maternal well-being. In introduction, I am going to share you that breastfeeding is the natural process of feeding an infant or young child with milk directly from the mother's breast milk, which is considered as the best nutrition for a child. Breastfeeding is the most important part of the newborn development as it provides nutrition to the infant and maintains the balanced nutrition cycle.
Thank you, doctor. One more poster presentation is there.
Good morning, everyone. Myself, Dr. Ganesh Patil, PG second year student of Comar Department of the Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today I am going to present a poster on the topic of hepatitis. Hepatitis is nothing but the infection of the lung, which is caused by various infective agents, including there are five types of the hepatitis. Here, type A, B, C, D, and E, of which hepatitis A is the most common type of the hepatitis. We will get to know the transmission of the hepatitis B, of which the first is the perinatal transmission, which transmit from the mother to child during the childbirth, which is the most common cause of the hepatitis B in the endemic era. And also, it is transmitted through the infected needle or the sharp objects directly to the body. Other one includes the sexually transmission. Let's that is exchanging the each other's body fluids with the patient, or which includes the exchange of the pathogens too. Includes unprotected sex, multiple partners, and other mode of transmission include transfusion of the infected blood and the blood products. Now we will see the clinico-pathological syndromes of the viral hepatitis. Includes acute and the chronic, of which acute include the acute symptomatic, acute asymptomatic, and the fulminant hepatitis. Of which acute asymptomatic includes the infection without recovery, and acute symptomatic includes infection with recovery. Fulminant hepatitis is fast and furious, with sudden and severe liver failure causing. Chronic hepatitis. Chronic hepatitis causes the one is the liver cirrhosis. Being the dysfunctional is so sad, but what is killing me are these ugly nodules of the hepatitis, causing the hepatocellular damage. Other is then the patient might be a carrier which transmit the pathogen to the someone else. And the last stage causing the cancer that causes the hepatocellular carcinoma, where the liver is almost dead. In the hepatocellular carcinoma, there are many risk factors, including the hepatitis B infection. Other one is the hepatitis C infection. And the most common type is the liver cirrhosis, which is caused by the chronic inflammation. Other includes the consumption of the alcohol and Wilson disease, other and hematochromatosis and aflatoxins, metabolic syndrome, obesities. These are the risk factors for the carcinoma that is caused by the hepatocellular damage. According to the WHO, 2018, the chronic HCV infections include the baby boomers includes 36.3, then Generation X causing 23.1%, and millennials causing 36.5%. Others included 4.1%. It is minimal.
Thank you, doctor. Thank you for the paper and poster presentation. Next, I would like to invite Dr. Komal Shankarrao Nichal for the paper presentation.
Namaskar everyone. Today I am going to present my topic entitled as Ayurveda Approach for Understanding Tuberculosis under the guidance of Professor A.S. Baghel sir and Swati Khandale ma'am. Introduction. Rajeshma is a group of disease caused by the imbalance of Tridosha and with the symptoms that manifest as a collective condition known as Vyadhi. The etiopathogenesis of Rajeshma involves both Anulom and Pratilom Gati. Rajeshma predominantly impacts the respiratory system and meninges, although it can affect other parts of the body as well. The present study focuses on its respiratory manifestation. Key symptoms of Rajeshma include jwar, kas, shwash, and parshvakshul. Rajeshma is primarily attributed to the Dhatva Manda and Dhatukshay. In addition, there is a Rasa, Rakta, Mans, Med, and Shukra in Kshaya Avastha. It is classified as a Upasargic Vyadhi. The condition also has a several predisposing factor refers to as a Chaturveda Nidana. Shosh is manifested as Madhyam Rog Marga Vyadhi. Vikaranam Kushala Nahi Jiyata Kadachanam Nahi Sarva Vikaranam Namato Asti Dhruva Sthiti. Current status. The prevalence rate of tuberculosis in India in 2024 is approximately 179 cases per lakh population. Key factor contributing to the recurrence, previous treatment, drug resistance, malnutrition, and socio-economic factor because of the poor nutrient, poverty, and other socio-economic factor can contribute to the recurrence of TB. Hence, tuberculosis possessing major challenge and need to understand it in terms of the Ayurvedic principle. Aim and objective to study the Samprapti of tuberculosis through Ayurvedic point of view. Material and method, classical Ayurvedic texts and contemporary literature were reviewed. Total number of articles reviewed 10 in context to tuberculosis in Ayurveda perspective from various online platforms like Google Scholar, PubMed, IUCare and other national research database. Discussion. In Ayurveda, we can consider pathologies in the following way. Sandharan and Vishamashan. Sandharan, that is separation of the natural urges like Vat, Mutra and Prisha, and Vishamashan, also arm produced due to the Samashan and Adheshan, which may cause the Marutadi Prakop, that lead to the Rasadi Srutas Dushti due to the Nidan Sevan, that lead to the Srutavarot, that is obstruction of the channel, causing the Dhatva Mandya, that lead to the Rasadi Dhatu Anulom Gatikshay, like Rasa, Rakta, Mans, Med, Astim, Shukra, that causes the Rajakshma. That this Samprapti is according to the Anulom Gati. Now Pratilom Gati. Because of the Sahasajanya and Kshayajanya. Sahasajanya Nidan like Atilangan, Atiplavan, Abhighat, Ayathavala Marambha, more physical exertion beyond the working capacity that cause the Vata Ruddhi, which lead to the Dosha Udirana due to the Yogavahi Guna of a Maruta. And Kshayajanya Nidan like Mansik Nidan, Irsha, Krodh, Shok, Bhay, etc. and Sharirik Nidan like Ati Karshan, Ati Vebhar, Anashan that cause the Shukrakshay and Ujakshay that lead to the Snehakshay. Because of that, Vatruddhi, which lead to the Dosha Udiran due to the Yogvai Guna of Maruta, leading to the Rasadhatukshay in Pratilom Gati that cause the Rajakshma. Sthana Sanshaya of dosha and dosha involvement in Rajeshma according to the Ayurvedic perspective. If Sthan Sanshaya of dosh occur in the Kanto or Galashrit, dosh involvement, Vatadi Tridosh, Lakshan is a Swarabhet, Kas, Kanta Udvansa that we can correlate it with the tuberculosis like cough and phlegm. If Sthan Sanshaya occur in the Ur, dosh involvement is Kapha and Vata. Lakshana is a Shananada Urasya Kasada, Kapashtivate sa Shoditam, Chardara Rudirasya cha, that is hemoptysis. Cough, blood appear in the cough. If Sthanasenshu occur in the Sarvakshari and Sandhi, dosh involvement is Vitta Pradhan Tridosh, Sarvanga Jvara, Ansa Pashvabhitapa, Karapada Santapa. This is a three root of the Raja Ikshma that we can correlate it with a fever, night sweating. If Sthanasenshu occur in a Sarvashari, dosh involvement is Vatadi Tridosh, Lakshana is a Balamansa Pariksha. We can correlate it with as severe weight loss, fatigue, malaise. If Sthanasenshu occur in the Guda, Vatadi Tridosh involvement, Varchava with Atisar. If Sthanasenshu occur in the Parva and Uraha, Vatadi dosh predominance, Parshvashul, Urakshul, we can correlate it with as a chest pain. If Sanshenshu occur in Jiva, Hruday, Kantha, Mansa, Vatadi Tridosh involvement, Arochak is a Lakshan and we can correlate it with it as a loss of appetite. If it occur in the Kshir, Shirshul, that is headache, and if Sanshenshu occur in the Ur, Lakshan is a Shwash, that is shortness of breathing. The comparison of Lakshana of Shlekshmashkrumi with the symptoms of tuberculosis. These are the some Lakshana of the Shlekshmashkrumi that we can correlate it with as a tuberculosis, Rullas, nausea and vomiting, Asavairasya, excessive salivation, Arochak avipak, anorexia, jwar, fever, Jumba yawning, Shavatu sneezing, Angamarda body ache or pain in the limbs, Karsha, severe weight loss. We can see all these symptoms in the tuberculosis. Conclusion. Tuberculosis is a clinical syndrome resulting in generalized weakness in body due to the infection of Mycobacterium tuberculosis. As per Ayurvedic principle, tuberculosis occurs due to the dhatu kshay as anulom and pratilom gati along with the vata pradhan tidosh. Here the dhatu becomes diminished and the sangas throtas along with the vimargagamanam of dosha result in the impairment of dhatu function. These lead to the symptoms seen in tuberculosis, which include both physical and mental symptoms. It can be also correlated with the rasa kshayajanya vikar and shwash gas vadhi. Specifically, Shatakshin mentioned in Ayurveda can be correlated with the complicated stage of the pulmonary tuberculosis. According to the Yukti Praman, it can be correlated with the Shlekshmashkrumi mentioned in the classics due to the similarities in the Nidana, Lakshanas of the Shlekshmashkrumi and Vishamashajanya Rajakshma. It can also be correlated with the Ojakshay in the last stage of the tuberculosis. Here are some references. Thank you.
Thank you, Dr. Komal, for the well explained paper presentation. Next, we go to the review study. I would like to invite Dr. Archana Agrawal for the paper presentation.
Namaste everyone, myself Archana Agrawal. Here I am going to present my topic concept of Ojas, Ojakshay and diabetes mellitus, a review study. Introduction. Tatra rasadinang shukrantanang dhatunang yat param tejah tat khalu ojah tadeva valamiti uchyate swasastra siddhantat. Ojas is regarded as the ultimate and the most refined essence of the dhatus, that is the bodily tissues, and it plays a central role in maintaining vyadhikshamata, that is immunity. According to Ayurveda, the Sahaja Vala is associated with innate immunity and the Kalaja Vala aligns with acquired immunity. And Acharya Charak also recognized the Ojas as one of the Dosha Pranayatan. Ojas is often equated with Bal or Shlishma that is Kapha. It may also be understood as the dynamic radiant energy. Disorders like AIDS and diabetes often reflect diminished immunity, which can be interpreted in Ayurveda as Ojakshay. In conditions such as diabetes mellitus and malnutrition, where depletion of ojas is consistently observed, individuals become more vulnerable to various associated degenerative conditions and repeated infections. So, the role of ojas in sustaining overall health and promoting a state of positive well-being is a key factor in the prevention of diseases. In Ayurveda, Oja Vikruti is recognized as three types: Oja Vishransa, Oja Vyapat, and Oja Kshay. Oja Kshay refers to the deficiency of Oja or depletion of Oja, whether in terms of quantity, quality, or function, and is identified based on specific symptoms. Oja Kshay is mentioned in the pathogenesis of Madhumeha, that is the diabetes mellitus, that is why it is also referred to as Oja Meha or Kshudra Meha. Diabetes mellitus is a metabolic disorder with multiple causes characterized by elevated blood sugar levels resulting from impaired insulin secretion, action, or both. Currently, available treatments focus primarily on controlling blood glucose levels. However, they do not address the gradual decline in the patient's immunity. As a result, over time, individuals with diabetes often develop complications such as diabetic retinopathy, neuropathy, nephropathy, etc. Therefore, maintaining immunity, specifically addressing Ojakshay, is crucial for preventing these complications and ensuring more effective management of the disease. Aim and objective: to explore and analyze the Ayurvedic concepts of Ojas and Ojakshay and their correlation with the diabetes mellitus. Material and method. This study presents a review of various classical Ayurvedic texts. It gathers and compiles materials related to Oja, which are then analyzed and discussed to provide a comprehensive and in-depth understanding of the concepts of Oja and Ojakshay in relation to diabetes mellitus. Review of literature. At the first, formation of ojas, how ojas is formed. Then, according to Ayurveda, Brahmarehi phalapushpebhyu yatha sanchiyate madhu tatvat ojah swakarmabhyu gunaihi sanchiyate nuna. The formation of ojas can be best compared to the creation of honey. Just as bees gather the essence of countless flowers and fruits to produce and store honey in their hives, Ojas is the refined essence formed as the final product of numerous physiological processes within the body. Ojas is derived from all the dhatus. It is evident from the above explanation that from a etc. that Ojas emerges as the most refined byproduct following the metabolic transformation of the primary dhatus. According to Sharangadhara, Oja is the dhatu of Shukra, while Bhagavad describes it as a mal of Shukra dhatu. Its odor, ojas is described as having the fragrance of laja gandhi. According to Charak, it tastes like honey, primarily sweet or madhura rasa and slightly astringent or kasaya quality. Characteristic features of ojas. Ojas is described as somatvaka, snigdha, shukla, shita, sthira, sara, viviktam, mridu, and vitsna. Qualities of ojas. Acharya Charak describes 10 qualities of ojas, which resemble those of milk and ghee, but completely unlike the properties of madhya and visha. These qualities include Guru Shitang Rudush Lakshanam, Bahalang Madhuram Sthiram, Prasannam Pichilam Snigdham Ojo, Tasha Gunam Smutam. Types of ojas. First of all, para ojas. Acharya Charak states that the heart or the hridaya is the residence of para ojas, which is considered the supreme and most vital form of ojas. Its quantity is ashtabindu or the 8 drops. Para ojas is essential for sustaining life, and any reduction or depletion of it can lead to serious health illness and sudden death. upper oja. Second is the upper oja. Upper oja is also called as the Shleshmika ojas because it shares properties with Shleshma or the kapha is distributed throughout the body. It is Sarva Sharira Vyapi, similar to how ghee is uniformly mixed in milk or honey is found in within the flowers. According to Acharya Charak, the normal quantity of the oja is the Ardhanjali, that is the half a handful. A decrease in upper ojas leads to loss of bodily strength and the development of various illnesses. Functions. तत्र वलेन स्थिर उपचित मांसता सर्वचेष्टासु अप्रतिघातः स्वरवर्णप्रसादो कायानाम् आभ्यन्तराणां च कराणां नाम आत्मकार्यप्रतिपत्ति भवति. Sushruth mentions sthira upachita mansata, that is the well developed and musculature, sarva cheshta, all activities of the body, speech and mind functioning without any hindrance, apratighata, unobstructed flow of energy, allowing effortless physical tasks like lifting or carrying. This reflects the presence of bulk or the strain, swara varna prasada, clarity and pleasantness of voice and complexion. Bhyanam abhyantaranam cha karanam refers to the external and the internal organs or senses. Means in externally the karmendriyas are the motor organs and the internally buddhi indriyas or the mental faculties are our organ which is continuously work for the oja. Atmakarya patipatti, awareness and proper execution of one's inherent functions or the duties. Ojakshay Karan. There are many karans of the Ojakshay like Ati Vyayam, Anashan, Chinta, Pramitashan means the eating too little, Vata Atapa Sevan, Abhaya, Rukshapana, Prajagara, then excessive loss of vital bodily substances such as Kapha, Shonita, Shukra, Mala, Kala, Abhighata Karan, then the Kopa, Ati Vyayava, these are the Ojakshay Karan. Oja can become imbalanced or may undergo both quantitative and qualitative depletion as per Sushruth. Disturbances in Oja referred to as Oja Vikruti. These are going through three stages that these are Oja Vinsrangsha, Oja Vyapat, and finally the Oja Kshay. In this progression, the symptoms of Oja Vinsrangsha suggest the onset of functional decline, that is karma hani, while Oja Vyapat indicates the Oja Guna hani or the deterioration in the quality of the Oja, and Oja Kshay in final stage it reflects the reduction in the quantity of Oja, that is the Pramanata hani. Acharya Charak has also described the clinical features of the Oja Kshay. These three stages of Oja Vikruti can be observed across a range of conditions and diseases varying from mild to severe and from physical and mental exertion to both acute and chronic illnesses. Then the stages are following outlined as follows. Symptoms of Oja Vinsrangsha, that is the first stage. Symptoms are Sandhi Vishlesh, Katrasada, Doshachyavana, and the Kriya Sannirodha. And symptoms of the Ojas Vyapat, that is in the second stage, the symptoms are Stabdha Guru Katrata, Smata Shotha, Varna Veda, Glani, Tandra, Nidra. Symptoms of the Ojakshay, that is in the third stage, as per Sushruta Samhita, they are Murcha, Mansakshay, Moha, Pralapa, and Mrityu. Symptoms of Ojakshay, as per the Charak Samhita, Viviti, Durvalo, Avikshanam, Dhyate, Vyatitendriya, Dushchaya, Durmana, Ruksha, Pavikshamascha, Tatkshay. When the physiological functions of the doshas are disrupted, they become vitiated. As a result, the vata and the kapha imbalances and they increase in their quantity while pitta fails to perform its normal function effectively. This disruption leads to the vitiation of oja. Once oja is disturbed, it hampers the normal functioning of the body. Since oja shares similar properties with kapha, disorders involving the oja dushti tend to become chronic in nature. In madhumeha, there is both qualitative and quantitative depletion of the oja or the upper oja specifically. In Ayurveda, Madhumeha is classified as a type of Pataj Prameha, also known as Madhumeha is also called as Ojomeha or the Kshodra Meha. Kshodra is the synonym of the honey, characterized by the passage of the sweet and honey-like urine. This condition arises due to an excessive increase of kapha. because the oja depletion is there. Oja invert the kapha, it increases kapha, pitta, meda, and the mans often seen in individuals who consume heavy, oily foods, sour and salty tasted food, freshly harvested rice, and the rice wine in excess. It is also common in those who oversleep and the sedentary lifestyles, neglecting the physical and mental exercises, and avoid elimination therapies, that is the sultana therapies. This leads to obstruction of the bath's normal pathway, causing bath along with ojas to descend and accumulate in the basti, that is the urinary bladder, resulting in a persistent and difficult to treat disease known as the madhumeha or the diabetes mellitus. Then discussion. The human body is mainly made up of doshas, dhatus, and malas, just like a plant depends on its root or the moola for growth and survival. Along with this, ojas is a special and vital substance that supports the strength, structure, and function of all the dhatus. It is the first essence formed in the body and is key to physical, mental, and spiritual strength. In Ayurveda, ojas is seen as essential for the body's defense in diseases like diabetes and malnutrition, where ojas is often lost. People are more prone to other illnesses and infections. With rising health issues, it is important to fully understand the ojas, how it is described in Ayurveda, its role in diseases, how treatments affect it, and how boosting ojas can help. Studying with this can lead to better treatments and also help in preventing diseases by keeping the body strong and healthy. And lastly, conclusion. Ojas is regarded as the vital essence of all the seven dhatus, and if when present in adequate amounts, it ensures the good health, while its deficiency results in illness. In the development of diabetes mellitus, particularly in its complication, oja plays a significant or the crucial role. Therefore, treatment should focus not only controlling the blood glucose levels but also on enhancing the ojas. Prakrut ojas is crucial for maintaining the health and normal physiological functions of a healthy individual, while oja vikruti plays a significant role in the development of the disease. The body's immunity or the vyadhik shamatva ultimately depends on the state of ojas. Ayurvedic Rasayan therapies help a balanced Agni. That is, the Agni is our digestive or the metabolic fire, enhancing the formation of high quality dhatus by optimizing dhatu Agni functions, which in turn promotes the production of optimal levels of ojas, thereby restoring its balance. Thank you.
Thank you, Dr. Archana, for the well explained, wonderful presentation. Next, I would like to invite Dr. Shobhita is for the paper presentation. Dr. Shobhita, are you there?
Good evening, sir.
Good evening, Doctor. Please share the screen, Doctor.
Yes, sir. Sir, are you able to see my screen?
Yes, Doctor, your screen is visible. Please start the session, Doctor.
Thank you, sir. Good evening to everyone present here. Myself, Dr. Shobhita S. My presentation will be an overview on laparoscopic surgery with special reference to exploratory laparoscopy, guided by Dr. Vishwanath Sharma, sir. So it mainly consists of introduction, definition, important components of laparoscopic surgery, principles of laparoscopic surgery, requirements for laparoscopic surgery, advantages, disadvantages, exploratory laparoscopy, indications, contraindications, complication, discussion, and conclusion. So the introduction, where laparoscopic surgery is also known as a minimal invasive surgery or a keyhole surgery, is a modern surgical technique where operations are performed through small incisions instead of large incisions, like in traditional open surgery. It uses a laparoscope, a thin lighted tube with a camera, to provide a high definition view of the surgical area, allowing the surgeon to guide specialized instruments and perform the procedure with precision. Although the term minimally invasive surgery is recent, the history of its components is nearly years old. The
Just a
first
moment, Doctor.
laparoscopic.
Sorry for the inconvenience. Doctor, the
Yes, sir.
final thank you slide is visible, Doctor. The final slide only visible, Doctor.
Uh,
The current slide is not visible. The thank you slide has been visible. Okay, Doctor. Now move, Doctor. Please continue, Doctor.
Visible, sir?
Yes, sir. Yes, Doctor. Please continue.
So now introduction is visible?
Yes, Doctor, visible.
Okay, thank you, sir. The first laparoscopic cholecystectomy was done by Mew of German in 1985 and by Murat in the Lyon in 1987. The minimal invasive surgery has a number of advantages over open surgery. Then laparoscopic surgery, which is one among the minimal invasive surgery, it is therapeutic as well as diagnostic. The definition goes like in minimal invasive surgery is a modern surgical technology and surgical innovation that aims to accomplish surgical goals with minimal trauma. Then laparoscopic surgery is also called as a keyhole surgery, is modern surgical technique in which operations are performed by making a small incisions in the abdomen. A rigid laparoscope is introduced through a port into the peritoneal cavity. This is insufflated with carbon dioxide to produce pneumoperitoneum. Further ports are inserted to enable instruments access and they use for dissection. The important components of laparoscopic surgery, they are the equipments, insufflation machine, imaging system, laparoscopic instruments, that is instrumentations, then electrosurgical cautery system. And this is the main thing that we have to understand the principle of laparoscopic surgery, which can be said using a word known as I withdraws. Here, I stands for the insufflation, creating a space, a domain, and V is visualize anatomical landmarks or the tissues, and I stands for identify specific structures for the surgery, and T is the triangulate surgical tools to optimize efficiency for the proper access of the laparoscopic instruments for handling the tissues. And R comes retract, that is to manipulate and access the correct tissue plane. And O stands for operate, that is to do any type of anastomosis or to incise or excision. And S stands for seal or hemostasis. And this is the ultimate goal of any surgical intervention is the hemostasis. And next comes the requirements for laparoscopic surgery, which mainly consist of preparation for laparoscopic surgery, laparoscopic instruments, and laparoscopic technique. And the preparation for laparoscopic surgery mainly consists of the overall fitness of the patient and the proper history taking and the required examinations for the proper for the opted surgical intervention which has been taken. And next is nil per oral, then the prophylactic medications like the antibiotics, antacids, antiemetics, and whatever the preoperative medications that we go through. Then the catheterization. Here, catheterization is not for everyone. It depending on the patient condition, depending on the surgical intervention that we take, catheterization has been mentioned. And next is the informed consent, which plays a huge role in any surgical intervention. And next comes the laparoscopic instruments, which mainly consist of optical devices, equipments for creating the domain, then instruments for the access, operative instruments, energy sources, hemostasis, and other required instruments. In this image, you can see the first one is a telescope. Here you can see it's been mentioned as a light source input and the camera input. And in the image of B, you see a 0 degree, 30 degree, and 45 degree. To explain it in a gross way, these angles are very important for the proper visualization of the target structures which need to be operated. So these angles provide a proper visualization. For example, the mesh is being should be sutured in the abdominal wall. In the 0 degree laparoscope or the telescope, the visualization is poor. So the 30-degree angle or 45-degree angle will give a proper visualization of the abdominal wall where the mesh should be kept and sutured. So based on the condition, based on the requirement, the angulations are being used. Then comes the light source and the cable. Here the light source is a vital crucial role in the laparoscopic surgery. Has it is a known as a keyhole or a minimal invasive surgery, where the ports have been created through which the laparoscopes are inserted, and this light is what which gives the visualization of the field, the operative field. So the light where they use here is an high intensity LED or halogen or xenon bulb, which gives a even illumination of the operative field. And next comes the television monitor, which is the final connection of this optical device, where the visualization of these structures are being seen in the monitor. And next comes the insufflation, the insufflator mission, through which the carbon dioxide, which is being insufflated to create the domain, which is known as the pneumoperitoneum. And you see here is a Veress needle, and this is the first ever instrument which is being operator which is being used in this laparoscopic surgery, where 0.5 centimeters below the umbilicus, the Veress needle has been inserted to create this domain, to create this pneumoperitoneum. and this comes a trocar. These trocars are the pathways for these laparoscopic instruments to be inserted inside the abdominal cavity for the access or the manipulation of these organs or the structures which need to be manipulated, which need to be handled. So this trocars can be explained, or in this image, the upper one, where you see it is being labeled as outer sheath, pointed inner trocar. This is the one which helps in inserting to the abdominal cavity. Then the gas vent, the trumpet valve, and the hub of the inner trocar. Again, these functions are varied based on the condition, and then it is classified as 10 trocars, 5 trocars, and 2 and 3 is also been there, where they are used in case of pediatric laparoscopic surgery. And next comes the graspers, and here graspers, you can see a vivid range of graspers, and in which you will be seeing atraumatic grasper, traumatic grasper, fenestrated. Then the design of the grasper is based on the structure that has been held or manipulated, or the area which is being manipulated. So based on the requirements, based on the conditions, these vivid range of graspers are being used in the laparoscopic surgery. And this is one of the instrument, which is a Maryland dissector and the Caesars. And next comes the clip applicators. Again, it is used on the conditions, like when it is useful in stopping the bleeding during laparoscopic surgeries. And then comes the laparoscopic technique. The laparoscopic technique is usually done in head end position. That is, the head end of the table is to be lower to have an easier insertion of Veress needle and the scope. A transverse 0.5 centimeters incision should be made on the skin just below the umbilicus, where the Veress needle should be introduced through the incision after lifting the abdominal wall between thumb and the fingers. Pneumoperitoneum should be created using Veress needle through umbilical incision. Then carbon dioxide is commonly used to create pneumoperitoneum. Pneumoperitoneum is to be created up to a pressure of 15 Hg, which distends the abdominal cavity adequately to have a proper visualization of the abdominal contents. Then laparoscope is inserted through this umbilical port. The additional ports like 5 and 10 through the trocars are placed depending on the procedure to be done. For this, we can take an example of a lap chole. That is, in cholecystectomy, laparoscopic surgery is considered as a golden standard, where the three-port classical approach, where one port is on the umbilical and another port is the right hypochondrium and the other in the epigastric region. Right hypochondrium 5 port is being introduced, and in case of epigastric, it is 10 port is being introduced. So based on the surgical intervention, the ports have been decided, and these ports are placed in such a way to have a proper triangulation of the instruments for dissection. As we saw in the previous slide of the principle of the laparoscopic surgery of I vitros, the T stands for triangulation. That is a huge role, which is a game changer in this laparoscopic surgery. Proper access of the target or the surgical field will help in the successful outcome of the surgery. The advantages were relatively less painful compared to open surgery. Trauma of access is very less. So this is one of the major advantage of laparoscopic surgery. Next comes a shorter hospital stay and early return to work, faster postoperative recovery, better visualization of the anatomy, that is better approach for visualization of other parts of abdomen for any other pathology. The instrumental access to different abdominal locations is many times better compared to open method. Then minimal scar on the abdomen. Then comes to disadvantages. This technique demands more technical expertise. It is a huge disadvantage. As I said, there are different graspers, the proper knowledge of laparoscopic instruments, and the decision of arranging or decision of taking where the port should be placed based on a surgical intervention. And during laparoscopic surgery, there are many chances of damaging the surrounding structures. So it needs an highly expertise or the high skill in doing these type of surgeries. So this is one of the biggest disadvantage. And next comes, it is difficult to control bleeding, as bleeding obscures the field of vision and the blood vessels tend to retract into the surrounding tissues. Then comes the extraction of larger specimens like lung, colon is difficult because the ports that we use here 5 ports and 10 ports. In pediatric, it is 2 and 3 So extraction of these large organs is difficult. The chance of damage to surrounding structure is more in this procedure in comparison to the open surgery. For example, the common bile duct injuries are frequent following laparoscope. This technique often takes more time to perform an operation and sometimes due to difficulties for limited exposure or bleeding. The surgeon may have to abandon this procedure and convert to open surgery. And it is a very expensive procedure. This is also a huge disadvantage in the society. And now comes the explorative laparoscopy. Explorative laparoscopy, also referred as a diagnostic laparoscopy, is a minimal invasive method for the diagnosis of the intra-abdominal diseases through direct inspection of intra-abdominal organs. Explorative laparoscopy also allows tissue biopsy, culture acquisition, and a variety of therapeutic interventions. Laparoscopic ultrasonography can also be performed during explorative laparoscopy to evaluate organs that are not amenable to direct visual inspection. The purpose of an explorative laparoscopy is to determine the source of or the reason behind a person's symptoms by directly exploring abdominal and pelvic organs and tissues which may be diseased, injured, or contain abnormal growths. In some cases, tissue biopsy and or treatment of the underlying problem is also performed during the same surgery. Explorative laparoscopy may be used to explore the following organs and structures like large and small intestines, appendix, stomach, liver, gallbladder, spleen, pancreas, kidneys, bladder, female reproductive system, that is fallopian tubes, ovaries, and uterus, abdominal lymph nodes, and blood vessels. Indications in case of acute pelvic conditions like ovarian diseases, in tubal pregnancies, ectopic pregnancies, infertility, staging of malignancy, biopsy from the tumors, in chronic pain abdomen where ultrasound, endoscopies, and the barium studies are negative when they fail, then comes the hero, that is diagnostic laparoscopy, which is useful to identify what is a major underlying cause. And now comes the procedure where incision and the pneumoperitoneum is created. A small incision is made, usually below the umbilicus. A needle or trocar is inserted, and a carbon dioxide gas is pumped into the abdomen to create space for the laparoscope and the other instruments. Visualization: the laparoscope is inserted through the trocar and provides a magnified view of the pelvic organs like uterus, fallopian tubes, ovaries, and the surrounding areas on the monitor. Diagnosis and treatment: where diagnostic laparoscopy, the surgeon uses the laparoscope to examine the pelvic organs, identify the cause of pain or other symptoms, and take tissue samples for biopsies if needed. Then therapeutic laparoscopy, other instruments are inserted through small incisions to perform procedures like removing abnormal tissues, example from endometriosis, repairing damaged structures, or removing organs. Once the procedure is complete, the gas is released, instruments are removed, and the small incision are closed with sutures and adhesive bandages. Conditions where diagnostic laparoscopy is used. In chronic pelvic pain, diagnosing and treating causes like endometriosis, pelvic adhesions, and pelvic inflammatory disease. Endometriosis, removing or ablating endometriosis tissue. In pelvic inflammatory disease, in PID, draining of abscess, removing infected tissue, and repairing the damage. Ovarian cyst, removing and draining the cyst. In infertility, diagnosis and treating causes like adhesions or endometriosis that may affect fertility. Other gynecological conditions including fibroid tumors and uterine disorders. Here is an image where you see ovarian ectopic pregnancy, which is being captured in in the explorative laparoscopic surgical intervention. Then it is also being excised. And in this minimal invasive approach, where small incisions are made in abdomen and a small camera laparoscope is inserted to provide a magnified view of the abdominal cavity and direct visualization, the surgeon can directly observe the primary tumor, access its size and spread, and look for any signs of cancer extending to other areas also. In biopsies and cytology, if suspicious tissue is found, biopsies can be taken and sent for analysis. Additionally, peritoneal lavage, that is, washing of the abdominal cavity, can be performed to collect cells for cytology, helping to detect any free floating cancer cells. Assessment of lymph nodes, where laparoscopy allows formation of regional lymph nodes, which can be a key indicator for cancer spread. And decision making, the information gathered during laparoscopic staging helps determine the most appropriate treatment plan, whether that be a surgery, a chemotherapy, or other therapies. In this image, you can see through the experimental laparoscopy, the ovarian cancerous growth was detected. The contraindications in patients who are unfit for general anesthesia is contraindicated. In patients with cardiopulmonary diseases, in patients who had abdominal operations earlier, this is due to increased risk of visceral damage and difficulty for dissection due to presence of abdominal adhesions. In patients with external irreducible hernia, the laparoscopy should be avoided as it increases the abdominal pressure due to pneumoperitoneum that causes trauma to the hernia. In patients with bowel obstructions, laparoscopy should be avoided. In patients with hiatal hernia, laparoscopy should be avoided as induction of pneumoperitoneum will increase the hernia and will cause to cardiac and respiratory dysfunctions. Complications like injury to the bowel and bladder or bladder, injury to major vessels, that is common bile duct injury, then carbon dioxide complications being seen. And comes a discussion where the laparoscopic surgery is a modern surgical technique where operations are performed through small incision instead of larger incision, like in case of traditional open surgery. The laparoscopic surgery, which is one among the minimal invasive surgery, it is therapeutic as well as diagnostic. Better visualization of the anatomy, that is better approach for visualization of other parts of abdomen for any other pathology. Instrumental access to different abdominal locations is many times better compared to open method. Relatively less painful compared to open surgery, shorter hospital stay and early return to work. Faster postoperative recovery. Then expiratory laparoscopy, also referred to as diagnostic laparoscopy, is a minimal invasive method for the diagnosis of intra-abdominal diseases through direct inspection of intra-abdominal organs. The purpose of an experimental laparoscopy is to determine the source of or the reason behind a person's symptoms by directly exploring abdominal and pelvic organs and tissues, which may be diseased, injured, or contain an abnormal growth. In some cases, tissue biopsy and or treatment of the underlying problem is also performed during the same surgery. Laparoscopy has significant role in staging of malignancy. Abdominal malignancies, example like in pancreatic cancer, hepatic tumor, can be diagnosed and staged by this technique. Then laparoscopic cholecystectomy is the most accepted operation and considered as a gold standard. Laparoscopic appendicectomy has main advantage in its diagnostic advantage, like particularly in doubtful cases to exclude other acute abdominal conditions or pelvic conditions. Conclusion: laparoscopic surgery, also known as minimal invasive surgery or keyhole surgery. Minimal invasive surgery is a modern surgical technology and surgical innovation that aims to accomplish surgical goals with minimal trauma. Main advantage is in its diagnostic advantage, particularly in doubtful cases to exclude other acute abdominal condition. The instruments are small and fine, so trauma to the tissue is minimal, less painful compared to open surgery. The advantage of this technique due to the immense difference seen in postoperative pain, scar, and length of the hospital stay. Thank you.
Thank you, Dr. Shobita. Thank you for the well explained, wonderful presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. Before that, I would like to invite Dr. Rameshwar Ketkar for the presentation. Dr. Rameshwar, are you there? Dr. Rameshwar Ketkar, are you there? Okay. Next, I invite Dr. Pragati Tombare for the paper presentation. Dr. Pragati, are you there?
Yes, sir.
Good evening, Doctor.
Good evening, sir.
Please share the screen, Doctor.
Sir, I'm unable to share the screen.
Okay, just a moment, Doctor. We'll share for you.
Yes, sir.
And please start the session, doctor.
Yes, thank you, sir. A very good evening to all of you. Myself, Dr. Pragati Thomre, MD second year scholar from Department of Panchakarma ITR Jamnagar. I am here to present a case report with title Management of Neuromyotonia by Ayurvedic Principles of Jvara Chikitsa with special reference to Mansagata Jvara under the valuable guidance of Dr. Anup Thakur, sir. Next slide, sir. So, neuromyotonia, it is also known as Isaac syndrome or Isaac-Maternal syndrome. It is the form of peripheral nerve hyperexcitability that causes spontaneous muscular activity resulting from repetitive motor unit action potential of the peripheral origin. Causes acquired neuromyotonia, most common type. It is 80% of the cases suspected to be autoimmune mediated, which is usually caused by the antibody against the neuromuscular junction to the potassium channel on the motor nerve, resulting in the continuous hyperexcitability. Onset is 15 to 60 year. Paraneoplastic neuromyotonia. It arises secondary to the cancer due to the autoimmune response triggered by the tumor. And third is hereditary. It can be inherited due to the mutation in the genes. Treatment, there is no cure for neuromyotonia, but the condition is treated by anticonvulsant like phenytoin, carbamazepine, etc., plasma exchange therapy, IVIG treatment, immunosuppressant like prednisolone, etc. Next slide, sir. Moving toward the patient details, demographic data, age 32 year, gender male, address Morbi, Gujarat, occupation shopkeeper, religion Hindu. Chief complaint with duration, involuntary twitching in bilateral greater toes, thighs, calf muscle in the lower legs, burning sensation in bilateral sole, lower back pain, pain in bilateral knee joint, and pain in bilateral calf muscle, seen 6 months. History of present illness. He had a history of working at gym since 4 years, so due to which he had cramps in bilateral calf muscles. History of typhoid fever in December 2024, 8 months ago, so got treated by the conventional medicine and got relief. Then he had a fissure followed by lower back pain and bilateral knee joint pain, took physiotherapy and conventional treatment, after which the twitching of the muscle of the greater toes and the calf started with burning sensation of the bilateral soles. Again took allopathic medication, but no results. So came to the Ayurveda. So there is no history of like a family history or surgical history or no any current medication is going on. Ashtavida Pariksha, Nadi, Vatapradhan Pittanubandhi, Mala, 2 to 3 times per day, unsatisfactory, sometimes sticky and sometimes semi-solid. Mutra Prakrut, Jiva was Sam, Shabda, Sparsha, and Ruka Prakrut. Akriti was Madhyam. On clinical examination, pulse 88 per minute, BP 110/70, BMI 23.8, RR is 18 per minute, CNS is conscious oriented, RS is air entry bilateral equal, and CVS is S1S2 normal. On local examination, the muscle power of the both upper limb and lower limb were normal, that is +5, and muscle tone of upper limb and lower limb were normal. Investigation, EMG study shows EMG of tested muscle suggestive of fasciculation, including the duplets and the triplets, and neuromyotonia, right lower limb predominant, peripheral nerve hyperexcitability may be considered. Ayurvedic pathogenesis, Hetu, causative factor, in Ahara, Katu and Amlarasa Pradhana, Ahara, Dadhi and Guru Ahara Sevana. In Vihara, Yathabala Vyayama in Jima, Kshitavayu Sevan, that is AC exposure, and Divaswap, that is day sleep. Manas Hetu, Atichinta. Samprapti Ghataka, Dosh, Vadapitta, Dusha, Rasa and Mansa, Srotodushti, Rasavaha and Mansavaha, Agni, Vishamagni, Rogamarga, Abhyandar and Shakha, and Sadhya Sadhyatva, Kruchra Sadhya. So, Ati Vyayama, Ati Bharavahana, Abhishanti Ahara, and Divaswapa leads to Mansadhatu Dushti. We can it considered as a Kha Vaigunya. So, he had a cramps in a bilateral calf muscle. Also, there is a Agni Dushti. Previous slide, sir. Leads to the Jwara for 6 to 7 days. So, he took antibiotic and conventional treatment for that. So, there is a Lina dosha, which were Pitta Pradhana. So, Lina dosha is transferred to the Koshta, Koshtagata Vadhi, that is Parikartika. For Parikartika and for lower back pain and pain in bilateral knee joint, he took physiotherapy and conventional treatment. But there is an absence of a treatment for the Lina dosha. So the doshas are transferred from the Koshtagata to the Shakhagata. So Shakhagata, Vatapitta dominant dosha. Already there were a kha vaigunya in a Mamsa dhatu, resulting into the involuntary twitching in bilateral greater toes, thighs, calf muscle in the lower legs, that is Gatra Vikshep, burning sensation in bilateral sole, Daha, and pain in bilateral calf muscle, that is Pindikodveshtana. Next slide, sir. So our diagnosis was Mausagata Jwara. So Mausagata Jwara having a symptoms like Antaradaha, Satruna Moha, Saglani, Srushtavitakata, Daurgandhya Gatra Vikshepo, Jwara Mausasite Bhavet. For that therapeutic intervention were Sarvanga Abhyanga Yutabalatil and Patrapind Swedan for 10 days with Patoladik Shirabasti. The content were Madhu 60 gram, Saindhav 12 gram, Sneha Gogruta 60 ml, Kalka 30 gram and Shirapaka 400 ml. The content as per Shlorin slide. Mausapachaka Yoga 250 mg tablet BD for 10 days. So result, twitching, it was +4 before treatment. After treatment it was +1. Lower back pain, it was Vaskol 2 before treatment. After treatment it is 0. Burning in sole, it was before treatment it was 4. After treatment it is 0. Pain in bilateral calf muscle, Vaskol previously 3. After that, after treatment it was 0. And knee joint pain, it was scale 4 before treatment. After treatment it is 0. Follow-up were taken at 7th, 14th, 29 and 59 day, but there were no symptoms found in that patient. Next slide, sir. Discussion. असंजायतो बलः यस्तु ज्वरमुक्तो निषेवते वर्जयते नरः तस्य पुनरावर्तके ज्वरे. By using this shloka, thus the treatment principle is the pacification of the vata and pitta dosha and mausadhatu gata kha vaigunya. So best treatment is virechana, but those who are weak and can't undergo shodhan can undergo shodhana by basti, that took Kshiravasti. In the patient with a Lina dosha having a Dhatu Daurbalya, because of which Kshira or Yapana Basti is prescribed. Hence, Basti from Chikitsa was adapted, that is Patuladik Kshiravasti. Sarvanga Abhyanga with a Patrapinda Swedan was adapted as a Purva Karma to improve the muscle tone and improve the working of the tissues. To treat the Khavaigunya, Mausapachak Yog from the Jwara Chikitsa was advised for 10 days. Conclusion. Ayurveda mentioned that a Vaidya, even if unable to label the disease, can effectively treat it by acknowledging its hetu, dosha dhatu malavaishamya. The principles from the Jwara Chikitsa are applicable to treat the various conditions of the diseases. Kshiravasti can treat the patients of neuromyotonia as it is Vata-Pitta dominant condition, yet a single case can't substantiate it. These are the references. Thank you.
Thank you, Dr. Pragati, for the well-explained presentation. Thank you so much, Doctor. Next, I'd like to invite Dr. Geetanjali Shashikant Deshmukh for the paper presentation. Dr. Geetanjali. Good evening, Doctor.
Hello, good evening, sir.
Your screen is visible, Doctor.
Yes, screen is visible.
Please. Yes,
Okay,
Doctor. First is the paper, then post it, Doctor. Please start the session.
Okay, thank you, sir. Good evening, everyone. Myself, Dr. Gitanjali Deshmukh, second year PG scholar in Kai Chikitsa department from GM Patur Akula. Today, I am going to present paper presentation on the topic Vata Rakta, that is gout. An integrated approach to Vata Rakta means gout. It is a case study under the guidance of Dr. Jayashree Katule, HOD of Kaya Chikitsa, and Dr. Ashish Keche, reader of Kaya Chikitsa from GM Patur Akula. Now, abstract. Vatarakta is described as an independent disease, also referred to as Vatashonita, in classical Ayurvedic texts such as Charak Samhita, Ashtang Hriday, and other authoritative treatises. The present study is a case report on the integrated management of a 55-year-old male patient presenting with complaints of severe pain and redness at the first metatarsophalegeal joint for the past 1 month, fever for 4 to 5 days, tenderness over the same joint for 15 days, and mild ankle joint pain. The diagnosis was consistent with Vatrakta, that is the gout. An integrated approach combining Ayurvedic medication and modern pharmacological support was adopted. The patient showed significant symptomatic relief, indicating the effectiveness of integrative management in the Vatrakta. There are keywords for the Vatrakta, means Vatarakta, gout, Raktavaha Srotas, as Vatarakta is a Vyadhi of Raktavaha Srotas, metatarsophalangeal joint, and integrated approach. Introduction. Vatarakta is a condition that arises when Vata dosh aggravated due to its own causative factors, that is Nidan, becomes obstructed in its natural pathway by viated Rakta Dhatu, means blood. This interaction between aggravated Vata and viated Rakta leads to the manifestation of the disease known as Vatarakta. It is also referred to by synonyms like Khudavat, Vatabalasak, and Addevat in classical Ayurvedic texts. The classical sign and symptoms of Vatarakta includes Kandu means itching, Ruja means pain, Toda means pricking pain, Spurana that is thrombing pain, and Shavatvak that is discoloration of the bluish skin. Raktatvak means the reddish discoloration, Bheda means piercing pain, Gaurav means heaviness, and Suktata means numbness. All these symptoms are indicative of the involvement of both Vata and Rakta dosha and align closely with the clinical presentation of gout in modern medicine, which further support the correlation between the two conditions. Objectives of the Vatarakta: to study the clinical presentation of Vatarakta from both Ayurvedic and modern perspectives, to observe hematological and clinical changes during the course of treatment, to minimize disease complications and reduce the duration of illness, and to improve the patient's overall quality of life through integrated management. Materials and methods. First is the literature review. It is a comprehensive review of classical Ayurvedic texts and modern medical literature was conducted to understand the pathogenesis, clinical presentation, and management of Vatarakta. Second, conceptual study. It includes disease review. Firstly, Ayurvedic perspective, and second is modern perspective. First, Ayurvedic perspective. Hetu means the causative factors. Mithyahar Vihar means improper diet and lifestyle. Excessive intake of lavan ras, katu ras, snigdha, ushna bhojan, viruddha bhojan, divaswap means daily sleep, and ratri jagran means night awaking. The doshas involved in Vatarakta are Vata and Rakta. Dushtas means affected tissues are Rakta, Tvaka, and Mausa. And the affected organs are Tvak, Maus, Sandhi means joints, Hasta means hand, and Sarva Sandhi means all joints. The classical symptoms of Vatarakta are Kandu, Ruja, Toda, Spurana, Shavatvak, Raktatvak, Bheda, Gaurava, and Suptata. From modern perspective, the gout is a common metabolic disorder and a form of inflammatory arthritis caused by hyperuricemia leading to uric acid crystal deposition in joints. It is characterized by sudden attack of severe pain, swelling, and redness and tenderness. Most commonly at the first metatarsophalangeal joint, the pain is often intense enough to wake the patient at night and may be aggravated even by minimal contact like bedsheet. Third is the drug review, means Ayurvedic formulations used. There are many of the drugs used in the Vatarakta like Kaishor Gugu. In Kaishor Gugu, Guduchi is the main content and which is mainly used in Vatarakta. Then Arogya Vardhini, it is known for its Shodhan properties. It helps eliminate toxins and supports liver function, thereby assisting the metabolic regulation. Then Guduchi Ghanavati, it balances Pitta and Vata doshas, reduces inflammation, and helps to lower the uric acid levels. It also relieves joint pain and swelling. Then next, Mahamanjishtadi Kwat. It is a herbal decoction that aids in detoxification, blood purification, and helps in relieving inflammatory conditions. It is a case presentation. A 55-year-old male patient, farmer by occupation, reported at hospital on date 11/9/2024 with complaints of severe pain and redness at first metatarsophalangeal joint since 1 month, fever since 4 to 5 days, tenderness over the same joint since 15 days, and mild ankle joint pain. History of past illness, no any comorbidities, no any surgical history. Then personal history, appetite, loss of appetite, allergy not detected, addiction of alcohol from 20 years and of tobacco from 35 years, bowel regular, bladder normal, diet vegetarian, non-veg diet, mixed diet, exercise no exercise, sleep disturbed due to pain. The investigations done like CBC, CRP, uric acid, rheumatoid arthritis, urine routine. In Vatarakta, from modern perspective, uric acid levels are increased and it is not of RA because RA test is negative. The treatment from Ayurvedic aspects, medicine like Kaishor Guggur, Arogyavardhini Vati, Guduchi Ghanavati, and Mahamanjishtadikvat, and from modern aspect, it is like antibiotic monosafe, antacid, pan-MCET, and PCM. Discussion, the treatment approaches on Ayurveda, such as lifestyle modification, management of underlying disease, and systemic drug administration. This patient was managed with combined treatment of modern and Ayurvedic drugs. The patient was observed on clinical examination and laboratory investigation reports. Initially, before starting the Ayurvedic medications, patient has having severe pain and redness at first metatarsophalangeal joint, fatigue, disturbed sleep, and low appetite. Then he was started on Abu Ayurvedic formulations. Over a period of time, symptoms reduced. Observation, there was improvement in the appetite, sleep quality of the patient, pain and redness at first metatarsophalangeal joint reduced, hematological changes got improved over time, overall improvement in the quality of life was observed in the patient. Then conclusion, Ayurvedic and modern management of Vatarakta is found to be effective and safe. The treatment reduce adverse effects and complications and improve the quality of life of patient. References from Ayurvedic aspect, Acharya Charak, Charak Samhita, Shukla, Dr. Tripathi, Charak Samhita with Hindi commentary, Chaukhamba Prakashan. Then from modern aspect, it is K.D. Tripathi, Harrison's Principle of Internal Medicines. It is the paper presentation. Now it is the poster presentation. The topic for poster presentation is the Katigatvat, that is the lumbar spondylisis. It is the integrated approach to Katigatvat, that is the lumbar spondylisis. The need for study for the lumbar spondylisis is Katigatvat is one of the most significant Vatavedi described by Charak Acharya under the 18 Anatmaj Vatavadis. In contemporary clinical practice, Katigatvat can be correlated with lumbar spondylisis, which is a degenerative condition of the spine that is increasingly prevalent in today's society. Modern lifestyle factors like lack of physical activity, improper sitting posture, prolonged screen time, lifting of heavy weights, and excessive traveling contribute significantly to the early onset and progression of lumbar spondylisis. The resulting pain and restricted mobility severely affect the quality of life. Also, it is the need for study for it gives the limitations and adverse effects of long-term use of analgesics and surgical interventions in modern medicine. There is a growing need to explore safe and effective treatment modalities. Ayurveda offers a holistic approach through shaman and shodhan therapies that can provide sustained relief and improve the quality of life without harmful side effects. Therefore, it is the need of the hour to evaluate and establish an evidence-based Ayurvedic treatment protocol for Katigatvat, that is lumbar spondylisis, which can offer long-lasting relief, better patient compliance, and minimal adverse effects. The methods to it is the different Ayurveda and modern textbooks, journals, research papers, articles are the referred to study concept of Katigatvat and its correlation to the lumbar spondylisis. The analysis of The clinical features of Katigata Vat, as described in classical Ayurvedic texts, show a significant correlation with the signs and symptoms of lumbar spondylosis in modern science. In this study, commonly observed symptoms like lower back pain, stiffness, and restricted movement were effectively managed through a combination of Bahya Chikitsa, that is external therapies, including Snehan, Svedan, and Katibasti, along with Abhyantara Chikitsa, that is internal medication. The therapeutic efficacy observed can be attributed to the synergistic action of the administered drugs and the therapies. The probable mechanism of action involves Vatashaman, Srotoshodhan, Snayubala Vardhan, and anti-inflammatory effects leading to symptomatic relief and improved functional capacity. These are the images of the Katibasti which were used in Ayurvedic Panchakarma for Katigatavat. Then Chikitsa. The management of Katigatavat was based on the principles of Vatavadhi Chikitsa, as Katigatavat is included in 80s Nanatmas Vatavadhi. Sthanik Chikitsa, as Kati is a sthan of Vayu, so it is the Sthanik Chikitsa, and Samprapti Vighatana, that is breaking the pathogenesis. The treatment was divided into two parts. Bahya Chikitsa means external therapy and Abhantar Chikitsa means internal medications. The Bahya Chikitsa includes these therapies were chosen for their Vatashamak, Snehan, and Svedan effects to relieve pain, stiffness, and improve the mobility. Snehan, that is oleation, means Abhyanga with medicated oils like Mahanarayan tel, Sahacharadi tel, or Kottam Chukkadi tel for 7 to 8 days depending on the patient's severity. Then Svedan, it is the Nadi Swed or Patrapinda Swed. It helps to relieve the stiffness and improves the circulation. Then Katibasti, retention of warm medicated oil, that is Sahacharadi tel or Dhanvantaram tel, over the lumbar region for 30 to 40 minutes for 7 to 14 days, useful for localized pain relief, muscle relaxation, and nourishing the lumbar spine. Then Abhyantar Chikitsa means internal medications. They were administered to pacify Vata, reduce inflammation, and strengthen the musculoskeletal system. Then classical formulations used like Yogaraj Gugul, Dashamul Kwat, Rasnadi Gugul, Erandatel or Erandapak, which all are used to reduce pain, that is anti-inflammatory and Vatashamak effect, Shodhar and Vatashamak effect, and for chronic pain and stiffness. Then Shodhan Chikitsa, if the patient's condition is chronic, then it can be used. In selected cases with chronicity or recurrence, Shodhan was performed based on patient strength and Rugna Bala. Basti Karma, it is the main therapy for Vata disorder, means Anuvasan Basti with Sahacharadi Tel and Niruha Basti with Dashamul Kwat, Erandamul Kwat or Guduchi, etc. The duration, which is classical Kala Basti or Yoga Basti, as per need, can be done. Then conclusion, Ayurvedic management of Katigata Vat, that is lumbar spondylosis, had shown effective and sustained results in reducing pain, stiffness, and improving the functional ability of the patients. The combination of Bahya Chikitsa like Abhyanga, Svedan, Katibasti, and Abhyantar Chikitsa like internal medications works synergistically to balance Vata dosha, strengthen the musculoskeletal system, and restore mobility. Therapies based on classical Vatavadhi Chikitsa Siddhanta, particularly Basti, Karma, offer a unique advantage in treating the root cause of the disease, not just its symptoms. Ayurvedic treatment was safe, natural, and promote the holistic well-being without significant side effects. Hence, Ayurvedic Chikitsa provides a reliable, non-invasive, and holistic approach for managing Katigatavat, making it a valuable alternative or complementary system of care in the treatment of lumbar spondylosis. Then final references, it is Charak Samhita Ayurved Deepika commentary of Chakrapani, edited by Yadavji Trikamji. Then Sri Govind Das Bhaishajya Ratnavali, Dr. Indradev and Radson Penam Davidson's Principles and Practice of Medicine. Thank you.
Thank you, Dr. Gitanjali, for the well-explained paper and poster presentation. Thank you so much, Doctor.
Thank you, sir.
Next, we go to the another paper presentation. I would like to invite Dr. Arpita Kulkarni for the paper presentation. Dr. Arpita, are you there?
Yes, sir. Am I audible?
Yes, Doctor. Audible. Good evening, Doctor.
Good evening, sir. So I'll be sharing my screen. Just a minute.
Okay, Doctor.
Sir, is
Your
my screen visible?
Your screen is visible, Doctor.
Okay. Good evening, everybody. I'm Dr. Arpita Kulkarni, second year PG scholar from Department of Shalya Tantra, Sri Kalabhairaveshwara Swami Ayurvedic Medical College, Bengaluru. So today's topic is an insight on Sivana and its practical applicability. So introduction, Sivana is one of the Ashtaveda Shastra Karmas and it is a unique contribution mentioned by Acharya Sushruta. Sivyaha Medaha Samuttastra Bhinnaha Sulikhita Gadam Sadyo Vranashta Ye Chaiva Chalasandhi Vyapashita. Here Acharya Sushruta has mentioned when Sivana has to be done. So in conditions where there is Medobhava Vikaras and in Vranas that are Vidirna Vranas, and in conditions when there is chalasandhi or when there is separation of two structures, so Sivana can be done then. So the reference is taken from Sushruta Samhita, 25th chapter, 16th shloka. Next, Sivana Dravyas, Shanaja Kshauma Sutrabhyam, Sravyaha Balena Va Punaha, Murva Guduchi Tanairva. The shloka is taken from Sushruta Sutra, 25th chapter, 12th shloka. Suturing is done with the following materials, that is Sukshma Sutra of Ashmantaka, Ashmantaka Valkala, Ksaumas, Snayu, Bala, Murva and Guruchi. And then Suchi, Suchihi Tikshnayaha, Susamahitaha, Karayet Malati Pushpa Vrintagra Parimandalaha. Suchi must have Tikshnagra, that means its tip should be sharp. Susamahita, body should be equal in size. Its end should be like Malati Pushpa Vrintagra Parimandala. Types of Suchi. Deshe Alpa Mamse Sandhaucha Suchi Vritta Anguladvayam Ayata Trayangula Trasra Mamsale Chapi Pujita Dhanurvakra Hita Marma Phala Kosha Udara Upari Iti Ete Trividaha Suchi Tikshnayaha. So there are three types of Suchis. One is Vritta, Ayata and Dhanurvakra. Vritta is 2 angulas in length and it is usually used in sites where there is Alpa Mamsa and Sandhi. And the second type is Ayata, which the length is 3 angulas and it's used in site which has lot of Mamsa. And Dhanurvakra type of Suchi, it's used in site where there is Marma Phala, Phala Kosha, Udara Upari. And Sivana Prakara, Vellitakam Shanaihi, Sivyet Gofanikam Vapi, Sivyetva Tunna Sevani, Ruju Grantim Ato Vapi, Yatha Yoga Mathapi Va, Sushruta Sutra, 25th chapter, 22nd shloka. So, Vellitaka, this is achieved by suturing continuously along the length of the wound, binding the wound edges inside it. And Gofanika, where the Vrana is wide, and there's Gofanika type of suturing is done. Third type is Tunna Sevani. It's done just like how the torn garments are stitched. And Ruju Granthi, this type of suture, it's placed by inserting the needle perpendicular to the skin surface. So, Purva Karma before Sivana is done. So, Pamshu Roma Nakhadini Chala Asti Bhavet Chayat Ahatani Yathu Muni Pachayet Grisham Ranam Rujascha Vividaha Kuryuhu Tasmat Etan Vishodayet. So if wound is contaminated with pamshu, roma, nakha, that should be removed first. Then after samyak vishodhana of vrana, wound edges are elevated. Then pradhana karma, tato vranam samunasya stapayitva yathastitam. So the wound edges are elevated, approximated, and then sutured. Then how the Sivana has to be done. Nati dure nikrishteva suchim karmani patayet durat rujo vranoshtasya sannikrishte avalunchanam. So the Sivana should be done in such a way that the wound edges should not be too far, not too close, and it should also not be overlapped. Pashtat karma, अथ क्षौमपिचुश्चन्नं सुस्युतं प्रतिसारयेत् प्रियङ्गु अञ्जना यष्ट्यात् रौद्रचूर्णैः समन्ततः शल्लकीफलचूर्णैर्वा क्षौमध्यामेन वा पुनः. So after proper suturing, avachurnana has to be done with the following drugs like Priyangu, Anjana, Yashti, Lodra, Shallaki Phala, and wound site is then covered with Kshauma Pichu, and then Bandhana is done. Indications of Sevana. So as I mentioned the shloka previously, Sevana can be done over diseases arising from the Medas, Bhinnavrana, Sadhyovrana, and wounds over the movable joints. Contraindications. न क्षार अग्नि विषयजुष्टा न च मारुतवाहिनः न अन्तर्लोहितशल्याश्च तेषु सम्यक् विशोधनं पांशुरोग्म नखादीनि चलमस्ति भवेत् च यत् अहतानि यतो मुनि पाचयेत् दृशं व्रणं रुजश्च विविधाः कुर्युः तस्मात् एतान् विशोधयेत्. So Sevana should not be done in wounds caused by Kshara, Agni, Visha and in Antarlohita Shalya. When there is presence of all this in the wound, Sevana should not be done as this will cause suppuration of the wound which will lead to different types of pain. Now we'll move on to the modern part of Sevana. It can be correlated to suturing. Sutures. A suture is specially prepared and sterilized thread or strand used to sew tissues or surfaces and bring them together. So there are two types of sutures, absorbable and non-absorbable. Absorbable are the ones that is absorbed in the body and it's digested by the enzymes and removed by phagocytosis. Non-absorbable are the ones that remain in the body and retain its tensile strength for at least 1 year. So these are the different types of absorbable sutures like catgut, plain catgut and chromic catgut. There are two types. Then polyglactin, polyglyconate, polyglycolic acid, polyglycaperon and PDS. So catgut is derived from collagen of the healthy sheep or cattle, whereas the chromic catgut, it's the same catgut but it's tanned with chromium salts. So most commonly used one is catgut. And the next one is the non-absorbable sutures. Examples like silk, linen, surgical steel, nylon, polyester, polypropylene. Then what is the properties of the ideal suture material? First is it should have uniform diameter as this will eliminate potential breaking points and provide uniform higher tensile strength. And it should also possess and maintain adequate tensile strength until its purpose is over. And it should produce knots which hold securely without cutting or slipping. There should not be any fraying of the ends, and it should also cause minimal tissue reaction. It should not create a situation favorable for bacterial growth. It should be non-capillary, non-allergic, non-electrolytic, and non-carcinogenic. It should also facilitate easy handling. It should be of the material that can be easily sterilized, retaining its strength and pliability, and without alteration of its natural properties. It should be freely available and less expensive. And smoother the suture material, easily it will pass through the tissue with least trauma. And knot security, monofilament sutures, they have smooth surface, so the knot slips and opens up easily. So at least 3 to 5 knots should be tied. Surgical needles, these are eyeless or atraumatic with the suture material embedded within the shank of the needle, and it has 3 parts: shank, body, and point. The body of the needle, it's either round, triangular, or flattened. And round-bodied needles are usually designed to separate tissue fibers rather than cutting through them. Cutting needles, they're used for where the fascia is very tough and the tissue is very dense. So in such cases, cutting needles are used. Blunt-ended needles are usually now being advocated in some situations, like when there is closure of the abdominal wall. And half-circle needles are commonly utilized in the gastrointestinal tract, whereas J-shaped needles and other types, they're used in special situations such as the vagina, eye, and oral cavity. Suturing techniques, there are 4 types of techniques: interrupted, continuous suture, mattress sutures, and subcuticular. Interrupted, here the needle is inserted at right angles to the incision, then it's passed through both aspects of the suture line and exit again at right angles. Then continuous sutures, the first suture is inserted in an identical manner to an interrupted suture, but the rest of the sutures are inserted continuously. Mattress, it could either be vertical or horizontal. And subcuticular sutures, this technique is used in skin where a cosmetic appearance is important. And here the skin edges may be approximated easily. Discussion. South American method of wound closure involving using large black ants to bite the wound together with their pincers as jaws acting like skin clips, and then the ant's body was twisted off, leaving the head in place, keeping the wound opposed. So the same type of reference is mentioned by Acharya Sushruta in the context of Chitrodhara Chikitsa. And East African tribes ligated blood vessels with tendon strips and closed wounds with acacia thorns. Acharya Sushruta has mentioned the usage of Sukshma Sutra of Ashmantaka Valkala, Shanaja Sutra, Murva, and Guduchi. The ancient advice by Sushruta for use of Guduchi, that is, tendrils of Tinospora cordifolia as a herbal suture material as described in Ayurveda, was established in a study. The study showed that suturing with Guduchi produced less edema, less tenderness, and less discoloration at suture site, which may be due to anti-inflammatory and antibacterial properties. Another study illustrated that Ashmantaka suture thread can be used as a safe alternative for cotton thread in skin closure. Thus justifies the use of Ashmantaka suture thread as surgical suture used by Acharya Sushruta. Another study was conducted which included two types of natural cellulose fibers, coconut and sisal, were isolated as an alternative to the conventional, natural, and synthetic surgical suture materials. Based on the silk reference suture material, the mechanical properties of the sisal fibers are expected to be relevant for the surgical suture field. In contrast, the coconut fiber has poor mechanical properties for surgical use. Conclusion. Classical references regarding Sevana plays a major role even in the current day practice. As we discussed previously, classically mentioned Sevana Dravyas not only provide good mechanical support but also have some medicinal value in it. The procedure, indications, contraindications for suturing mentioned in our classics holds good even in the present day. Every surgeon should be well acquainted with suturing in order to avoid operative and post-operative complications of surgery. References from Brihatrayi Sushruta Sutra 5th chapter, where he is mentioned Tacha Shastra Karmashta Ashtavidam Tadyata Chedya Bedya Lekya Vedyam Esham Aharyam Visravyam Sivyamiti. Charaka has also mentioned many Shastra Karmas, and the reference has also been taken from Bailey and Ward Procedure and other journals. Thank you.
Thank you, Dr. Arpita, for the wonderful presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Priyanka Shastri for the paper presentation. Dr. Priyanka, are you there?
Yes, sir. Am I audible?
Yes, Dr. Audible. Good evening, Doctor.
Good evening, sir. I'm going to share my screen.
Okay, Doctor.
Is it visible, sir?
Now it's visible, Doctor. Please start the session.
Okay. Good evening, everyone. Myself, Dr. Priyanka Shastri. I'm going to present a topic on understanding Vriddhi Roga with special reference to Antra Vriddhi. The contents being its introduction, Nidana, Samprapti, Bheda, Purvarupa, Lakshana, and Chikitsa of Vriddhi Roga, with special reference to Antra Vriddhis, Nidana, Samprapti, Chikitsa, its Patya and Apatya, concluding by discussion and conclusion. Introduction. The word Vriddhi means Vardhate Anena iti Vriddhihi, taken from Amanakosha, which means increase in size or swelling, where it is mentioned by Acharya Sushruta and Vagbhata, where they considered 7 types of Vriddhi Roga, and Acharya Charaka has used the term Bradna for the same, and they are 6 in number. The Nidana of Vriddhi Roga goes like Adaha Prakupito Anyatamo hi doshaha Falakosha Vahinir Abhiprapadya Dhamanihi Falakoshayor Vriddhim Janayati Tam Vriddhim Itim Achakshate. aggravation of the doshas, which travel and gets localized in the dhamani of phala leading to the enlargement of phala which causes Vriddhi Roga. They have considered mainly 7 types of Vriddhi Roga, namely Vataja, Pittaja, Kafaja, Raktaja, Medaja, Mutraja, and Antravriddhi. Purva Rupa of Vriddhi Roga goes like Tasam Bhavishyatinam Purva Rupani Basti Kati Mushka Medreshu Vedana Maruta Nigraha Falakosha Shofascha iti, which is mentioned by Sushruta in Nidanasthana, which has Basti Kati Mushka Medreshu Vedana. Lakshanas of each type of the Vriddhi Roga. In Vata, there will be Anila Purnata, Basti Vatata, and Parusha Nimittam Anila Rujam. There will be pain without any reason. Similar symptoms have been mentioned by Vagbhata. In Pittaja Vriddhi, there will be Pakwa Udumbara Sankasha, Jwara, Daha, and Ushma. Along with it, there will be Ashu Samuttana Pakam. In Kafaja Vriddhi, Kathinam, Alpavedanam, Shitam, Kandumatim, Sleshma Vriddhim. These are the symptoms seen in Kafaja Vriddhi. In Raktaja Vriddhi, symptoms like Krishna Spota Vritam and Pitta Vriddhi Lingam. The symptoms which are seen in Pittaja Vriddhi similarly can be seen in Raktaja Vriddhi also. Medaja Vriddhi, Mrudu Snigdam, Kandum Atim Alpavedanam, Tala Phala Prakasham, Medo Vriddhim. These are the symptoms of Medaja Vriddhi. Mutraja Vriddhi, there will be symptoms such as it will be because of Mutra Sandharana, and it will be Mruta Vriddhir Bhavati, Sa Gachati, Dhritiriva Kshubhyati, Mutra Krichra, and there will be pain in the Vrishana Prajesha. There will be swelling in the Basti and also in the Falakosha. Chikitsa of each type of Vriddhi Roga. As mainly Vata is considered as the main culprit in causing Vriddhi Roga, so all the Vatahara line of treatment can be adopted here, which includes Snehana, Svedana, administering Virechana with Thaila prepared using Koshamra, Tilvaka Erenda, and also Niruha and Anuvasana Basti using Vatagna Dravyas. Along with that, Pradeha with Vatahara Dravyas has been mentioned. Coming to Shastra Karma, Pachana and Bhedana can be done here. Pittaja Vriddhi, it can be classified into 2 stages. One is Amavastha and Pakvavastha. In Amavastha, Pittaja Granthi Chikitsa can be adopted, and in Pakvavastha, Bhedana and Shodhana can be done, where Ropana Thaila and Kalka can be used. Similarly, Chikitsa of Kafaja Vriddhi, using Pralep of Ushna Dravyas, Daru Haritra Kashaya with Gomutra, and Kafaja Granthi Chikitsa, except Vimlapana, can be adopted here, and Bhedana can be done in Pakvavastha. Raktaja Vriddhi Chikitsa, similar treatment which is being adopted in Pittaja Vriddhi Chikitsa can be done here also. Along with that, Jalaukavacharan can also be done here. In Medaja Vriddhi, the Chikitsa include Svedana and Lepa with Surasadigana Dravyas mixed with Gomutra. Patta Bandhana can be done, and Dharana using Vriddhi Patra Shastra, and then Medo Nirharana, Bandhana with Kasisa Bhasma and Saindava, and later Ropana with Manashiladi Taila. Mutraja Vriddhi Chikitsa, Svedana followed by Vastra Patta Bandhana, and then Dharana using Vrihivrimka Shastra in Pashva Bhaga of Mushka. Next, Vrisravana of Mutra, and then Stagika Bandhana followed by Ropana. Now, Antra Vriddhi. The Nidana of Antra Vriddhi, it is because of Bhara Haranat, Balavad Vigrahat, and Vriksha Prapanat, and Abhiprapadya, and Ayasa. All this leads to Antra Vriddhi Roga. The Samprapti can be given as Nidana Sevana leading to Vata Prakopa, Sthulantra and other visceras being displaced down towards Vankshana Sandhi, where Granthi-like swelling can be seen, which if left untreated for a longer period, the structures enter Phalakosha and Shofa may appear, leading to Mushka Shofa, and then ultimately Antra Vriddhi can be seen. The Chikitsa of Antra Vriddhi is mentioned as all six types of Vriddhi Rogas can be cured. That is, they are mentioned as sadhya except for Antravriddhi. It can be managed in 3 stages, where if it is aprapta, when it is not completely descended into the Falakosha, Vata Vriddhi Krama can be adopted. When it is Vangshanasta, Dahana Karma can be adopted. And when it is completely descended down to Falakosha, then it is considered as Vartya. There are some of the references of using Dahana and Siravyada for treating Antravriddhis. Patya and Apatya, Ashwadiyanam, Vyayamam, Maithunam, Vega Nigraham, Ati Asanam, Chankramanam, Upavasam, Gurunicha. These are the apatyas that are being mentioned, which, if avoided, can prevent the formation of Antravriddhi. Discussion. As mentioned by Acharyas, they are 7 in number, and Charaka has used the term Bradna for the same, where the swelling is seen in Vankshana and Mushka Pradesha. In Ayurveda, inguinal hernia, for example, enteroceal, can be considered as Antravriddhi, which is one among the cement type. The Nidanas, as mentioned by Acharyas, such as Baraharana and Balavat Nigraha, can be compared to increase in abdominal pressure and weakness in the abdominal musculature due to trauma in the contemporary science. And the stages can be accordingly correlated with the inguinal hernia, where incomplete inguinal hernia can be compared to aprapta falakosha antravriddhi, and complete inguinal hernia can be correlated to kosha prapta antravriddhi. The presenting complaints also, like basti kati mushka medra vedana maruta nigraha, can also be compared to the clinical features such as pain and swelling seen in inguinal hernia. The recurrence rate of hernia is also mentioned by Acharya, like tasam punar sambhavu vyadhi swabhavat. According to Acharyas, except Antravriddhi, all other types of Vriddhi can be considered to be sadhya. And conservative line of treatment for aprapta falakosha antravriddhi, similar to Ataja Vriddhi, can be adopted. Acharyas mentioned falakosha prapta antravriddhi as vartya, but due to advancement in surgical techniques these days, it can be considered as shastra sadhya. Conclusion. As swelling in the groin is the presenting symptom of hernia, it can be considered as Vriddhi Roga in Ayurveda. Since hernia develops due to disturbance in the anatomy, surgical intervention remains the definitive line of treatment. Though hernia repair is widely accepted, some recent studies suggest that watchful waiting for asymptomatic hernia before proceeding for surgery would help. Thank you. These are some of the references that have been referred from. Thank you.
Thank you, Dr. Priyanka, for the wonderful presentation. Thank you so much, Doctor. Next, I would like to invite Dr. Nikita Gajan Pandey for the paper presentation. Dr. Nikita, are you there? Dr. Nikita, are you there? Dr. Nikita Gajanan, are you there? Dr. Nikita, can you hear me, Dr. Nikita? Dr. Nikita Pandey, can you hear me?
Yes, sir, I am here. Am I audible?
Yes, Dr. Audible. Good evening, Doctor.
Okay.
Please share the screen, Doctor.
1 minute, please.
Okay.
Sir, I can't share the file. Could you please?
Okay, Doctor, just a moment. Doctor, please start the session, Doctor.
Thank you so much. Good evening, one and all present here. Myself, Dr. Nikita Gajanan Pandey, PG scholar
from Swasthruta and Yoga Department, Vidarbha Ayurved Mahavidyalaya, Amravati. I am presenting the paper under the guidance of Dr. S.K. Chopkar sir, HOD and guide, Swasthruta and Yoga Department, Vidarbha Ayurved Mahavidyalaya, Amravati. My topic, next please. My topic is role of Pathya Ahar and Vihar in the management of obesity. Now, uh, introduction. Acharya Charak was the first to present a detail of Sthoulya. The Ati Sthul is one among the Ashtavanandit Purush described by him. According to Acharya Charak, in case of fatty person, other dhatus doesn't grow to the extent. In today's fast life, bad food habits and relatively less exercise can be taken as major cause of obesity. Obesity is discouraged by society for social as well as medical reasons. Obesity is the most common nutritional disorder in the affluent society. The incidence of diabetes mellitus, hypertension, angina pectoris, and myocardial infarction, etc., is higher among obese individuals. Commonly, obesity is due to excess eating and lack adequate exercise in the pathogenesis of Sthoulya. All the three doshas are vitiated, especially Kledak cough, Pachak Pitta, Saman, and Vyan Vayu are the dosh factors responsible for the Samprapti of Sthoulya. Am and Naras traveling in the body channels get obstructed in the Medovah Strotas owing to the Khavaigunya due to uh, Bijasvav and Shaithilya and combine with Kap and Med, decreasing the Medodhatvagni, which in turn give rise to augmentation of Meda. Vitiated Vyan Vayu propels this augmented Medhatu to its site, that is Udar, speaker, stana, gala, etc., resulting in star. Next, please. Manifestation of this group are associated with either excessive accumulation of male dhatu or diminished nourishment of other dhatus or obstructive in various throtas by medojanya margavrod or the arm or vitiated of path and sleshma dosha. So excessive accumulation of medodhatu produce various signs and symptoms in Sthoulya patient. Next, please. Now, aims and objectives. To understand the concept of obesity, to evaluate the basic principle of Ayurveda for healthy life, and to study role of Ahar in the management of Sthoulya. Next, please. Materials and method. This study is based on explanatory facts and literature review. The data collection is totally based on secondary source like Ayurveda text and research paper. Next. Methodology. Obesity is often associated with a higher risk of mortality and morbidity as it is an important risk factor of non-communicable diseases like type 2 diabetes mellitus, hypertension, dyslipidemia, osteoarthritis, cardiovascular diseases, infertility, polycystic ovarian disease, as well as uh, psychological disturbance like stress and depression. According to some studies, the cases of obesity and its related comorbidities increased significantly during COVID-19 pandemic. Due to lockdown during the pandemic, there was a huge increase in case of obesity. Obesity is a major risk factor for type 2 diabetes mellitus, and the two conditions are strongly associated. Therefore, a combination of healthy eating along with portion control and regular exercise is advised to maintain moderate weight to help prevent or manage diabetes mellitus. Next. Purvarup of obesity. None of the Ayurvedic texts has described the Purvarup of Sthoulya. Acharya Charak in Nidan has mentioned similar pathogenesis of Prameha and Medorok. The reason being that in both of them there is variation of Kapha and Meda. Therefore, Purvarup of Prameha and Medovaha Strotodushti Lakshan can be considered as Purvarup of Sthoulya. They are as follows: Atinidra, Tandra, Alasya, Visra, Sharirgandha, Anga Gaurav, Anga Shaithilya. Next. Roop of Sthoulya, that is मेदो मांस अतिवृद्धि, चल स्फिक, चल उदर, चल स्तन, Anutsaha, and Ashtamahadosas. From them, another group are I- Aisharasah, Javaparodah, Prucha Vyayama, Dorbalya, Dorgandya, Sveda, Svedabadha, Shudhati Madra, and Pipasa Ati Yoga. Next. Samprapti. According to Charak, due to Strotorodha Meda, there is vriddhi of Kosh, Koshtasthit Samanvayu, which in turn cause Ati Sandukshan of Jatharagni. The increase in Jatharagni leads to rapid digestion of consumed ahar and leaves the person craving for more food. If at all, due to some reason, the person doesn't receive more food, the increased Agni cause Dhatu Pachan, which may lead to various complications. But because of the hunger, the person tends to eat more and the cycle continues. In this way, it becomes vicious circle, creating excessive improperly formed medodhatu, which giving rise to various symptoms. Because of such condition of strotoroda, the other dhatu are not nourished properly, cause, causing shaithilya of dhatus prior to med dhatu and depletion of dhatus next to medodhatu. According to Sushrut, कफ कफवर्धक आहार, adhyasan, avyayam, divaswap, etc. lead to formation of amras, that is apachit adhyaras dhatu. The madhur the amras moves within the body. The dhashma in this amras causes protosanga, which leads to sthoulya. Next. Chikitsa. The general principle of treatment in Ayurveda is Nidan Parivarjan, Sanshodhan, Sanshaman, that is Pathya and Apathya. In case of Sthoulya, that is Pathya is most important, which an individual should follow. Pathyam Patha Anatena Yachaktam Manasah Priyam Yachak Priyam Pathyam cha Niyatam Tatra Lakshat. Pathya, which is the ahar vihar that calms the mind, is beneficial to the body and provides nourishment, nutrients, and apatya, which is opposite of pathya. Pathya kalpana prescribed for the patient. Both uh, most of the basic preparation like manda, peya, vilepi, yavagu, mansras. Certain ahar kalpanas like manda, peya, yavagu, vilepi, krushara, yush, mansaras, etc. have been described, which are easily digestible in increasing order and have curative effect also. However, Pathakalpana, the liquid media taken for the preparation, are generally the medicated decoction. Next. There are some ahar dravya which are considered pathya ahar in Sthoulya. For example, mudka, yava, takra, vruntak, lashun, hingu, marich, laja, Kodrav, Chinsa, Chanak, and Jambu. From them, now we will see the gun karma of Mudra. That is, it is Laghu, Med, uh, Medarog, Medorogahita, Kafahara. Mugdha having Kashairas bring about Ruksha, which mitigates Kapha dosha and dries up the clade and Meda dhatu, thereby doing Strotoshodhan. The high fiber content of Mudgar shows the release of calories into the bloodstream. It has low glycemic index of 31, which makes it good diabetic food. Clinical trials have shown that green gram supplementation was found to be significantly reduce the serum total cholesterol, triglyceride, and LDL level in mice fed with high fiber diet. Next. Now it's Yava. It is Kashai Madhuras. Kashai ras reduces kapha, pitta, absorb clade, made leading to Agni Vardhan and does Lekhan Karma. मधुरस and शीतवीर्य does वृद्धि of शरीर धातु बल. It has ruksha, guru gun, kapha, bhara. Katuvipak absorbs sneha, meda, kleda present in the body. Has Agnivardhan, lekhan karma. Barley is easily digestible as compared to wheat and other grain and is endowed with various active principle including phenolic acid, flavonate, lignans, beta-glucan, folate, dietary fibers have potent anti-inflammatory action which could thereby moderate risk of obesity. It is rich source of macro and micronutrients containing uh, fumaric acid and ferulic acid, which does anti-adipogenic action and inhibition of adipogenesis. Next, that is takra. Takra is preparation by churning the curd after adding 1/4 quantity of water. Takra is Agnidipan, Grahi, easily digestible, having Kapha Vata Hargun. It does not cause Pitta Prakop due to its Madhur Vipak. It is useful in Kapha Prakop due to its Kasharas, Ushnavirya and Rukshagun. It is useful in Vat Prakop due to its Madhur Vipak, Amla Ras and Snigdha Gun. In Vat Prakop, Amla Takra plus Shunthi or Amla Takra plus Sendhav Lavan. In Kapha Prakop, Madhur Takra plus Trikatu Churna. Clinical trial shows that sphygmolipid molecules in buttermilk prevent stomach absorption of cholesterol, resulting in low cholesterol. Next. Pruntak. It is Tikshna Lagugun with Ushnavirya and Kautu Vipak. Seedless brinjal is cooked in smokeless fire and mixed with adrak, nimbu, sendhav, lavan and tel improves Agni. Uh, Bhatitrikam Pruntak that is burnt dry on coal is mashed, cooked in ghee along with sendhav, lavan, hingu and other spices. This preparation is called bhati trikam. Brinjal that is cooked over mrudu agni does agni dipan. Vat kafahara. Pruntak cooked on ahar on agni is kafamedo anil amagna laghu agni dipan. But when mixed with tel and lavan becomes guru and snigdha. Next, that is lashun. It has pancharas except amlaras, snigdha, tikshna gurugun, ushnavirya, katuvipak, kapha, vatahara. Numerous clinical trials have shown lashun to be good for the heart by lowering total cholesterol, LDL, cholesterol, and triglyceride. By its katu and tikshna gun, it helps to clear the strotorod and can be administered in the form of shirpak or along with takras or used along with the other spices by seasoning. Composition of allium sativum extract significantly suppressed body weight gain and white adipose tissue weight despite daily food intake along with reduction of adiponectin and leptin level in obese mice. Another study showed that administration of garlic oil to male sprout daily rats for 10 weeks showed reduced body weight and WAT mass. Next, Hingu. It has Katuras, Tikshna Lagu Gun, Ushnavirya, and Katu Vipak, which does Deepan, Pachan, Vat, Kaf, Prashaman. Clinical trials have proved that Ferula asphodida gun has potent anti-obesity activity. Serum leptin level were considerably decreased in treated rats. It play an important role in the digestion of dietary lipid by stimulating bile flow and enhance the activity of digestive enzyme of the pancreas and small intestine. Next, Marich. It has Katu Ras, Laghu Tikshna Sukshma Gun, Katu Vipak, Ushnavirya, and is Kafahar Deepan Chedan Shoshan. A research study claims that a piperine, a component of black pepper, inhibits adipogenesis by antagonizing PPARY activity in adipocyte, thus leading to potential treatment for obesity related disease. Next, Laja. It has Kashai Madhuras, Alparuksha, Lagugun, Sheetvirya, and its Kapha Pittahar and does not aggravate Vat. It does Agnidipan and Medohar, though possessing Laghu Ruksha Gun and Sheetvirya, it pacifies Vat because of Madhur Ras, and its Kashai Ras and Alparuksha Gun is indicated in Kapha Rogas. Laja can be administered in the form of Manda, which is Laghu, does Dhatu Poshan, Agnidipan, Ampachan, and corrects the Mandagni. Next, Kodra. It has Madhutiktaras and thus Kled Shoshan Lekhan. Kodo millets are rich in B vitamins, especially niacin, B6, and folic acid, as well as the minerals such as calcium, iron, potassium, magnesium, zinc, and rich in antioxidant, adding in neutralizing harmful free radicals. It has high protein content, low fat, and very high fiber content. Instead of eating polished white rice, which has been stripped of its nutrient, one could option for this, as it contains complex carbs and belongs to the low glycemic index food list, enabling one to lose weight. Next, चिंच. It has आम्ल मधुर रस, गुरु वृक्ष गुण, उष्णवीर्य, आम्ल विपाक, पक्व and मध्यम पक्व चिंच फल. It does वात कफ प्रशमन. This can be used more in Varsha Rutu as it is Vathar and avoid in uh, Sharad Rutu as it has Pitta Prakop. Chinsa be used in smaller quantity every day by adding with more spices to food and the chinsa panam. Uh, Clinical trial have showed that chinsa phala hypolipidemic effect, regulate lipid metabolism, decrease plasma leptin, serum cholesterol, serum LDL level. Next, chanak. It has madhur kashai ras, laghu ruksha gun, sheetvirya, and kafahara. Brishta Chanak is Vat Kafahar and Laghu. The Ruksha Gun acts as a good absorbing agent in clearing the Strotarod. Chanak being a low glycemic index food, having a good source of protein, dietary fiber, and less fat can be used for weight loss. Recent report of Chanak consumption resulted in reduced serum total cholesterol and LDL cholesterol. In the study on animal, adding chickpea to the rat diet helped to successfully stop their body weight from rising. Next, Jambu. It has Kashai Madhur, Amla Ras, Laghu Ruksha Gun, Shitavirya, and Katu Vipak, and does Pachan, Kafahar, and Vatakar. Clinical trials on Visited rats have proved that specifically jumbo seeds and leaves, is effective in lowering total cholesterol, triglyceride, and serum LDL levels, which is helpful in reducing dyslipidemia. It further shows result which states that jamun fruit extract supplementation significantly reduce diet-induced obesity, insulin resistance, etc. Some useful tips for weight loss. That is, first, avoid eating late at night and do not sleep during the day. Eat only after digestion of previous food. Eat only if you are hungry. Take a light walk after a meal. Try to take dinner within 7 p.m. Exercise for at least 30 minutes per day. Increase the consumption of vegetables in boiled form in the diet and consume food when hot. Chew the food completely before swallowing and concentrate on food without any distraction. Food which is steamed should be taken in large quantity. Discussion. Ahar is considered to be the best among all things which sustain life. According to Acharya Charak, if any human being follows proper code of conduct related to intake of Pathya Ahar, then he lives for 100 years free from disease. From ahar, when consumed in proper quantity, helps in the growth of the body, whereas it takes in improper quantity, it lead to various Vyadhi Utpatti. In Sthoulya, आहार having Guru Apatarpan Gun, Kapha Vatahar, Medohar, Lekhan Gun are to be consumed. Guru Ahar is necessary in order to control the increased Agni and Vata, thereby suppressing the Atikshuddha. Atarpan Ahar is needed to reduce the Meda Dhatu and Kapha dosha. This helps in reducing the increased Meda Dhatu. Analysis of ras in Ahar indicates that Katu Tikta Kasha ras are to be used more in the uh, kha- Hello, am I audible?
Yes, Doctor. Audible. Please continue, Doctor.
Okay. Analysis of ras in Ahar indicates that Katu Tikta Kasha ras are to be used more in Kabhojan and Alpabhojan are the best for uh, Karshan. Uh, After that conclusion, uh, Ayurveda advocates Nidan Parivarjan as one of the important mode of treatment for all the disease. Sthoulya is one among the lifestyle disorder which can be effectively managed by Nidan Parivarjan and intake of Matravat Ahar. Ahar having Guru Tikshna Ushna Ruksha Gun Ahar are advised as they are opposite of Mandas Nigda Shit Gun of Vat, Kaf and Med. Kritana Ahar like Manda, Peya, Vilepi, Yavagu, etc. all have Dipan Pajan, Kafahar Karma, which is useful in cases like Sthoulya. Uh, औषध sevan alone cannot alleviate the disease if defective food habits are practiced. On the other hand, if appropriate food habits as pathy is included in daily regimen, even औषधि sevan can be reduced or prevented. Acharya Sushruta mentioned that Vyayams are the best for reducing sthoulya, which is kapha medohar, minimal intake of food and excess expenditure of energy through regular exercise would be the basic rule to get rid of obesity. Thank you.
Thank you, Dr. Nikita. Thank you for the enlightening presentation.
Thank
Next,
you so much.
the paper presentation. Next, I'd like to invite Dr. Ishri Sadish Chavan for the paper presentation. Dr. Ishri, are you there?
Yes, am I audible?
Yes, Dr. Audible. Good evening, Doctor.
Good evening, sir. I am going to share my screen. 1 minute, please.
Okay, Doctor. Your screen is visible, Doctor.
Visible? Is it visible?
Yes, Doctor. Screen is visible. Please start the session, Doctor.
Okay. Myself, Dr. Ishwari. I am going to present paper on topic Shvidra, Beyond Skin, Deep Journey Through Healing, Heritage and Humanity. I am third year PG Scholar student under Department of Chikitsa. Introduction: when the skin forgets its color, the world remembers its judgment. Definition of Shvitroga: Shvitra in Ayurveda refers to a condition where the skin loses its normal pigmentation due to Tridosha imbalance, known as vitiligo in modern medicine. It is an autoimmune condition. It's more than a skin disorder, it is a psychological and a cultural issue. What happens in the skin? The immune system attacks on melanocytes, the cells that produce melanin, result white patches that may spread across the body. There are the three types of the vitiligo, that is segmental, non-segmental, and universal. Common myth: not caused by infection or pure hygiene, and it is not contagious. Shvitra in Ayurveda, ancient insight described in Charak Samhita and Sushrut Samhita, causative factor, Viruddhahar, poor digestion, genetic factor. Dosh involvement, that is primarily Pitta and Kapha, Vat may aid in spreading of lesions. The three types of Shvitra in Ayurveda, that is Darun Shvitra, deep lesions and rough skin, Arun Shvitra, red tinted patches, Kila Shvitra, white chalky patches. Social stigma and cultural perception. Historical reference in ancient India considered spiritually impure and Egypt associated with the leprosy, marriage, jobs, and social exclusion. There are so many real stories of rejection and isolation. That is social stigma for the Shvitra Roga. Shvitra often wrongly linked to the karma or moral failings. Redefining the beauty and famous faces of vitiligo, that is Michael Jackson popularized awareness but hide it for years, and Winnie Harlow, that is supermodel who embarrassed her vitiligo. Ayurvedic treatment and approach for Shvitaroga, that is Shodhan, detox therapy, Vaman, Virechar and Rakta Mokshan, and Shaman, herbal lepas, pastes such as Bakuchi, Aragvad and Khadir, and internal herbs Guduchi, Manjista and Haridra, Rasayan therapy that boosts immunity and rejuvenation, diet and lifestyle, avoid incompatible food combines, that is example milk plus fish, light non-greasy diet, sun exposure therapy. Modern science, Ayurveda, and integrative medicine, allopathic treatments, topical steroid, phototherapy, surgical options, that is melanocyte transplant, Ayurvedic advantage, that is holistic treatment, mind, body, and diet, reduce side effect, improve digestion and immunity. Research areas, that is curcumin and Soriella oil plus UVB synergy. The emotional layer, that is the invisible pain, psychological effect, depression, anxiety, social withdrawal, body dysmorphia in teens, self-image issues, bullying, and social withdrawal. Therapies, cognitive behavioral therapy, counseling, mindfulness, uh, support groups, Ayurvedic mind therapy, Sattva-Vajay Chikitsa, and meditation. Art expression and healing. Vitiligo is now a symbol of uniqueness in art. Camps, Vitiligo, beautiful, proud of my patches include art therapy workshop, series of people with vitiligo. Shvitra, the future outlook, research and innovation, genetic mapping of vitiligo, stem cell treatments, cosmetic tattoo advancement, hope through awareness, education is the key to ending the stigma, embracing every hue of humanity. Healing starts with acceptance. Ayurveda sees what modern science is only beginning to understand. Thank you.
Thank you, doctor. Thank you for the insightful presentation. Next, I would like to invite Dr. Pradipha for the paper presentation. Dr. Pradipha Tanajis, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Wait, sir, I am sharing my screen.
Okay, doctor. Your screen is visible, doctor. Please start the session.
Yes, sir. Sir, my screen is visible?
Yes, doctor. Your screen is visible, doctor. Please start the session, doctor.
Yes, sir. Myself, Pratibha Shirse, from the Rasashastra and Vishaja Kalpana department from GSC Nanded. The topic of my presentation is a review of Parpati Kalpana with special reference to Loha Parpati. Yes, sir. First of all, we will see the introduction. Parikartika is one of the four major pharmaceutical preparation. Preparation used in the Rasa Shastra. Parat cannot be used internally. Parat and Gandak are the essential constituent to make Parpati as a Bandha. Parpati is a unique mercurial preparation involving different processes like Murchana, Sagandha, Nirgandha, Sagni, Potbandha of Parat. The difference of heat provided also differ its therapeutic properties. Etymology of the Parpati Kalpana. The Sanskrit word Parpati denotes a thin flake-like preparation. Parpati indicates a preparation which is a thin, brittle, and has a shape of a thin papad. Synonyms of the Parpati, Parpatika, Potbandha. Definition of the Parpati. Dhruta Kajjalika Mocha Patrake, Chipati Kruta, Sapota Parpati Saiva, Baladde Khila Roganut. Molten Kajjali is made into a thin flake by pressing on a banana leaf, hence name as a Parpati or Potbandha or Parpati Bandha, which indicates its flat shape. It is useful in disease condition of all the age group, including children. History of Parpati Kalpana. Rasendra Mangal in 8th century by Acharya Nagarjun has mentioned use of Parpati in Kushtarog. Later in 11th century, Acharya Chakrapani Dutt in Chakradatta mentioned its use in Grahani Roga. In 12th century, Acharya Dunduknath has mentioned the Kramagni. In 18th century, Bheshaja Ratnavali has explained many Parpatis and Rasa Parpati. Later on, with the development of the different acharya, added different dravyas with parad and gandak to enhance its therapeutic action. Types of the parpati. First one is sagandha. In the sagandha, rasa parpati, tamra parpati, somal parpati, yoma parpati, and swarna parpati are there. In nirgandha parpati, kshar parpati, malla parpati, loha parpati. Equipments required for the Parpati Kalpana. First one is Khalva Yantra for preparing Kajjali, for converting Parpati into powder form. Second one is the spoon, spatula, continuous stirring for material during heating. Third one is Darvi, can be of Loha or Tamra for melting Kajjali. Fourth one is heating device for heating. It changes property from Gurutva to Lagutva. Gome for giving proper shape and pressure. Due to the coldness of gome, the melted kajali immediately solidifies and forms thin flakes of parpati. Patra, kadli patra, for pouring down the parpati on it. Sneha, to prevent material sticking to patra and darbi, to stop the loss of material while heating. Agni, mrudu agni is required to liquefy kajali. Pakakarma attains pankatva, that is a muddy appearance. Methods of preparation. This method is a general method of preparation of parpati kalpana. Firstly, kajali is prepared by trituring shuddha parad and gandak till it becomes black fine powder, and kajali pariksha should be done. After that, kajali and all other ingredients are added and mixed together according to the type of parpati. Mixture is then transferred into an loha darbi, which is coated a layer of gruth. The kajali is to be stirred continuously till the whole kajali melted completely. Goma is placed on an even surface, and above that kadli patra is placed and coated by thin layer of gruth. Melted kajadi is poured on gruth lift, smeared banana leaf. Another similarly gruth coated banana leaf is kept on the spread substance, and the pressure is applied in one direction. On cooling on its own, the upper banana leaf is removed and thin wafer-like parpati is collected. It is finally washed with hot water to remove excess ghee, dried and powder, and kept in a bottle. Parpati Pak, there are three parks for Parpati Pak, Mrudu Pak, Madhyam Pak, and Khara Pak. First one we will see Mrudu Pak. Mrudu Pak having the color of molten kajal is Mayur Chandrika Varn. It is a very soft, and when we try to break it, it bends. Black color and shining is less. This parpati is generally used for the medicinal purpose. Second one is Madhyam Pak. Kajal attains tail consistency, black color with proper shining. While breaking on edges, silver shining is seen. Kharapak parpati becomes with reddish, dry, hard, and coarse blackish in nature. Now we will see the Loha Parpati. Ingredients which is required for Loha Parpati is Shuddha Parat, 1 part, Shuddha Gandhak, 2 part, Tikshna Loha Bhasma is 1 part. This reference I have taken from the Siddha Yog Sangraha, Atisar Pravahika chapter. Procedure of Loha Parpati. Kajjali, as we seen in previous slide, that Kajjali is prepared by trituring 1 part Shuddha Gandhak, and here 2 part Shuddha Parat is taken. Kantaloha Bhasma is added and again triturated for 1 hour. Obtained mixture was taken in Ghrut-lipta Loha Darbi and heated on Mandagni. Then the mixture, after melting completely, was poured on a Ghrut-lipta Kadli Patra, which was kept on Gomai. Immediately it was pressed by another Kadli Patra for 1 minute. 20 minutes after Swangshit, thin flake was obtained. Dose of Loha Parpati is 1 to 2 Ratti. Anupan is milk, buttermilk, Bhrishta Jirak Churna, Dadin Soras. Therapeutic uses are Agnimandya, Gruhni, Amla Pitta, Pandu, Sutikajwar, Amshul, Atisar, Kamla, Pliharok, Bhasmak, Amwat, Udavat, Kushta, Garvish, Vali, Palit. These are the references of Loha Parpati. First one is Bheshaj Ratnavali. In these ingredients are Parad is 1 part, Gandhak is 1 part, and Loha Bhasma is 1 part. Matra is 1 Ratti, that is 250 milligram. Uses in Sutika Rog, Jwar, Grahani, Atisar. Second one is Rasa Taringani. Parad, Gandhak, Loha Bhasma, Tamra Bhasma, Abrak Bhasma. All these ingredients are in 1 karsha. Dose of this Loha Parpati is 125 milligram to 250 milligram and used in Pandu, Arsha, Kamla, Grahani, etc. After that, this reference is Rasatantra Saraur Siddha Prayog Sangraha. Parat Gandak Loha Bhasma is taken as a 1 part each. Again, dose is 1 Ratti to 3 Ratti and usage is Sangrahani, Atisar, Pandu, Kamla, Amvat. Ayurvedic Aushadhi Guradharma Shastri reference. Parat Gandak Loha Bhasma is 1 part. Dose is taken as a 1/4 to 1 gunja and uses as a Grahani Shul Atisar. After that, Rasachandan Shu reference. Parat Gandak Loha Bhasma is 1 part and dose is 125 milligram and uses in Grahani Shul Atisar Pliha Mandag Agnimandya. Ayurvedic Rasashastra Parat Gandak Loha Bhasma 1 part and dose is 1 to 2 Ratti, Sangrahani, Pandu, Amvat, Kushta. In this disease, this low Parpati is used. Parpati Prayog, there are 2 Parpati Prayog. First one is Samanya Prayog and second one is a Vishesh Prayog. In Samanya Prayog, dose is given as a 1 to 2 Ratti with the Anupan of the fried Jirak, Hingu, Takra. In the Vishesh Prayoga, 1 or 2 Ratti dose initially and it is increased by 1 Ratti per day up to maximum 10 days. And after that, this dose is decreased by 1 Ratti. In this way, it takes around 40 days for a Kalpa Prayog use. Amayik Prayog or indication, Mandagni, Grahani, Shot, Atisar, Arsha, Jalodar, Kushta, Gulma, Pandu. These are the indication of the Parpati as we have seen in the previous slide, which is same Pathya. These are the Pathya we have to do while saving the Parpati. These are the Godugdha, Takra, fruit juice, Kakmachi, Patol, Adrak, Kadli Pushpa, Brinjal, Old Shalidu. अपत्य अन्न जल लवण अम्ल सेवन शीतल जल स्नान क्रोध उष्ण द्रव्य तिक्त द्रव्य अनुपान मधु भृष्टजीरक क्षीर सीता घृत दाडिम सोरस तक्र. These are the references that I have collected the information regarding the Parpati Kalpana and Loha Parpati. Thank you.
Thank you, Dr. Pratibha, for the grateful presentation.
Welcome.
Thank you so much, Doctor. And next we go to the another paper presentation. Next, I'd like to invite Dr. Nikita Milin Dohokale for the paper presentation. Dr. Nikita.
Hello, myself Dr. Nikita Mirinder Hukle, PG scholar of Shalakya Tantra from PMT's Ayurveda College, Shivga. I am here to present paper on case study of Shushkakshi Pak with its management through Amlaki Siddha Grita Tarpan. Today's life was completely changed due to the use of advanced technologies like computers, internet surfing, TV, use of ACs, and overuse of vehicles and industrialization. And it has led to the more polluted and dusty and dry environment. Due to all these lifestyle changes, the organ which is at first and foremost risk is eye. The Ayurveda describes this condition as Shushka Akshipak. The classical lakshanas include dryness, rukshata, burning sensation, daha, blurring of vision, avil darshan, unable to open eyes easily, kruchunmilan. The tear secretion is an integral component of the ocular surface physiology, and when it is compromised quantitatively and qualitatively, it leads to dry eye syndrome with several ocular symptoms, and ultimately the patient may end up in a corneal blindness. The symptom of dry eye syndrome are similar to the disease Shushka Akshipak, ocular surface inflammatory syndrome in Ayurveda. Vata Pitta irritations, as per Ayurveda viewpoints, are the major contributing pathological factors in its manifestation. Shushka Akshipak can be considered as a Tarpana Sadhya Netra Rog. In this clinical study, I have attempted Amlaki Siddha Grita Tarpan for the Shushka Akshipak treatment. The introduction point includes the lakshanas of Shushka Akshipak can be equated with the signs and symptoms of dry eye syndrome. The symptoms of dry eye includes irritation, foreign body sensation, feeling of dryness, itching, non-specific ocular discomfort, conjunctival xerosis, reduce or absent marginal tear strip, and corneal changes in the form of punctate epithelial erosions and filaments. It is a very common condition characterized by disturbances of tear film. Approximately 8% of world population is suffering with this. Tear secretion provides continuous moisture and lubrication on the ocular surface to maintain comfort, corneal, conjunctival health, and vision. Abnormalities of any of the components of the secretion lead to the instability of the tear film, resulting in drying of the ocular surface. The tear substitutes are the only treatment modality with modern medical science. The duration of action of these tear substituents is variable and are advised as per the need, only providing symptomatic relief. The preservatives present in these formulations are also a cause of dry eye, whereas those available without preservatives are not cost effective. Hence, there is a need to find the safe, effective medication. The Tarpana is mentioned as a treatment modality in Shushkakshipak and especially indicated in various conditions like Rukshata, Parusha, Kautilya, Avila Netrata, Shirana, Takshma, Shirotpat, Kruchunmilan, and also in other diseases such as Timira, Arjuna, Shushkakshipak, Abhishanda, and Adimantha. The aims and objectives of my study is to evaluate the efficacy of Amlaki Siddha Grita Tarpan in the management of Shushkakshipak. The material and method I used as a case report, a 32 years old male patient visited in Shalakya Tantra OPD with presenting complaints of dry eyes since 4 to 5 days. With the history of present illness, patient is okay before 4 to 5 days, then he developed the dryness of eyes. Therefore, for relief, patient comes to the OPD. I have done the general examination. The patient doesn't having any past history, any treatment or any surgical history. The slit lamp examination reveals lids lashes are within normal limit. Conjunctiva was mild congested. Sclera is in normal limit. The cornea shows few epithelial disruptions. Anterior chamber was deep. Iris was normal color pattern. Pupil is normal size reacting to light, and lens was clear. The management includes Tarpana Vidhi. The Purvakarma includes the patient is made to lie down in a supine position on their back in a well lit room, free from dust, smoke, and drafts. They should be comfortable and relaxed. A gentle head and face massage followed by mild fomentation may also be performed. Pradhan Karma, the eyes are cleaned with sterile cotton which is dipped in a lukewarm water, and a concentric boundary will be made along the outer orbital margin with the paste of Mashachurna, approximately 20 ml till it covers the tip of the eyelashes. The Amlaki Siddhigrita will be filled in both the eyes and allowed to retain in the eyes approximately for 10 minutes. That is 1000 Vakamatra. And the patient is allowed to close and open the eyes frequently. After the prescribed time, the grita will be removed by making the hole in the boundary at the lateral canthus of the eye. The Paschatkarma includes removal of ghee, cleaning the eyes, nasa and dhumpan, post-therapy instructions. The mechanism of action. The therapeutic effects of Netratarpana can be described through the following mechanisms. It provides direct lubrication and nourishment. It provides tissue regeneration, anti-inflammatory and antioxidant properties, cleansing and detoxification, relaxation and stress relief. Hence, I conclude the study with the following key highlights it provides symptom relief, objective improvements for its safety, its holistic approach, and I conclude the study as a therapy is an effective treatment for the dry eye syndrome. Thank you.
Thank you, Dr. Nikita. Thank you for the remarkable presentation. Next, I'd like to invite Dr. Mayank Pratap Singh for the paper presentation. I would like to invite Dr. Mayank Pratap Singh for the paper presentation.
Everyone, myself Dr. Mayank Pratap Singh, MSc scholar from SSRAMC Inchel, Belgaum. My topic is on Rakta Mokshan in Salya Tantra, a detailed review. Introduction. Rakta Mokshan is one of the Panchkarma procedure described in Ayurveda. It is a specialized parasurgical technique aimed at the removal of vitiated blood from the body for therapeutic purposes. It is considered one of the foremost treatment for Rakta Vikara and conditions involving localized inflammation, pain, and swelling. In Salya Tantra, Rakta Mokshan holds significant value as a minimally invasive intervention with both preventive and curative benefits. Historical context in Ayurvedic literature. The procedure is extensively mentioned in Susrut Samhita, particularly in Susrut Sutrasthan and Chikitsa, where Acharya Susruta describes its role in eliminating vitiated blood to restore the normal physiological balances. Charak Samhita and Ashtanga Hridaya also refer to bloodletting as a prime modality for certain systematic and local disorder. Type of Rakta Mokshans. According to Susruta, Rakta Mokshan is classified into two broad categories, Sastra Vishramana and Anusastra Vishramana. Sastra Vishramana means surgical methods like Siravedan, that is venesection, Prachanna Karma, multiple punctures, and Jalaukavacharan, leech applications. In Anusastra, that is non-surgical methods, Sringa, Alabo, and Ghati Yantra. Sring is application of horn, Alabo is bottle guard application, and Ghati Yantra is a pot section. Indication in Salya Tantra. Rakta Mokshan is indicated in the following Salya Tantra condition, that is Vat Kafaj Gridrasi, Vat Rakta, Visharpa, Vidrati, Sandhivat, Avabhavuk, post-traumatic inflammatory condition, and Dushtavrana, etc. The procedure should be avoided in children, elderly pregnant women, anemic patients, individual with hypotension or severe weakness, chronic debilitating disease. Procedure of Rakta Mokshan. Purvakarma. Patient selection and consent. Assessment of dose, and Rakta Dushti. Preparation of instrument and aseptic measures. Main procedure, that is Pradhana Karma. Depending on the method selected, Siravad, Prachanna, Jalapa, etc. Removal of specific quantity of blood until symptoms subside. Post procedure, that is Paschas Karma. Bandaging of side, administration of Sheetal therapy for hemostasis, rest and dietary regimen for recovery. Mechanism of action. From an Ayurvedic perspective, Raktamokshan expels vitiated blood, thereby removing local harm, pacifying aggregated dosas, and enhancing Ras Rakta Dhatu quality. From modern viewpoint, it promotes microcirculation, reduces inflammatory mediators, and improve oxygenation of tissues. Clinical applications in Salyatantra. In Salyatantra practice, Raktamokshan is frequently applied as an adjacent to surgical intervention to manage post-operative inflammation, reduce pain, and accelerate wound healing. It is also used in chronic musculoskeletal disorder to enhance rehabilitation. Safety and possible complications. When performed under proper aseptic measures and with correct patient selection, complications are rare. Possible adverse events include mild bleeding, local infection, dizziness, or allergic reaction to leech or saliva. Conclusion. Raktamokshan is a time-tested parasurgical procedure in Salyatantra with wide-ranging application for inflammatory, painful, and blood-related disorder. Integrating classical Ayurvedic knowledge with modern clinical protocol can enhance its efficacy and global acceptance. And rest references are there, that is Susrut, Samhita, Charak Samhita, Ashtang Hridaya, and etc. Thank you.
Thank you, Dr. Mayank, for the impactful presentation. Next, I would like to invite Dr. Vijayalakshmi for the paper presentation. I would like to invite Dr. Vijayalakshmi for the paper presentation.
Namaste, myself Dr. Vijayalakshmi Karimani, second year PG scholar from the Department of Rachana Sharira, Ayurvedic Medical College, Vrana, guided by Dr. Harshvardhan Balihar, Professor and HOD, Department of Rachana Sharira, Ayurvedic Medical College, Vrana. Today's topic is concept of anatomical structure of Snayu in Snayugata Rogas. Introduction is in Ayurveda, many research has to be done to align with the modern medicine. Some of the terminologies, the definitions are not clear. So it is very important to understand about the Snayu. Let us see the Snayu Utpatti. Sna Dhatu Un Pratyaya. So Mridupaka and Karapaka causes the Sira and Snayu. And next is Snayu formation. It is the Pitruja Bhava, therefore it is Sthira, Katina, but it is not Mrudu or elastic. Snayu Paribhasha. Snayu Riti Shanakaraha Upadatu Visheshaha Ena Dhanushi Nayyate. Anga Pratyanga Sandhibandhana Rupaya Snayuha. Mamsavahe Dve Tayor Mulam Snayutvam Raktavahasya Dhamanyaha. Snayu Sankhya and Sthana. Nava Snayu Shatani Tasam Shakasu Shad Satani Dve Shate Trimshacha Koshte Grivam Pratyurdam Saktatihi. So this is the distribution of the Snayus in the Shaka, Madhya Sharira and Urdhva Griva. Snayu prakaras are of 4 types. Snayus Chaturvida Vidya Tastu Sarva Nibodhame Pratanavatyo Vrittascha Pratyascha Sushiras Tatha. So let us see one by one. Pratanavati Snayu is branched. Pratanavatyaha Shakasu Sarva Sandeshu Chapyataha. They are present in all the joints and extremities. Next is Vritta Snayu, Vrittastu Kandaraha, Sarva Vigneyaha, Kushalairiha. They are circular in shape and are known as Kandara. Sushira Snayu are porous, Ama Pakvashe Yanteshu, Bastocha, Sushiraha Kalu, and the orifice for urinary bladder, vagina, and rectum can be considered. Pruthula Snayu are flat. Parshva Urasi Tatha Prishte Pruthulasha Sushiras Tatha Shiras Tatha. That is the fascia, the aponeurosis present in the shira, Galena aponeuroticum, thoracolumbar fascia, and the abdominal aponeurosis and inguinal ligament can be considered as Prutula Snayu. Next is functions of the Snayu are Snayo Bandhanam Prokta Dehe Mamsa Asti Medasam. Shranajak Shoma Sutrabhyam Snayo Balena Vapunaha. The one which binds the Mamsa Asti and Medasi Snayu, and the function of binding the body parts is done by the Snayu. Let us see the clinical importance of snayu. न हि अस्तिनि न वा पेश्यो न सिराना च सन्धयाः व्यापादिता अन्योर यथा स्नायुः शरीरिणाम. That is, the pain caused by the snayu compared with the pain due to asthi sandhi are more critical. So these are the binding structures, are important structures. The shalya, good shalya, which is present in the snayu, one who is expert in removing that is expert in surgery. So the board, how it is supporting by the wooden blocks are supported by the thread tied to it, and it is able to carry the weight on it. Similarly, the human body, which is whose bones are tied with the tightly with the ligaments, is able to carry the weight. Snayu marmas are Ani 4, Vitapa 2, Kakshadara 2, Kurcha 4, Kurchashira 4, Basti 1, Kshipra 4, Amsa 2, and Vidura 2, Kshepa 2. Let us see the Snayu marma with the Lakshanas. So Lakshanas are Ayama, Akshepa, Stamba, excessive pain in the Snayu region. So Yana, Sthana, Asana, Shakti, and Vaikhalyata. So some of the examples are, if we damage these marmas, these many symptoms can be seen. So next is Snayu is also considered as Upadhatu. Next is Basti. In Ayurveda, the ligaments are fibrous structures connected to soft organs also. So how the snayu is corresponding to the outermost fibrous connective tissue which is present on the urinary bladder. Next is clinical importance of the snayu are Snayuvata Vyadhi are hard to treat and may become incurable if misdiagnosed. So symptoms will be stiffness, tremor, pain, edema, convulsions. Aggravated Vata causes the Antarayama, Bahirayama, Dhanustambha, Kubjata, and Khalli. So, Snayugata Vikaras are usually termed as rheumatic disorders. Common forms are Sandhigata Vata, Amavata, Vata Rakta, and the symptoms will be Stamba, Sankocha, Khalli, Granthi, Sporana, and Sukti. So, the Snayugata Vata, it is a condition where Vata vitiated due to causes like Ati Vyayama, Ati Cheshta, Abhihata, Aharaja, Viharaja, Karmaja, and Manasika Karanas. So, vitiated Vata localizes in the joints like Kurpara, etc. And this is discussed in the Vata Vyadhi. So characteristics characterized by musculoskeletal pain, fatigue, and chalaguna of the Vata plays more important in many Vata Vyadhis. So this vitiated Vata is the key factor in disease development. So, Prakruta Vata localized in the specific site, disrupting their normal function. So, symptoms will be severe pain, joint stiffness, delayed wound healing, restricted movement. So, treatment can be Snehana, Svedana, Mardana, Bandhana, Basti, Agnikarma. Next is Snayavata Vata treatment. It is the physician in fibrous tissue causes stiffness, pain, and tremors. So, treatment includes Snehana, Upanaha, Agnikarma, Bandhana, and Mardana. Sushruta gave honey, jaggery, oil, beeswax for Agni Karma in Snayu Vikara especially. Next is Akshepaka. Akshepaka Vyadhi is because of the contraction of the Snayu, and this provoked Vata contracts the vessels, tendons, and ligaments of the hands and feet and cause episodic contraction in different parts of the body. Pakshagata, in Vishishta Samprapti of Pakshagata, vitiated Vata affects one side of the body, dries off the sira and snayu, causes movement loss, limb contraction, pain, and stiffness. So, Vagbata says, goes with both the Charaka and Sushruta opinion. So, it is also called as Ardhakya Akarmanyata. Next is Grudrati is one of the Nanatmaja Vatavyadis. Symptoms will be pain, stiffness, pricking sensation from the lower back radiating to leg, including buttocks, thighs, knee, calves, and feet. So next is tendinitis is a condition in which the tissue connecting the muscle to bone becomes inflamed. An injury to Achilles tendon which connects the calf muscle to the heel, and it is commonly seen in runners, middle-aged people who play sports only on weekdays. So, fibrositis is a condition defined as the pain or inflammation of the muscle sheaths, muscles, and connective tissue layers of the joints become bones, tendons, and muscles. So, the regularly affected areas in fibrositis are muscular regions of the lower back, thighs, hips, arms, chest, neck, shoulder, and thighs. So, trigger finger is a painful locking of the finger due to flexion extension with a snapping release caused by contraction of the fibrous digital sheath, impairing the tendon gliding. So, commonly seen in diabetes and women aged 50 to 60. In Ayurveda, Sushruta recommends Agnikarma as a treatment. So, next is Duchenne muscular dystrophy. It is a hereditary neuromuscular disorder caused by absence of the key muscle glycoprotein. So main symptom is progressive muscle weakness. Next is tennis elbow, condition marked by the pain, immobility, and contraction, predominantly affects 30 to 50 years, related to lateral epicondylitis, manifested from repetitive strain on snayu. Next is sprain is characteristic feature of our pain, immobility, and contraction, significantly impacting daily activities and quality of life. Usually seen in 30 to 50 years. And Ayurvedic perspective, Vata dosha imbalance is the affecting the snayu. So pathophysiology emphasizes the weakness of structural integrity and resulting functional disturbances. So this discussion is snayu connects the mamsa and asti. Structurally, it resembles the ligaments but also refers to tendons, aponeurosis, or sphincter muscles, defined as Vatavaha Nadi, a channel carrying Vata dosha. Injury to snayu causes severe pain due to Vata's dominance in pain sensation. Sushruta also describes snayus are the binding structures. Snayus are traditionally used for tying the bows as a Sivana Dravya, and in Marma Sharira, type of Marma is also named as Snayu Marma due to its structural resemblance to Snayu. Dallana commented that Snayu binds the Sharira Avayava together. In modern science, muscles attached to bones via tendons and ligaments. Bones are connected at joints by ligaments. So, suspensory ligaments are also ligaments that hold the organs in place. Especially the breasts in place proves that Medas is held or bound by the ligaments. Pranavayu located in the Murdha travels through the Snayu pathway, and Snayu is the Moolasthana of the Mastulunga. Ligaments and tendons are similar in structure but differ in the way they are attached. Fascia is also fibrous and covers the muscles and can be included under Snayu. The aim of this work is to compile the references, critically analyze those references, and establish the scientific concept of Snayu. So that my conclusion is Snayu is a fibrous connective tissue present in the human body. It has various forms as per the functional requirement of the body.
Thank you, Dr. Vijayalakshmi. Thank you for the very informative theoretic knowledge. Thank you so much, Doctor. Thank you for the informative session. Next, I would like to invite Dr. Harshada Rajesh Tolwade for the paper presentation. Next, I would like to invite Dr. Harshada Rajesh Dolwade for the paper presentation.
Good morning, everyone. I am Dr. Harshada Dolwade from SMBT Ayurvedic College, Igatpuri, Nashik, and my topic is Effect of Agnikarma in Perianal Fistula, a case study. First introduction. Fistula in ano is an inflammatory tract lined by unhealthy granulation tissue with internal opening in the rectum or anal canal and external opening in the perianal skin. It connects the anal canal, rectum, anorectum to the perianal skin. Most of the fistula in ano are due to an infection of cryptoglandular and thus forms a perianal abscess. It bursts spontaneously and forms fistula in ano. It may also be seen in association with some disease like Crohn disease, lymphogranuloma venerum, actinomycosis, malignancy, and TB. Generally, fistula in ano can be classified as low anal and high anal fistula on the basis of location of the internal opening and the risk of post-operative incontinence. High anal fistula are the one in which the internal opening is or at above the anorectal ring and there is a high risk of incontinence if laid open. In low anal fistula, the internal opening will be below the anorectal ring and the risk is low. Perianal subcutaneous fistula are among low anal fistula in which 30% of the external sphincter is involved. It may occur from a perianal infection or as a complication of fissure in ano. Low level fistula is common in young adults, males, and the prevalence is 0.01%. Patient may complain about the intermittent pain, seropreludin discharge from the perianal skin, and skin irritation. Risk factors for developing this disease include obesity, diabetes mellitus, smoking, hyperlipidemia, and a sedentary lifestyle. The modern treatment of perianal fistula include fistulectomy, fistulotomy, advancement flap, gluing of the tract, anal fistula plug lift, waft, fistula closure repair, etc. In Ayurveda, on the basis of sign and symptoms, fistula in ano can be correlated with Bhagandara. The word Bhagandara literally means Dharana around Bhag, Gud, Basti Pradesh. The development of Bhagandara is proceeded with the formation of Bhagandara Pidika in Gud Pradesh. If proper treatment of Bhagandara Pidika is not employed, Pak occurs and result in Bhagandara. It is characterized by single or multiple opening around Gud. Generally, treatment principle described by Acharya Shushrita include Chedankarma of Bhagandara Marga, followed by application of Shar or Agni. Scope of the study: Bhagandara, if neglected or treated unskillfully, that may lead to creation of false tract or extension of the tract. The treatment should be anti-inflammatory, analgesic, and speed up the healing. Currently in Ayurveda, Sharasutra is used in the treatment of Nadiparan and Bhagandara. Subcutaneous fistula is a type of fistula in which 30% of the external opening is involved. So there is a less fear of incontinence in the internal sphincter. So Agnikarma in one setting is selected to avoid long hospital stay and to shorten the healing time. Coming to the case report, the chief complaints are a 38-year-old male came to OPD presenting with the complaints of pus discharge from boil present at anal region since 5 months, bleeding from the site of boil present at the perianal region. The patient had an history of chronic constipation. A detailed rectal examination was done. On the basis of detailed history and per rectal examination, patient was diagnosed as Raju Bhagandara. Agnikarma is indicated for Riju Bhagandara as per Shushrita. No any significant past surgical history of patient was present. In general examination, his build was moderate, height was 5'6", weight 65 kgs, blood pressure was 130 by 90 mm of Fg, pulse rate 82 per minute, respiratory rate 18 per minute, and pallor was absent. Per rectal examination, inspection, boil present at 7 o'clock with pus discharge. At PR, no dimple was felt. After probing, internal opening was felt at 6 o'clock and the tract length was about 9 to 10 centimeter. In investigation, CBC, RBS, CTBT and ESR was within normal range limits, while as HIV, SCV, VDLR and SBSAG were non-reactive. Methodology. After probing, internal opening felt at 6 o'clock. Tract length was about 9 to 10 centimeter. Then IV antibiotics and injection were given for 3 days. Sharasutra was inserted in the tract. Agnikarma was done on the fistula tract continuously during the changing of Sharasutra and gauze was kept. Sitz bath with Haridra Churna was advised. The result: the follow-up was taken for every 7 days until the complete healing of wound was taken place. Effect of this Agnikarma was observed that normally only the Sharasutra take at least 8 months to cut and heal simultaneously, but due to Agnikarma, tract cutting rate reduced to half than normal, pain also minimized and healing becomes more fast than usual. In conclusion, perianal fistula can be treated with Agnikarma to ensure its fast healing and prevents its reoccurrence. After Agnikarma, perianal fistula was converted into fresh wound through the deconstruction of healthy granulation tissue and fibrous tissue. Also, the inflammation and contraction of the site induced by Agnikarma initiated the healing process and fastened the healing. These are the references. Thank you.
Thank you, Dr. Harshada, for the energetic presentation. Next, we go to the paper and poster presentation. First for the paper. I would like to invite Dr. Ruduja Datta Damande for the paper presentation. I would like to invite Dr. Ruduja for the paper presentation.
Hello everyone. Today I will be presenting on the integration of Ayurvedic principles with modern insights for managing hypothyroidism. I am Dr. Rutuja Damande from PDA College of Ayurveda and Research Center in Pune. I will be covering how Ayurvedic frameworks intersect with modern endocrinology to offer the holistic approach to these increasing prevalent health problems. Hypothyroidism is a hormonal disorder due to insufficient secretion of thyroid hormones, primarily T3 and T4, and is usually diagnosed with elevated TSH. Patients often present with lethargy, unexplained weight gain, constipation, cold intolerance, and mood change, amongst other symptoms. While autoimmune thyroiditis, like Hashimoto's disease, is a leading cause, factors such as iron deficiency, dietary patterns, and specific stress are significant contributors. The incidence of hypothyroidism is rising due to the changes in lifestyle, eating habits, and chronic stress. These are the symptoms of hypothyroidism, which I covered previous slide. That is lethargy, cold intolerance, weight gain, water retention, and sluggishness. Ayurveda's analytical approach. Unlike modern medicine, organ-based classification, Ayurveda approaches disease through functional and systemic imbalance. There is no direct description of thyroid gland in classical Ayurvedic texts. Instead, diseases are analyzed in terms of imbalance in doshas, Vata, Pitta, and Kapha, as well as affected tissues, means dhatus, digestive and metabolic fire means Agni, and the state of body channels Srotas. This allows for a much broader root cause oriented approach to hypothyroidism. Kapha and metabolic slowdown. The clinical features of hypothyroidism, such as weight gain, lethargy, and chilliness, align closely with kapha doshas, aggravation described in Ayurveda. Kapha is defined by qualities like heaviness and coldness, much like the presentation in hypothyroidism. This is often linked to manda agni or diminished digestion and metabolism, resulting in accumulation of arm, means a toxic undigested metabolic byproduct. Arm block the body channels or srotas, leading to systemic sluggishness characteristics of the disease. Dhatu involvement and Med and Rasa. Firstly, from the Ayurvedic lens, two tissues are particularly implicated. First, Med Dhatu, which denotes fat tissue, and Rasa Dhatu, which represent the plasma and the lymph. When Med Dhatu is whited, we see symptoms like obesity and water retention, amplifying kapha effects. Rasa dhatu is crucial for nutrition and hormone transfer. Its improper formation, usually due to the impaired digestion, can disturb endocrine gland function, thus affecting the thyroid. So, hypothyroidism is not just an isolated gland problem but tied to systemic dhatu imbalance. The mind body axis and role of stress. The growing body of research links stress to the autoimmune thyroid conditions. Ayurveda recognized centuries ago that mental and emotional imbalance can interrupt Agni and the doshas, especially Vata and Kapha. Prolonged stress and diminish ojas, the essence of immunity and vitality, rendering the body more susceptible to chronic ailments like hypothyroidism. This highlights the importance of considering psychological wellness in thyroid gland, thyroid disorder management also. Many ancient cause of disease or nidan described in Ayurveda match modern risk factor for hypothyroidism. Overconsumption of oily, processed foods, inactivity, disrupted sleep, weak digestion, mental stress, systemic inflammation, genetic predisposition, they all contribute to the risk persistence of thyroid dysfunction. Aligning this correlation provide a comprehensive framework for both prevention and treatment. Galganda, Ayurvedic reference for thyroid problem. Although classical Ayurveda does not mention hypothyroidism, it describes gulgand, a swelling in the neck region which closely parallels the presentation of goiter. Gulgand arises chiefly from kapha and vat dearrangement. Is managed with specific herbs to balance these doshas. While Galganda does not capture all the aspects of hypothyroidism, it offers conceptual bridge to structural thyroid issue. Ayurvedic management plan. The Ayurvedic management of hypothyroidism is multifaceted. We begin by reviving digestive fire, Agni, that is, clearing toxics, that is, digestives and spices, herbs and formulations that lessen cough and may address the metabolism route. Liver supports is also vital because the liver helps convert thyroid hormones to their active form. Stress management, though rasayan herbs, massage, nasal therapies is essential to maintaining mind and body balance. I covered this in the slides. Agni Deepan and Ampachan, Kaphameda Shaman, liver support and stress management and rasayana. Dietary advice, lifestyle recommendation and panchakarma therapies. Diet and lifestyle intervention favoring warm or cooked food and regular activities support systemic health in selected cases. Panchakarma detox therapies are used to restore doshic imbalance. Last, I would like to conclude hypothyroidism is much more than a hormone deficiency. It's reflection of deeper metabolic and psychological and energetic imbalance. While Ayurveda use ancient principles such as Tridosh theory, Dhatu analysis, its approach is remarkably in tune with modern understanding of lifestyle related diseases. By integrating Ayurvedic diagnostics and therapies with contemporary screening and monitoring, we empower the most world for better health outcomes. Messages, holistic, individual care, integrating Ayurveda and modern diagnostics offers a comprehensive route to restoring the thyroid function and overall wellness. Thank you so much for patient listening.
Thank you, doctor. Thank you for the well explained presentation. One more poster presentation is there.
Hello, I am Dr. Rutuja Datta Damande, PG scholar, presenting on Viruddha Ahar, the unique concept of Ayurveda. Um, Viruddha Ahar refers to food substance which violates the doshas, dislodges them from their sites but don't expel them from the body. These cause a gradual accumulation of violated doshas leading to various diseases. Acharya have classified Viruddha Ahar into several types. First is Desh Viruddha, means unsuitable to place. Example, alcohol hot desert land. Kal Viruddha means incompatible with season or time. Example, ice cream during winter. Agni Viruddha, incompatible with digestive power. Example, heavy food in low digestive capacity. Matra Viruddha, wrong quantity of food. Example, excess ghee if digestion. Satma Viruddha, against habituation. Example, suddenly switching from vegetarian to non-veg diet. Dosh Viruddha, means aggravating doshas. Example, dry cold food in Vata disorder. Sanskar Viruddha, means improper processing of food. Example, heating honey or reheating the oil. Virya Viruddha, opposite potency combination. Example, fish and milk together. Then Pushta Viruddha, unsuitable to boil nature. Avastha Viruddha, unsuitable to person's state. Example, eating heavy food after exercise. Krama Viruddha, wrong sequence. Example, eating desserts before meal. Parihar Viruddha, ignoring rules. Means, example, consuming prohibited food with incompatible items. Upchar Viruddha, wrong therapeutic diet. Pak Viruddha, improper cooking. Example, half-boiled egg. Sayog Viruddha, wrong combination of food. Example, banana and milk together. Hriday Viruddha, dislike food combination. Sampad Viruddha, poor quality ingredients. Vidya Viruddha, against dietary rules. This wide classification shows that incompatibility can arise from preparation, time, combination, quantity, habit, and even mental acceptance. Where Viruddhahar is consumed repeatedly, it violates doshas. After that, dislodges them from their sides but doesn't expel them. So they stay inside and manifesting as the disease over the time. This explains why chronic incompatible diet slowly leads to serious disorders. Charak Samhita mentioned many diseases arising from Viruddhahar, like Shoni Drushti, means violation of blood, skin diseases, infertility, after that digestive disorders, even genetic defects in progeny are some diseases which are because of Viruddhahar. Modern parallel includes metabolic disorders, allergies, autoimmune conditions, and lifestyle diseases. Because of Viruddha Ahar, disease occur, then what should the management we do as a Ayurvedic Vedya? Avoidance of Viruddha Ahar primary steps, that is Nidan Parivarjan. After that, Shodhan means detoxification through Panchakarma to expel violated doshas. After that, Shaman Chikitsa means pacifying therapies. Use of Rasayana, rejuvenation therapies to restore balance. In Charak Samhita, Acharya Charak mentioned four main lines of treatment. First one is Vaman, that is emesis. Second one is Virachan, purgation. Third one is Nidan Parivarjan, that's avoidance of cause. Last is Pathya, means wholesome diet. In a summary, Viruddhahar is a powerful contributor to disease. Ayurvedic classics stress avoiding incompatible food combination. This concept is highly relevant today with increasing lifestyle disorders due to improper diet habits. By following Ayurvedic dietary principles, we can maintain good health, prevent disease, and promote longevity. Thank you so much for peaceful listening.
Thank you, Dr. Rutuja. Thank you for the well explained paper and poster presentation. Thank you so much, Doctor. Next is a paper presentation. I would like to invite Dr. Sagar Budaji Diore for the paper presentation. I would like to invite Dr. Sagar for the paper presentation.
Myself, Dr. Sagar Dore, third year PG student from Ashwin Rural Ayurvedic College, presenting paper on literature review on Sandhi with special reference to osteoarthritis. Introduction, Ayurvedic review. Ayurveda has given proper importance to tea for proper Shradha dharana. Explaining this phenomena, Ayurveda has defined that as the tree is only structured upon the roots within the same way, human frame is only established upon asti. All of the Sharir start to an exquisite extent are based upon proper functioning of asti. Sandhikatvat hampers the normal physical and social activities of individual. Vaddosha प्रकोप happen if the dhatu of Sharira reduce dhatu shajani or somarga of Vaddosha get obstruct orogeny which causes the shift stan sanshraya of Vaddosh in Sandhi Pradesh of the body. Next, Sandhigatvat is Madhyam Margagat Roga and it happens due to accommodation of Vayu in Sandhi Pradesh. In Sandhigatvat, Prokopitvat causes Sandhishur, pain during normal joints movement. In the Sandhi Pradesh, there may be issue in flexion and extension of joints. All of the function of Kupitvata may be visible in affected regions. Next, modern view. At present, osteoarthritis, a chronic degenerative inflammatory disease, is most common type of arthritis, which is one of the leading causes for pain, limitation of body joint movement in elderly person. Osteoarthritis, in terms of clinical features and pathology, is similar to Sandhigatvat, explained in Ayurveda classics. In osteoarthritis, significant inflammation and breakdown of articular as well as periarticular and cartilage happens causes the alternation in joint structures along with local swelling and pain at joints during daily routine activities. Knee, hands, hips, spine joints are usually affected in osteoarthritis. It has two types, primary, secondary. Primary has no known causes, but secondary osteoarthritis occurs due to another disease, deformity, injury, infections. Next, objectives. To review Sandhigatvat from various Ayurveda Sahitas. Second, to study and correlate Sandhigatvat with osteoarthritis. Material and methods. The literary resource for the existing have a look at was amazed by means of Ayurveda Sahitas like Charak Sahita, Shoshal Sahita, Vaishyaja Ratnavali. It will likely be correlated with the contemporary available books, literature, journals, websites, and study paper as according to the want of examining. Discussion, clinical signs, restricted movements, palpable, sometimes audible coarse crepitus, bony swelling around joint margins, deformity, usually without instability, joint line or periartical tenderness, muscle weakness or questing. As you can see from these pictures, pain, stiffness, tenderness, grating sensation, swelling, bone spurs are common symptoms of osteoarthritis. Next, examination. On inspection, the joint may be barely purple and there can be swelling of soft tissues combined with muscle wasting. There can be some warmness over the joints. The osteophyte across the joint can be palpable and the joint line itself is regularly tender to palpation. Movement will be markedly confined and crepitus can be both palpable and audible. Next, radiological features of osteoarthritis. Joint narrowing, osteophyte formation, subchondral sclerosis, cyst formation can be observed in affected joint X-ray. Next, treatment. Ayurvedic aspect. If Vata dosha occurred without any obstruction by other dosha, that is Pitta and Kapha, then the treatment procedure should be started by seven of Grut, Tel, Vasa, Majja. After proper snayana, application of Anuvasan Basti, Snigdhanasya, and dietary regime prepared with Sneha should be given to the patient. After proper snayana, application of Vata Tel should be applied in affected part by Vata dosha. After that, proper Svedana should be given to the patient. Third, after the application of above procedure, if the patient is not getting relief, then Mrudu Virechana can be given to the patient. If the patient is weak enough to undergo Virechana therapy, then in this kind of patient, application of Neurovasti is advised. Next, fifth, application of Navanasya Dhumpana is always advised in Vatvari patient. Sixth, if Vat dosh occurred due to obstruction of Pitta dosh, then the treatment procedure should be done in interchanging manner. That is, application of cold and hot substances. Process should be continued in regular manner. 7. If Vata dosh occurred due to obstruction of Kapha dosh, then treatment procedure should be done by application of Tiksha Svedana, Nirovasti, Vamana, Virechana, Grit, Til and mustard oil. Next, if the Vata dosh occur due to the obstruction of Pitta and Kapha dosh, then at first treatment of Pitta dosha should be done followed by Kapha dosh. Next, Ahara and Vihara. 7 of Grit, Tel, Vasa, Majja, Parishek, Abhyanga, Basti Prayog, Snehana, Svedana residing in place in which no direct contact of air means Nirvat Sthan. 7 of Mansaras, Dugdapan, Madhur, Amla, Lavan Dravyas should be indicated. Osteoarthritis unharmed herbs are Gugul, Rasna, Shigru, Laksha, Amlaki, Guruchi, Erand, Ashwagandha, Haridra, Vacha, Nirgundi, Haritaki, Bivitaki, Sunta, Pimpali. Next, modern aspect, osteoarthritis treatment without medication. First, rest. Arthritis symptoms are typically worsened by activity and are improved with rest. However, a complete lack of activity can lead to loss of muscle and joint stiffness. Second, weight loss. Obesity is strongly linked to development of arthritis of the knee. Weight loss may reduce the joint pain in weight-bearing joints such as hip and knees. Third, physical therapy and exercise programs. It improves flexibility and strengthens the muscle surrounding the joint. Orthoses. Orthoses are the devices that keep the joints aligned and functioning correctly. Next, assisted devices. Canes, walkers, assisted electric power, seat lifts, rest toilet seats, and tub showers bars can reduce the stress on joints and can make easier to perform daily tasks. 6. Heat therapy. Heat relieves pain and stiffness in arthritis joint. It can be applied to the joint with hot packs, hot water bottles, heating pads, or electrically heated mittens. 7. Cold therapy. Cold relieves pain in arthritis joints and reduces muscle spasm. Cold can be applied for short period using ice packs or coolant sprays. People with certain medical conditions such as retinal phenomena should not use cold therapy. Next, transcutaneous electrical nerve stimulation (TENS). A TENS unit delivers a mild electrical current to the skin, stimulating nerve fibers in the skin that may interfere with the transmission of pain signal from arthritis joints. Osteoarthritis treatment with the medication. Non-steroidal anti-inflammatory drugs, NSAID, relieve ache and reduce inflammation. Some of the non-prescription products which are to be had for treating arthritis are NSAIDs, joint injections. Sort of injections are used for human with arthritis, glucocorticoids injections. Injection of liquid referred to as hyaluronate. Next, conclusion. Clinical scientific point of view of Sandhi can be demarcated as osteoarthritis. The disease characteristics is very traumatic and tough for sufferers laid low with this type of alignments. The treatment modalities defined in Ayurveda and in modern must want right research based total evaluation in order that good results may be received in close to the destiny for the healthy gain of affected person suffering from this kind of illness. Is no later desires in addition dialogues so that a fruitful end may be acquired within the near future. Next, references come from Charak Sahita, Shushush Sahita, Village Loves, Short Practice of Surgery, Davidson Principles and Practice of Medicine. Thank you.
Thank you, doctor. Thank you for the delighted presentation. Next, I would like to invite Dr. Rajashree Mane for the paper presentation. Next, I would like to invite Dr. Rajashree Mane for the paper presentation.
Good evening everyone. I am Dr. Rajashree Mane, PG student from the Department of Rog Nidan एवं विकृति विज्ञान, College of Ayurveda and Research Center, Nigadi, Pune. Today I am going to discuss a topic which is scope of Rog Nidan in public health screening and Ayurvedic model. Public health screening is an essential tool for early detection and prevention of disease in large populations. Ayurveda, with its robust diagnostic foundation known as Rog Nidan, emphasizes early identification of disease tendencies through personalized non-invasive method. Rog Nidan includes Nidan Panchak, means Hetu, Purvarup, Roop, Vishay, Samprapti, means causes, early signs, symptoms, therapy response and disease process. In Ayurveda, there are some examination methods which are Ashtavid Pariksha, Dashavid Pariksha. Ashtavid Pariksha include Nadi, Mala, Mutra, Jiva, Druka, Shabda, Sparsha and Akruti, while Dashavid Pariksha include Prakruti, Vikruti, Sarata, Sahanan, Desha, Kala, Bala, Sattva, Satmya, Ahar Shakti and Vayam Shakti. With the help of these tools, we can diagnose the disease early. For this screening, we can target group of children, adult and elderly, and we can do screening from the following step. First, Prakruti analysis can be done. Then we do Nadi Pariksha, means pulse examination. Then we do Jiva Pariksha, means tongue examination. Then identification of Hetu and Purvarup will be done, and at last Dashavid Pariksha can be done. Here is an example is given. We can arrange a camp in semi-urban area. Through the above methods, we can find the high Medoroga risk in sedentary people. From this study, we can advise people lifestyle changes so that occurrence of disease will control. Here are some advantages of Ayurvedic screening. First, it helps in early detection of imbalance. Then it is low cost and non-invasive method. Then third is it is personalized and preventive method. And last, this is culturally acceptable. Discussion. Rog Nidan, the way Ayurveda diagnose disease, can be very helpful in public health screening. Modern methods often find disease after they started, but Rog Nidan help to find problems before symptom appears. Ayurvedic methods like Nadi Pariksha, Jiva Pariksha, Prakruti Pariksha help to detect small changes in the body that may lead to diseases like obesity, diabetes or stress related issues. This matches the Ayurvedic idea of spotting, Purorup and Samprapti. And also important is it is useful in school and villages. It gives personal health advice. For this, of course, we need a standard method and trained staff. It supports WHO's vision for traditional medicine. And here are some references of this topic. Thank you so much, respected faculties, organizers, and my colleagues, for giving me this opportunity and listening peacefully. Thank you.
Thank you, Dr. Ashley, for the insightful presentation. Next, we go to another paper presentation. I would like to invite Dr. Mrinali Salubadahake for the paper presentation. I would like to invite Dr. Mrinali for the paper presentation.
Good evening, everyone. Myself, Dr. Mrinali Dahake, PMS Scholar, Department of Kai Chikitsa, Ashwin Rural Ayurvedic College, Manchil, Sangamer. My topic is Rudro. Abstract. Hridaya is the synonym for the word heart in modern medicine. Increasing cardiovascular diseases are increasing in today's era due to change in lifestyle modifications and stress. Hridaya is the mool of Rasavaha and Pranava Strotas. Dushti of these two leads to Hridrog. Introduction. Hridrog is a disease of marma which controls many vital activities. Hridrog is observed in very young age today. Hridrog is one of the diseases mentioned in Ayurveda where the description is quite brief and the Ayurvedic point of view needs clarification. Definition of Hridrog, Nidan Samprapti pathogenesis Chikitsa has been described in Charak Samhita. According to Sushrut, any condition which produces disturbance in the heart is called as the Rudrog. Rudshul has been described separately in 42nd chapter of Sushrut Uttar Tantra entitled Gulma Pratishedh Adhyay. Hridaya is one of the place for Gulma also. Materials and methods. This article is based on the Ayurvedic literature, various modern textbooks and useful websites. Classification of Rudrog. As per Ayurveda, according to Charak, Madhav Nidan and Ashtanga, Rudra is divided into 5 types, classified into 5 types. Sushrut has classified into 4 types: Vataj, Pittach, Kapash, Tridoshaj, and Krimich. As per modern literature, cardiovascular diseases are a group of disorders of the heart and blood vessels. They include coronary heart disease, diseases of the blood vessels supplying the heart muscle, rheumatic heart disease, damage to the heart muscle, and heart valve from rheumatic fever caused by streptococcal bacteria. Peripheral arterial disease, diseases of the blood vessels supplying the arm and leg. Cerebrovascular disease, a disease of the blood vessels supplying the brain. Deep vein thrombosis and pulmonary embolism, blood clots in the leg vein, which can dislodge and move on the heart and lungs. Congenital heart disease, birth defect, an effect of the normal development and functioning of the heart caused by malformation of the heart structure from birth. सामान्य लक्षण वैवर्ण्य मूर्छा ज्वर कस हिक्का श्वास आस्य वैरस्य तृष प्रलाप मोह छाया कफोत्क्लेश रुजा रुश्चीय रुद्रोगजः. discoloration of the skin, fainting, fever, cough, hiccup, dyspnea, unpleasant taste in mouth, excess thirst, confusion, unconsciousness, vomiting, nausea, and distress, pain, anorexia are various symptoms manifested in patients suffering from heart disease. Vatash Rudra, symptoms in this Vat is dominant, Vapetu, Veshtana, Stamba, Brahmoha, Shunyata, murmur. Murmur sounds are seen mostly in Vatash Rudra. And chest pain is also seen. Pittash Rudra, symptoms are mostly Pitta dominant, Raddaha, Klama, Trishna, Murcha, Brahma, Svedana. Kapha Rudra, the symptoms of Kapha dominant are seen Sputana, Stimitata, Bharikam, Tandra, Aruchi. Tridosha Rudra, the etiological factors and symptoms of all the three doshas, Vatas, Pittash, Kapha, are seen in this disease. Krimish Rudra, the symptom of Krimish Rudra dominant are Krimi. Svabhavichari, krimis are also seen. The patient of Krimish Rudrok feels severe pain in the pericardial region. Krimish Rudrok is very grave heart condition and may lead to immediate death. Samprapti. In the presence of etiological factors, the dosha get vitiated and take refuge in heart, create Rudrok by vitiating rasa, which is housed in Hridaya. There is some debate about whether the ras becomes vitiated once the dosha invade Hridaya or before given the Hridaya is the seat of rasa. It makes sense to agree that ras becomes vitiated once the vitiated doshas get to the Hridaya. It also feasible to translate the text in Viguna. The presence of etiological factors lodges in the Hridaya, then it destroys the Rasadhatu in the Hridaya, which leads to the Rudrok. Samprapti Ghatak, Dosha, Vatadi Tridosh, Dushya, Rasadhatu, Medadhatu, Strotas, Rasavaha, Pranavaha, Adhishtana, Rudaya, Strota Dushti, Sangha, Swabhava, Chirakari Swabhav Vyadhiचा, अग्निदृष्टी अग्निमांद्य साध्य असाध्य याप्य व्याधी सामान्य चिकित्सा हृदय महाकषाय include आम्र आम्रतक लकुच कर्मर्द आम्लवेतस दाडिम मातुलुंग special treatment for the Vataj Rudra oil suvirak mastu buttermilk along with salt to be consumed in lukewarm water decoction Kvat prepared from Punarnava, Devdaru, Panchamul, barley, bilva, kulatta are used. Medicated ghee prepared with paste of haritiki, shunti, pushkarmul, kuduchi, amlaki are used. Beneficial drugs, trikatu, tripala, kantakari, gokshur, pittaja. Beneficial drugs are Shri Virga, Madhur lotus, Kafaj Rudra, decoction of Udumbara, Arjuna, Palasha, Vata, Rohitaka, beneficial drugs, Katafala, Shunti, Daru Haridra, Haritiki, Sannipatach. Firstly, Langan. Langan is the main treatment for Sannipatach Rudrok. Diet and treatment of the three doshas is required. Conclusion. Heart disease of or Rudrok is a term covering any disorder of the heart. Everyone should have brief knowledge about this. So this article is explaining heart disease in a very scientific way by covering its Ayurvedic view as well as modern explanations. References are taken from Agnivesh, Sushrut, Charak Sahita, Madhav Nidan, and cardiovascular diseases of the modern textbooks. Thank you.
Thank you, Dr. Manali. Thank you for the presentation. Next, I'd like to invite Dr. Jaihind Ramling Chowdhury for the paper and poster presentation.
Hello everyone, myself Dr. Jahind R. Chaudhary. I am PG scholar from subject Ayurved Samhita Evam Siddhant. My college name is PDS College of Ayurved and Research Center Nigdi, Pune. My guide name is Dr. Sangeeta More. Today I am presenting a case study on an Ayurvedic management of Vata Shirashul. So Shiras is considered as Uttamang according to Ayurveda. It's included in one among the three marmas and also Dasha Pranayatana. Diseases related to head as explained in Ayurvedic classics. Vata Shirashul is one among the Shiras Rogas explained by Charak, Shushruta and Vagbhat. Acharya Charak has explained Nidan of Vata Shirashul such as Upavas, Shok, Bhaya, Tras, etc. Vata Shirashul is correlated to tension, headache, which accounts for nearly 90% of all headaches. Tension headache is related to stress, depression and anxiety. Here, a case of Vata Shirashul successfully treated with Ayurvedic management is recorded. A female patient, aged 42 years, approached the OPD with complaints of headache since 6 months. The site of the headache was on forehead and vertex region, which was a dull ache which was continuous throughout the day with same intensity. The symptoms increase on stressful situation which she faces due to her family conditions and if sleep is disturbed. She obtained relief on rest, hot beverages like tea or coffee, or an head massage with warm oil. She consulted many physicians for which painkillers were prescribed, for which temporary relief was obtained. For better management and for which temporary relief was obtained. For better management of the pain, the patient come to relevant past history and no similar complaints are found in the family. Chief complaints: pain in both temporal region of head, reduced sleep, anxiety, Shirogaurav, Karnashul on and off, Brahmavat Lakshan on and off. So in Nidan, excess intake of spices food, ultimately intake of food, Ratri Jagran and stress. General examination, general condition good, respiratory system clear, severe CNS per abdomen, BP, pulse were absolutely normal, Prakruti, Vat Pittaj. In Darshan Pariksha, no any abnormality seen. Samprapti Ghatak, Dosh, Vat Pitta, Dushta, Rasa and Rakta, Agni, Tikshna, Srotas, Rasava, Annavaha. Due to Nidan 7, causes increases in Ruksha and Ushna Guna, causing vitalation of Vat along with Pitta, which resulted in Rasakshaya and Shirashul. In treatment, Shadbindu Tel, which contains Bharangi, Erandmul, Tagar, Soy, Jivanti, Rasna Patra, Sendavlavan. Nasya of 3 drops in each nostril at empty stomach, Abhaktakal for 15 days given. Shunti leaf at forehead region twice a day as Sanic Chikitsa given for 15 days. Trifada Churna 2 gram with Koshna Jal at before bedtime at Shaman Chikitsa for 28 days. Results: after 1 week of Nasya Lep and Shaman Chikitsa, patient showed a significant amount of changes in condition, pain and reduced patient was getting sound sleep. Discussion: in this present case study, patient got considered difference from the symptoms. The patient is having headache. It is relieved by tight bandages using massage around the temporal region and scalp. So This could be concluded as Vata Shirashul. By assessing the etiology of Vata Shirashul, it could be correlated with tension headache, as the patient was having heavy work tension in his office, which ultimately makes her to skip her food frequently. Along with Vata Anubandha, doshas involved is Pitta. Nidan can lead to a Rukshaguna Vriddhi, which may cause Vat Prakop. Since the Anubandha dosha involved in Pitta, we should pacify Vat and Pitta at same time, and we should also take consider about the Nidra, sleep, and also the constipation. Considering all these factors, Nasya Yog prescribed here was also Vatar and Shulagna. Shunti also work as Vatar. Trifala is Tridoshagna, which reduces symptoms like constipation, improves digestion. Conclusion: in Shad Bindu Tail, there are 7 ingredients, which all are Vatar and Shulagna. Shunti lep also reduces headache, and Trifala also helps to reduce symptoms of Shirashul. Hence, there is a marked improvement in the case of Shirashul patient and had complete relief in headache, anxiety, and reduced sleep.
Thank you, Dr. Jehin Ramling Chowdhury. Thank you for the commendable presentation. One more poster presentation is there.
Hello everyone, myself Dr. Jain R. Chaudhary. I am presenting a critical review on Pravicharna Sneha in poster form. My guide is Dr. Sangeeta More, Associate Professor from the Institute of PDS College of Ayurveda and Research Center, Nigdi, Pune. So, the need of study based on route of administration. Snehan is categorized into 2 types: Abhyandar Snehana, that is internal administration, and Bahya Snehan, external application. Abhyandar Snehan can be further divided into Acha and Vicharna. It is also classified based on its purpose: Shodhananga Sneha and Shamananga Sneha, and Bruhananga Sneha. Vicharna Sneha, a specialized form of administration by blending Sneha with various food articles and using it in external therapies, is used for individuals who cannot tolerate large quantities of oil or have an aversion to it. In such cases, Sneha is administered in small dis, uh, disguised dose, often mixed with food or medicines to make it more tolerable. So methods. In methods definition, Pravicharna is application or administration of avacharana of sneha along with different kalpas. In vicharna, V shabda refers to ishad matra, little quantity. Reason for calling vicharna is because of use of alpa matra sneha, and it is using with other food entities. Synonyms: pravicharna given by Charak and Vagbhat, Shaman Sneha by Sharangdar, Sabhakta Sneha given by Shushruta. Introduction. Indications: Charak have given Sneha in conditions like Snehadveshi, Snehanitya, Mrudukoshti, Kleshhara, and Madhya Anitya. In Ashtang Hruday, Bala, Vruddha, Pipasatra, Snehadveshi, मध्यशील, श्रीसेवी, नित्य आसेवी, मंदाग्नी, भीरू, मृदुकोष्ठ, अल्पदोष, and in उष्णकाल. In काश्यप संहिता, स्थूल, अतिदुर्बल, पिपासा, अजद्वेषी, अरोचक, क्षुधा Routes of administration: oral as ओदन, विलेपी, मांसरस, पय, दधी, यवागु, सुपशाक्त, युष, कंबालिक, खड, सुक्त, तिलपिष्ट, मध्य, लेप, भक्ष. At skin, अभ्यंग, on eyes, अक्षितर्पण, for ears, कर्णतर्पण, nose, नासातर्पण, and in through rectal, basti. Vaginal, urethral, cervical, uttar basti. Time of administration according to Dhallan, Nitya Kala and Avastika Kala. So image at bottom shows the dosage, that is matra, that is Uttam matra, Madhyam matra and Kanishta matra. Indications for the individual in next column, and indications in disease, it is further column, and actions in the last column. So types of vicharna. Acharyacharak has given Abhyantara as Odan, Vilepi, Mansaras, Payas, Dadi, Yavagu, Supashak, Yusha, Kambalik, Khada, Saktu, Tilapishta, Madhya, Leha, Bhaksha, बाह्य, अभ्यंग, बस्ती, उत्तर बस्ती, गंडूश, कर्णतैल, नस्यतर्पण, अक्षितर्पण, कर्णतर्पण. Acharya Kashyap has given Odan, Vilepi, Mansaras, Kshir, Dadi, Yavaku, Kambalika, Supa, Yusha, Peya, Ashana, Bhaksha, Vikruti, Urdhva Karma, Adha Karma, Khala, Abhyanga, Netra Tarpan, Vadana, and Karnapurna. Rasa Pravicharna, based on properties of doshas involved in sneha, is mixed with all rasas and separately will make 63 formulations according to Vagpat and Charaka also. So Rasa Pravicharna with single rasas 6, with combinations of 2 rasa 15, with combination of 3 ras 20, with combination of 4 rasas 15, with combination of 5 rasas 6, with combination of 6 rasas 1. So in discussion, the concept of pravicharna is a unique and versatile approach to administration of sneha in Ayurveda. Unlike the rigid protocols of Achyapan, pravicharna allows practitioner to adopt the administration of the comparison with Achya. Sneha provides valuable insight into difference in dosage, palatability and suitability. While Achyapan is often referred in case requiring strong purificatory effects, pravicharna is more inclusive, catering to individuals who cannot tolerate large dose or unmodified medicated fats. Administering sneha along with food as a pravicharna ensures better patient compliance and digestibility. A noticeable aspect of pravicharna is its potential to blur the lines between shaman and shodhan sneha. While it aligns more closely with shaman principles, it is not bound by strict rules of shaman sneha, allowing greater versatility in its application. As few studies gives the positive evidence towards the application of vicharna snehan as Shodhananga Snehapan, this opens avenue for innovation in treatment, combining therapeutic and nutritional aspect to achieve desired outcomes. So references: Dalan commentator of Shushunu Sahita, then Charak Samhita by Agnivesh, revised by Charak and Dedbala with Ayurveda Deepika commentary. Sutrasthan 22nd chapter, Shlok number 4. Then again Charak Samhita, revised by Charak and Dedbala, and commentary of Chakrapani Datta. So reference is from Sutrasthan 16th chapter, Shlok number 23. Then again next reference is of Paradkar Vaidya, Sutrasthan 16th chapter, Shlok number 16 of Ashtang Hridaya. Next reference is from Panchakarma Tattva, first edition of Charak Samhita, page 112. Next reference is of Acharya Trivikramji, Chakrapani Datta Tika, Sutrasthan 16th chapter, Shlok number 82. Thank you.
Thank you, Dr. Jagan Chowdhury. Thank you for the enlightening paper and post presentation. Thank you so much, Doctor. Next is another paper presentation. I would like to invite Dr. Kavita Balasahib Argade for the paper presentation. Dr. Kavita Balasahib Argade for the paper presentation.
Good evening everyone, respected faculty members and my colleagues. I am Dr. Kavita Balasaheb Argade, PG Scholar Rog Nidan एवं विकृति विज्ञान Department of CRC College of Nigdi, Pune. Today I am going to present my paper on role of Ayurveda in mental health, management of depression and anxiety. In this paper, I will explain how Ayurveda helps to understanding, preventing and managing these mental health conditions. Depression and anxiety are common mental health problems today. Ayurveda uses natural methods like herbs such as ashwagandha, brahmi, yoga, meditation and therapies such as Shirodhara, Nasya to balance mind and body. These methods help to reduce stress and improve mental health. Depression and anxiety are common mental health problems today. Many people take medicine to feel better, but these can have side effects. Conventional treatments, including antidepressants, can be effective, but often come with side effects, risk of dependency, and incomplete or temporarily relief. This has led to a growing interest in complementary and alternative system of medicine, including Ayurveda, which offers a holistic approach to health and well-being. In Ayurveda, the traditional system of medicine practiced in India, balance of body, mind and spirit. The attribute mental disorder to imbalance in three doshas, such as Vat, Pitta, Kapha, disturbances in the Mansik Gunas, Sattva, Raja, Tama, and weakening of Ojas, the essence of immunity. In Ayurveda, depression called as Fissure and anxiety called as Chitta Udvek, and these both caused by imbalance in the body energy, that means doshas. The study was based on Ayurvedic textbooks like Charak Samhita, Ashtanghrudayam, Sushruta Samhita, along with selected interventions such as herbal medicines like Ashwagandha, Brahmi, Jatamansi, medicated oils or ghees like Kalyana Ghrut, Brahmi Ghrut, Panchakarma therapies like Shirodhara, Nasya, Abhyanga, psychological treatment, that means Sattva Chikitsa, and also reviewed clinical studies and research from reputed journals. From Ayurvedic conceptualization, depression is primarily associated with Kapha and Tama doshas imbalance, anxiety aggravated Vat and Rajas. Both conditions are recognized as Manas Rog and addressed through Tridoshas balancing and Sattva Chikitsa. The therapeutic interventions and outcomes. Ayurvedic herbs like Ashwagandha, Brahmi, Shankapushpi, Jatamansi helps to reduce stress, improve memory, enhance mood and stabilize emotions. While Panchakarma therapies like Shirodhara, Nasya improve sleep and boost mental well-being. Lifestyle practices such as yoga, pranayam, sattva chikitsa enhance emotional stability. Ayurveda sees depression and anxiety as imbalance in body energies and mind qualities. Herbs, Ashwagandha, Brahmi along with therapies like Shirodhara, Abhyanga, yoga, meditation help calm the mind and improve mood naturally. Modern medicines that may cause a side effect. Ayurvedic method work slowly but offer long-term benefits without dependency. Conclusion. Ayurveda offers a natural and holistic approach to managing depression and anxiety with the use of herbs, therapies like Panchakarma and mind-straightening practice such as yoga, meditation. It helps bring balance to both body and mind. It focuses on long-term healing with fewer side effects and promotes overall mental well-being. And here is some references regarding my topics.
Thank you, Dr. Kavda. Thank you for the paper presentation. Next, we go to the poster presentation. I would like to invite Dr. Prasida S for the poster presentation related to Stanya Pariksha. I would like to invite Dr. Prasida S for the poster presentation.
Okay, procedure. Today, I am here to present Kanya Pariksha, original unveiled finance planning. As we all know, August first week is celebrated as the world's best evening. Every year, to promote inclusive breastfeeding. Since it is important to care mother and child. Anyway, there was an rituals it is planned rather than that the breastfeeding is the foundation for lifelong health, development, and engagement. And how it is helpful to mother with its only advance about regarding the early breastfeeding. So other than that, actually the obesity and lower the risk of ovarian and breast cancer, diabetes are the three. Ayurveda is based upon the prevention of disease and maintenance of health. Remaining classes is clearly making about the importance of timing with this Kadakol of the rest. Also, the quality of our IT blood, that is the Shradha and Shradha. One of the lectures of Shradha is mentioned that it is Samprapti motivated as that she is Russian. And to do this, Vrana can be defeated by one of the events. And this the characteristic features of which like Naga, Shava, Yogita, Dushta, Neha, then Tamla Rasa, Paradasa, and Hava, which is actually the Korean. And Pichilava is more and Hava, which we get Brazilian and that. And this would be tested by the inbuilt method. It's mentioned in our classic. The that is by pouring a drop of breast milk over a quart of water. It is pretty dissolves completely. So that increases good health and provides machine nourishment, the nutrition that is good for nourishment. This single method for the quality of breast milk. It is not an issue that it works of water into the produce their own life and about protein. Because it was going out, I don't the film period is a gold standard that covers all waves of people, including symptoms. And this standard is to really have problem adversely affect the health and life of the and thus the identify of the quality of investment is pretty important. And this benefit is by doing these there is an initiative in the breast we can correct it by giving appropriate treatment based on the watches. Let's together let them others they can provide it with the stamina of our babies. Let them grow more healthy for a better income.
Thank you, Dr. Prasida. Thank you for the presentation. Next, we go to the paper presentation. I would like to invite Dr. Dinesh B for the paper presentation. I would like to invite Dr. Dinesh for the paper presentation.
Namaste, my name is Dr. Dinesh B. Varwadia. Today I'm going to present my synopsis topic titled with a review on Parikartika Vyadhi and its Ayurvedic management protocol. This work is planned under my guide Dr. K.H. Pachinawar sir and my co-guide Dr. Akshay B. Ganachari sir. These are the contents of my study starting from the introduction till bibliography. So in the introduction to Parikartika it is a Vyadhi of very painful condition with cutting pain and burning anal region. In Ayurveda, it is mentioned as complication of disease of Vata Jvara, Arsha, etc. as described as Kartanavat Shula, Daha and Anila Sangha. And in modern study, it is correlated with Fissure in ano, a tear in the lower anal canal with severe pain, burning, itching and blood discharge. So need for the study is it causes severe pain and bleeding during and after defecation. It may be acute or chronic. So conservative care are like stool softeners and ointments, but it has high recurrence rate. And surgery like anal dilatation, sphincterotomy, fissurectomy, etc. Causes fecal incontinence in few conditions and with severe pain and hematoma. And in Ayurveda, like Anvasana Basti, Pichu, Parisheka, Lepa, and Sneha Dravyas are safer and effective. So the current study is planned for comparing Lajalu Taila Pichu with Estimadu Taila Pichu. So as Pichu method is safe, shorter duration, and better local effect with minimal complications. Coming to the aims and objectives is to study Parikartika and acute fissure in ano and to evaluate the efficacy of Lajalu Taila Pichu and Estimadu Taila Pichu in the management of Parikartika with special reference to acute fissure in ano and comparing both the groups. So literature review was done, like studying Acharya Sushruta and Charaka's Parikartika and its complete literature, where it is a complication of Basti and Virechana. Its details are studied. Acharya Kashyapa described Parikartika and its types of Garbhini Chikitsa. In modern, it is correlated with Fissure in ano. The drugs selected are Lajalu Taila for Group A and Estimadu Taila for Group B. Here, both the groups will be receiving Taila Pichus and number of patients will be 30. The total duration of it will be 10 days. Lajalu Taila is described in Charaka Samhita as Sandhaniya and Purusha Sangaraniya. Shushu Samhita as Priyangvadi and Ambashtradigana. Priyangvadi in Vagbhatas. Parpatadi Varga, Aushadi Varga, Guduchadi Varga, and Babuladi Varga in other Samhitas. Estimadu Taila is mentioned in Ashtanga Sangra of Vagbhata, Shushuta Samhita Sutrasthana, and Shushuta Samhita Chikitsasthana. So materials and methods literature review will be studied. Samples will be taken from diagnosed cases of Parikartika in our OPD and IPD of Shalyatantra Vibhaga in Inchal College, Sri Shivagishwara Rural Medical College. Diagnostic criteria will be like diagnosis will be based on clinical evaluations like Lakshanas like Kartanaut Shula, Daha, Kandu, and Shonita Srava. Inclusion criteria like both the gender patient will be taken irrespective of religion, occupation, social economic status. Patient diagnosed as Parikartika with age from 20 to 60 and known case of HTN and diabetes under control. Exclusion criteria will be patient below 20 years of age and above 60 years of age. Patients of Parikartika like Rectal carcinoma, ulcerative colitis, Crohn's disease, and TB will be excluded. Uncontrolled HTN and diabetes will be excluded. Patient who are diagnosed of HIV, HbSAg will be excluded. Hypothesis is null hypothesis will be stating that the difference between the efficacy of Jalaukavacharan and Estimaduthala in the management of Parikartika is not statistically significant, whereas the alternate will be it is statistically significant. So the plan of the study, as I told, these are the design. Technique will be as explained. Sample size will be 30 subjects of Parikartika for both the groups. Investigation like CBC, RBS, HIV, HbSAg, CTBT will be done. Ethical clearance will be obtained. Statistical tests will be calculated. Assessment criteria like subjective parameters are pain, bleeding during defecation, ulcer in ano, and will be graded like 0, 1, 2, 3. These are the grading criteria. And objective criteria will be 2, sphincteric spasm and size of the ulcer with grade 0, 1, 2, 3. These are the criteria. Oral assessment will be done like cured, moderate cured, mild cured, and no relief. Pilot study was conducted on 5 patients. So it was found effective. Both the tail pitches were found effective. So the thesis is planned. Treatment procedure is under aseptic precautions. Gauze will be impregnated with Jalaukavacharan and Pichu will be placed for group A patient, and gauze with impregnated with Estimaduthala will be placed for group B patients. Assessment will be done before treatment on first day, after treatment on 10 day, after follow-up on 30th day. So there will be duration is 10 days of intervention, 20 days of follow-up, total 30 days of study. So these will be the bibliography references. Thank you.
Thank you, Dr. Dinesh. One more paper presentation is there. Once again, I would like to invite Dr. Dinesh B for the another topic paper presentation.
Namaste. My name is Dr. Dinesh B. Varvadia, and I'm going to present a topic on Gudabramsha, a rectal prolapse, its conditions, causes, symptoms, and treatment in both Ayurvedic and modern management. Thanks to my guide Dr. K.H. Pachinavar sir and my co-guide Dr. Akshay Biganachari sir for guiding through my PG studies. The Gudabramsha, it is explained as displacement of Guda from its normal site. It is considered under Kshudra Roga in Shushruta Samhita Nidana Sthana. So, as explained in Shoka, the causative factors are excessive straining during defecation, loose motions or diarrhea, excessive cough, urinary flow obstruction, and hemorrhoids may be the causative factors. So, Lakshanas of Gudabramsha are Nirgachati Gudam Bahir. So, protrusion of Guda, that is rectum, outside the anal opening is called as Gudabramsha. Coming to types of rectal prolapse, there are two types. One is partial rectal prolapse and complete rectal prolapse. In partial rectal prolapse, only the mucosa is prolapsed, whereas in complete, all the rectal layers are completely prolapsed. Coming to partial rectal prolapse, protrusion of mucous membrane alone, and the anal thickness, the protrusion thickness comes from 1.25 to 3.75 outside the anal walls, and occurs in children from 1 to 3 years of age and old age people. Only the mucosa and submucosa will be prolapsed in partial prolapse. Coming to complete prolapse, protrusion of all the layers of rectal wall, and protrusion will be more than 3.75 centimeters in length. It is usually uncommon in children, but more common in elderly, whereas female to male ratio is 6:1 ratio. Entire bowel can be palpably complete prolapse. Etiopathogenesis of rectal prolapse is in infants. It occurs due to direct downward course of rectum, due to undeveloped sacral curve, reduced anal musculature tone, and diminished support of mucosal lining. And in children, it is caused due to excessive straining, diarrhea, whooping cough, loss of weight, and reduced fat in ischiorectal fossa. Fibrocystic disease, neurological deficit, and maldevelopment of pelvis can all be the causes of in children for rectal prolapse. Coming to adults, associated with third degree hemorrhoids and atonicity of sphinctering mechanism, tone perineum in females, straining due to urethral obstruction in male, and patients followed by surgeries of fistula in ano, fissure in ano, or hemorrhoidectomy are all patients to whom rectal prolapse may cause. Coming to clinical features of rectal prolapse, mass or large lump through anus protrusion, and it should be pushed back after defecation. Here, fecal incontinence, difficulty in bowel regulation, discomfort, sensation of incomplete evacuation, and tenesmus are the common clinical features. Next, sensation of chronic moisture and mucosa drainage in perineal area, chronic prolapsed rectal mucosa, permanently extruded and ulcerated, leading to mucosa discharge and bleeding. Coming to examination for confirming rectal prolapse are, by inspection, a visible prolapse mass is seen. Pustulous anus with lax mucosa of anal orifice is seen. From anal orifice is seen. Prolapsed mucosa membrane is pink colored. Coming to the palpation, reduced sphinctering tone can be felt, increased size of anal orifice, reduced contractual power of anal musculature, protrusion of mass occurs while straining. Ayurvedic management of rectal prolapses are like after snehana and sevadana, the protruded guda is gradually pushed back to its normal position. Then Gopana Bandha having an opening is applied. Then medications like Panchakshiri Kashaya, Abhyarishta, Mushaka Taila, Changeradi Gruta, Chavyadi Gruta, Pipalyadi Anvasana Basti, Gruta with Madhura and Amla Rasadravas are given. Coming to the allopathic management of rectal prolapses, partial prolapses, in partial prolapse, conservative treatments like digital reposition, submucosa injections, and in operative procedures like Fissure's procedure, excision of mucosa. And in complete prolapse, fixational procedures like Wells operation, rectopexy operations, rectal sling operations can be carried out. Whereas in resection side, anterior resection of the rectum, perineal rectosigmoidoscopy, operations of pelvic floor and perineum can be carried out. So these are the patients who had rectal prolapse, and post procedures it was cured. Thank you.
Thank you, Dr. Dinesh, for the well-explained paper and poster presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Vidya KM for the paper presentation. I would like to invite Dr. Vidya KM for the paper presentation.
Namaste. Myself Dr. Vidya KM, second year PhD scholar, MVR Ayurveda Medical College, Kannur. Today's topic is the rainbow of risk artificial colors, Agandra Precipice on food colors. Colors is one of the major indicators for the expectance of food. That means colors of dangerous. These are the index which I am going to dealing about next slides. First one, introduction. Artificial food colors are chemical substances added to food, beverages, and cold soda drinks to enhance the color. The additives play a significant role in the food industry. Historical background. The use of colorant in the food synthetic dyes began in mid-16th century. A chemist, William Henry, accidentally discovered the first synthetic dye in 1856 while attempting to synthesize curing for malaria treatment. There are type of colors, natural food colors and artificial colors. The natural derived from plants, animals, and minerals. Example, turmeric, beetroot, and chlorophyll. In artificial colors, they are chemically manufactured. Actually, in this slide, we can see the multicolor cake. Usually, we start the all functions by the inaugurating the cake cutting. What is the colors means? In this, yellow is telling about the tartrazine, color 5, erythrocene in red, brilliant blue, the candle which are using the paraffin wax. Then there will be silver gold foil. It is the metal content and also the preservatives. Actually, these all colors which described is not permitted to food colors, but all chemicals is adding the foods. These are the natural colors which we use daily. It is riboflavin, carmine, lutein, beetroot red. These are natural colors. They have the permissible limit mg per kg weight. If your curcumin is good medical action, but if it is exceed more than 15.75 mg per kg weight, there will be show some health issues. We can go for the synthetic color. In these colors, tartrazine, sun yellow, aurora red, brilliant blue. If these containing the canteen tricks, chips, ice cream, cereals, soft drinks, jam, ice pops, sweets. So while taking the kids, this is consuming daily wages. It will be cause the allergies, ADHD, allergies of stomach upset, DNA damage, cancer, kidney tumors, and behavioral effect in children, also in adults. ADHD is the mental issues or psychiatric issues, the brain issues, seeing nowadays in more children showing the hyperactivity and educational disabilities like that. This is the picture showing rhodamazine B, potent cancerogenic chemical, which is using for gobi manchuri and cotton candies. This already banned by Karnataka government. By seeing this, all kind of communities poisons are, according to Agadandra, that is in Ayurvedic recipes, it is considered as a doshi visha because it is Chakrapani as told as Kalantara Pragopi. That means it is after it is by taking these poisons, it won't be shows any health issues, but because of it is avarana by kapha. When it is getting in Agandra positives, when the poison is acting with doshidam desha kala anna devasopni rabishnaha ismat doshede dadun tasmat doshi visham smadam. That means by acting with uh, environmental lifestyle choice, consumption of certain substance due to environmental factors, this all things is converted into poisons, and it will be act as a catalyst factor, accumulative effect, subtarsal symptoms, long-term consequence. That means dosha build up the body over time, often without immediate symptoms. So it will be masked as making it difficult to diagnosis. But pronorum exposure of dosha can to chronic disease or health issues. Hence, the potential view of dosha accumulation is like environmental toxins, lifestyle factors, and food additives. Here we are discussing about the food additives. Dosha effect on the body. Acute effect will be shown as hypersensitivity, excessive sleep, heaviness, yawning, laxity of joint, horripilation, and body ache. If it is a long-term consuming, can convert as a neurological issues, skin problem, gastrointestinal issues, disorder of reproductive system, and cancer. These are the some paper journal presentation for like autism, some other diseases. Conclusion. Objective: adding the color food to make them appealing, yet influence the customer byproduct. Nidana Parivarjanam Eva Chikitsa. Limited the usage of color food is stuff. Colors are always dangerous. Thank you.
Thank you, Dr. Vidya, for the interesting topic. Thank you so much, Doctor. Next, I would like to invite Dr. Neha Bharat Bhaviskar for the paper and poster presentation. Next, I would like to invite Dr. Neha Bharat Bhaviskar for the paper and poster presentation. First, we go to the paper presentation.
Good evening, everyone. Myself, Dr. Neha Baviskar, PG scholar from a Department of Chikitsa of JM Patur, Akola. I am here to represent you my paper presentation. My paper presentation topic is an integrated approach to Grudrasi in the guidance of Dr. Jayashree Katole ma'am and Dr. Ashish Sir. Abstract. Grudrasi is one among the 80 types of Nanatmach Vaidis and is a Madhyam Margagat Vaidi. The etiological factor responsible for sciatica pathology and clinical features are quite similar to Grudrasi. Hence, the Grudrasi can be correlated to the sciatica. Grudrasi Vaidi described in a Charak Samhita, Sushruta Samhita, and Vagbhat and other Samhitas. The presented study is a case report and a management of male patient 50 years old with a severe pain in low back on left side, which is radiating towards the thigh calf region and down to the foot. Difficulty and pain while walking and sitting, stiffness in the lumbar region and numbness in the left leg since the 6 months. He was administered various Shaman Yoga and also with the Abhyanga, Sarvanga Svedana and Nadi Sved. The symptoms of Grudrasi like Rudra, Ruka, Toda, Stamba, Spandan, and Kapha symptoms like Aruchi, Tandra, Gaurav. And the tests like SLR test and walking test were observed over the treatment. Analysis of the results show the improvement in the Grudrasi. Finally, study concluded that the given treatment is found to be effective in the management of Grudrasi. The keywords Grudrasi, Sciatica, Abhyanga, Svedan, Patrapinda Svedan, and Katibasti and Shaman Chikitsa. Introduction. In Ayurveda, the Grudrasi which included under the 80 types of Nanatmach Vatvikar. In this, the gait of patient is typical that resemble of the Grudra. The Grudrasi is divided into two types based on the dosha involvement in it. The one is Keval Vataj and other is a Vata Kafaj. The sign and symptoms of Keval Vataj is a pain with a pricking sensation, stiffness, and repeated twitching in the buttock. Low, lower back pain region, thigh, back of knee, calf region, and foot. In Vata Kafaj Grudrasi, there is a drowsiness, feeling of heaviness, and anorexia may be present. In Ayurveda, the disease Grudrasi treated as a Vatvadi, which included mainly Basti Chikitsa as the Shodhan Karma and internal medicine as the Shaman Chikitsa. Objectives to study the clinical representation of Grudrasi from an Ayurvedic and modern perspective, to evaluate the effectiveness of Ayurvedic treatment in the Grudrasi, to reduce the further complication and the duration of the disease, to improve the quality of the patient. Materials and methods are through the review of Ayurvedic text and modern literature for Grudrasi was done. Particular case represented here. Conceptual study for the Grudrasi. The Ayurvedic review is Hetu, Ati Chakraman, prolonged continuous standing and heavy weightlifting. Dosha involves are Vata Kapha Dosh Prakop, Dusha, Majja Asti, Rasa, Rakta, Sira, Snayu and Kandara. Vyakti Sthan are Kati Pradesh, Uru, Janu and Pada. The classical symptoms of Grudrasi are pain in lumbar region radiating towards the thigh, calf region and down to the foot, difficulty in walking and sitting, numbness in the left leg, Toda, Ruka, Stamba, Spandan, Tandra, Aruchi, and Gaurav. The modern review definition of sciatica, shooting pain along the cutaneous distribution of the sciatic nerve, and it is the terminal branches. Chiefly the common perennial is known as the sciatica. Pain usually begins in the gluteal region or even higher and radiates along the back of the thigh and the lateral side of the leg to the dorsum of the foot. Sciatica is a term which is characterized by the pain which starts in the lumbar region and referring down to the back of lower limb to the ankle and the foot along the pathway of sciatic nerve. Mainly authors stated that sciatica is a symptoms, not a diagnosis. Sciatica usually assumed to be caused by the compression of nerve root, but it is not necessary. Some other causes like a trauma to the lumbar region, improper sitting posture, continuous traveling, heavy weightlifting, lack of exercise can also towards the sciatica. Term sciatica is used when the leg pain radiates posteriorly in the sciatic or L5S1 distribution. Common cause of low back pain is herniated disc with or without nerve impingement, result in the back pain with a radiation down to the leg. Drug review. The treatment management used in this case are Sarvanga Abhyanga with a Karpuradi tel, Nadi Svedan, Sarvanga Patrapottali Sved with a Nirgundi, Arka, Eranda, Shigru, Karpuradi tel, Kativasti with a Karpuradi tel, Agni Tundivati, Yograj Bugur, and Rasna Panchakwan. Case representation. A 50-year-old male patient, farmer by occupation, reported at a hospital in a Chikitsa department on date 9/6/2025 with a severe pain in low back on the left side, which is radiating towards the thigh, calf region, and the down to the foot. Difficulty and pain while walking and sitting, stiffness in the lumbar region, and numbness in the left leg since the 6 months. The patient stated that he was quite well 6 months back since he developed the pain in lower back region, rotating left lower limb with a Stamba, Ruka, Toda, Spandan, Gabra, Oruchi, and Tandra. The patient was diagnosed of the Grudrasi on the basis of subjective and objective parameter and was admitted in Kai Chikitsa department. The criteria for assessment is both subjective and objective variables were employed for the assessment of impact of the treatment. Clinical assessment of symptoms and severity was done in the terms of gradation of symptoms. For this purpose, main sign and symptoms were given a suitable score. The relative extent of all criteria was recorded according to the rating scale in the patient before and after the treatment. The subjective criteria this includes the symptoms and the severity in suitable grading score for the Vata symptoms like Ruka, Toda, breaking sensations, Stamba, Spandan, and twitching. For the Kapha symptoms like Aruchi, Tandra, and Gaurav. The gradation for objective parameters are the SLR test and walking distance. The parameters of assessment are the progress of the theoretic regimen was assessed on the subjective and objective parameter. Improvement in the clinical symptoms were taken for subjective assessment and SLR test, walking distance test were the objective parameter test. Treatment advice to the patient are Sarvanga Abhyanga with a Karpuradi tel for 20 minutes for 15 days, Sarvanga Nadi Swedan 20 minutes for 15 days, Sarvanga Patra Potoli Swedan 20 minutes for 15 days, Kati Basti with a Karpuradi tel 20 minutes for 15 days, Agni Tumdivati 125 mg 2 tablets BT for 1 month, Yograj Google 220 250 mg 2 tablets BT for 1 month, Rasna Panchakvat 15 ml plus 45 ml water BD for 1 month. Result before the treatment, Ruka around the grade 4 and after treatment in the around the grade 1. Toda is 3 and after treatment 0. Samba is 4 and after treatment 1. Spandan is 4 and 0. Aruchi is 2 and 0. Tandra 1 and 0. And Gaurav are the 2 and 0. The objective parameter shows an SLR test before treatment shows the 3 grade and after treatment shows the 0 grade and walking distance are the 3 and 1. Discussion the treatment approaches on the Ayurvedic such as lifestyle modification, management of underlying disease, and systematic drug administration. The patient was managed with the Ayurvedic treatment. The patient was observed on the clinical examination, and the following points are observed: change in a pain over 1 month. Aruchi, Tandra, Gaura of the patient are reduced. There is objective parameter like the SLR test and walking distance is used for the assessment criteria after the Ayurvedic treatment management gradation and SLR test and walking distance reduced. Overall change in the quality of life. Initially, before starting the Ayurvedic medication, the patient was having the severe pain in low back, rotating towards the thigh, calf, and down towards the foot, and low appetite. Gaurav Tandra Aruchi. Then he was started on above Ayurvedic formulation over the period of time. Symptoms are reduced. Observation pain in low back radiating towards the thigh, calf region, and down towards the foot are reduced. There was improvement in the appetite. Aruchi, Gaurav, Tandra reduced of the patient, overall improvement in the quality of life of was observed in the patient. Conclusion Ayurvedic management of the Grudrasi is found to be effective and safe. Treatment reduce adverse effect and complication and improve the quality of life of the patient. References are used are Acharya Charak, Charak Sahita, K.D. Tripathi, Essential Medical Pharmacology, Harrison Principle of Internal Medicine, Davidson Principle and Practical Medicine. Thank you so much.
Thank you, Dr. Neha. Thank you for the well-explained presentation. Next, we go to the another poster presentation. I would like to invite Dr. Renuga Patel for the poster presentation. I would like to invite Dr. Renuga Patel for the poster presentation.
Good evening, everyone. My name is Dr. Renuka Patil, PG second year scholar from Pasutantra Evam Stri Doc from Dr. Divya Patil College of Ayurveda. Today is my topic is understanding infertility through Ayurveda, a journey of parenthood. Infertility defined as the inability to conceive after 12 months of unprotected intercourse after 8 to 10% of couples worldwide, with 1 in 4 couples in developing countries facing it. In India, primary infertility affects 11.8% of women. It can stem from issues with the ovaries, uterus, fallopian tubes, hormones, and psychological factors, and is classified as primary, never conceived, or secondary, that is, difficulty in conceiving after prior pregnancy. Ayurveda emphasizes factors for conception including Ritu, fertile that is fertile period, Kshetra that is healthy reproductive organs, Ambu as nutrition post conception, Bija that healthy sperm and ovum, and Somanasya that is psychological peace, with Apanatva playing key role in regulating reproductive functions. In this case, the Shodhana procedure involving Vamana that is detoxification and Matra Basti that is medicated enema to stabilize the Apanvat, followed by Shaman Chikitsa palliative treatment along with relaxation techniques like meditations are proved effective in treating infertility. Our aim is to study and address the cause of infertility through Ayurvedic principles. The causes of infertility in women, ovulatory disorders, example PCOS, hypothalamic disorders, primary ovarian insufficiency, high prolactin, thyroid disorders, fallopian tube blockages or damage, uterine issues, age-related infertility, unexplained infertility. The ovulatory disorders can be taken under the cause like Bija dosh, and the fallopian tube blockages, uterine issues can be taken under the Kshetra, that is reproductive disorders. For men, low sperm count and motility, erectile dysfunction, genetic factors, and emotional impact may involve like stress, anxiety, and feeling of isolation, etc. Risk factors in infertility are age. Age as a woman age, the quality and quantity of egg decline, making conception harder and increasing the risk of miscarriage. Smoking. Smoking harms reproductive organ, depletes eggs, and increases miscarriages and ectopic pregnancy risk. So, quit before fertility treatment. Weight. Overweight and or underweight can affect the ovulation, while a healthy BMI may increase ovulation frequency and pregnancy chances. Sexual history. STIs like chlamydia or and gonorrhea can damage the fallopian tubes, and multiple unprotected partner increases fertility risk. Alcohol. Excessive alcohol consumption can reduce the fertility. Treatment according to Ayurveda. Shodhan Chikitsa. Panchakarma therapy, especially Basti, is the vital for the Vata dosha and Sharir Shodhan. Importance of Panchakarma. For quality pregnancy, couples should undergo panchakarma with the male taking Shira Grita and the female consuming Tila Tela or Urada afterward. Virechan for ovulation. Patient with PCOS, generally we use Virechana. For Snehana, we use many Grita, medicated Gritas like Brahmi Grita, Phala Grita, Shatavari Grita, etc. Nasya Karma, as prescribed in Pusavan Vidhi, helps in conception and stability of pregnancy. Nasya with Anutela may helps to regulate the hypothalamus pituitary ovarian axis. Asthapan Basti, Anuvasan Basti, and Uttar Basti improves ovulatory, tubal, uterine, and cervical factors, with Uttar Basti using specific gritas for Kshetra Nirmana and tube patency. Shirodhara used to regulate HPO axis. Shirodhara with tel, the Dashamula Kwatha, milk, takra, as per the Prakriti and Dosha Dushti in the patient. Shamana Chikitsa. The therapeutic measures mentioned for Pradara, Rakta Atisara, Shonita Pittam, Rakta Arsha can be adopted as Yoni Rogas Chikitsa. Rasayananda Vajikaran drugs are also useful for treating Yoni Rogas. Mutra dosha pratishodhaka drugs can be used in Yoni Rogas. The line of treatment described for Shukra dosha, Artav dosha, and Stanya Roga can be adopted for Artava Dushti Chikitsa. Patha. The woman who consumes lasun never remain infertile. Meat increases Reta Shukra and beneficial for Vandyatva. Root of Surana, Vandyakarkoti and Devdali are Pathya. Milk is beneficial for Vandya and also helps in achieve pregnancy. Discussion. Infertility is a global health issue impacting both physical and emotional well-being, with conventional treatment like art often being costly and unpredictable. Ayurveda offers a holistic approach by balancing the body's doshas and improving overall health through the purification, pacification, therapies, lifestyle changes, and stress management. Research supports the use of Ayurvedic herbs like ashwagandha for male infertility and therapies like Basti and Uttar Basti for female infertility, showing improvements in hormonal balances, ovulation, and conception rates. However, further large scale research is needed to validate Ayurveda's effectiveness and explore its integration with the conventional treatment. The conclusion is the favorable effects of traditional Indian medicine practices on sperm quality, conception rates, and general reproductive health are highlighted in this comprehensive review, which highlights the hopeful potential of Ayurveda therapy for infertility. For infertile couple, incorporating Ayurveda into treatment plans provides a safe, natural, and affordable alternative. Additionally, combining traditional fertility treatment with Ayurvedic principle offers a comprehensive strategy and suggests a useful addition to support reproductive technology. Thanks everyone. Thanks for the opportunity.
Thank you, Dr. Renuka Patel. Thank you for the detailed presentation. Next, we go to the another paper presentation. I would like to invite Dr. Mridula Maheswamy for the paper presentation. I would like to invite Dr. Mridula Maheswamy for the paper presentation.
Good evening to all. The title of my paper presentation is An Approach to Understanding Hypothyroidism. Myself, Dr. Mridula Swami, PG scholar from Rachana Shari Department from Dr. D.Y. Patil College of Ayurveda and Research Center. So, hypothyroidism, it is also known as underactive thyroid, is a condition in which where the thyroid gland doesn't produce enough thyroid hormones, which leads to a slowdown in various bodily functions. The thyroid gland is located at the front of the neck, which produces hormone that regulates metabolism, heart rate, and body temperature. In hypothyroidism, insufficient hormone production leads to a general slowing down of bodily processes. Hypothyroidism is an endocrine disorder that can affect every part of routine life of a person with hypothyroidism. Hypothyroidism, it's decreased secretion of thyroxine, which is T4, and thyroiodothyronine, which is T3, by the gland itself, which results in the compensatory increase in TSH secretion. At present, the overall global prevalence of hypothyroidism is 4 to 15%. So the main function of thyroid is to regulate metabolism. Hence, its function relates with the Bhutagni. Vata, particularly Samana Vata, regulates the Agni. So this is important for proper functioning of the thyroid gland. This hypothyroidism leads to lesser production of heat, which increases in kapha, causes diminish of Agni and slowness in the body function. So in hypothyroidism, kapha is increased and the pitta and the Agni are in diminished state. What are the causes of hypothyroidism? It can be autoimmune diseases like Hashimoto's disease, Graves' disease, iatrogenic like radioactive iodine ablation or thyroidectomy, several infections, radiations, iodine deficiency, congenital diseases like dysharmonogenesis and thyroid aplasia. There can be due to some medications or the pituitary diseases. What are the lab investigations? So basically, we do a thyroid profile test, which includes T3, T4, TSH, free T3, and free T4. There is also thyroid antibody profile, which is a thyroid peroxidase antibodies and thyroglobulin antibody, and the pituitary marker like this TSH. These markers are tested in the combination for the assessment of the thyroid status. So, what is the Ayurvedic approach? So, hypothyroidism is a decreased secretion of thyroxine and thyroiodothyronine by the gland itself, which results in the compensatory increase in TSH secretion, which develops symptoms like fatigue, lethargy, loss of energy, weight gain, muscle ache, dry skin, menstrual irregularities, and palpitations. So, in Ayurveda, Samprapti, how the hypothyroidism occurs. So, different aharaj, viharaj, and the manasik hetu will lead to tridosh vegetation, including dominance of the kapha and margavarjanya mataprakopa. This dosha vegetation and Agni Mandyakara Nidana will cause the vegetation of the Agni. When Agni gets impaired, it leads to the formation of Ama, which in turn resists Rasavastrododushti and the Srotorodha. And this vitiated Rasadhatu will produce vitiated Uttaruttar Dhatu with respect to Srotodushti, and thus a syndrome involving many organs will get developed. So, what are the Samprapti Ghataka? Dosha will be Kapha and Vata, Dusha will be Rasa and Meda, Agni, Dhatu Agni, Strotas will be Rasavaha Strotas and Medovaha Strotas, Adhishthana will be Gala Pradesha, Srotodushti, we can see the Sangha and Vimarga Gamana, Udbhav Sthana will be Amashaya, and Rogamarga, the all three Rogamargas, that is Bahya, Madhyam, and Abhyantara. So these are the symptoms which we can correlate with the classical text in which Charak Ashtanga Hridaya has given it. So weight gain, that is the Sthoulya, the references are given, decreased appetite as aruchi, anorexia praseka, pallor is pandutvam, impaired fertility, clypeia, bradycardia, hritpira, decreased hearing, shabda, asahishnutvam. So dosha involvement, which doshas are involved with the according to the symptoms, and the references are given here. So tiredness, which dosha involved is vata vriddhi, hair loss, pittakshaya and kapha vriddhi, constipation, vata vriddhi, weight gain with poor appetite, kapha vriddhi and the pittakshaya, hoarseness of the voice, kapha vriddhi, vata vriddhi, impaired hearing, kapha vriddhi. Next is the strotas involvement. As Annavaha strotas, the symptoms we can see is the poor appetite and the constipation. In Rasavaha strotas, weight gain with poor appetite, puffy face, menorrhagia, feelingness of cold. Raktavaha, bradycardia, difficulty in concentrating, poor memory, paresthesia. Mausavaha, peripheral edema, goiter, delayed tendon reflexes. Next is a Medovaha, in which tiredness is there, goiter is there. Asthivah, osteoporosis, osteoarthritis. Majjavaha, carpal tunnel syndrome. Shukravaha, loss of libido, infertility. Purishavaha, constipation. Svedavaha, dry, coarse skin. And Artavaha, loss of libido, infertility, or secondary amenorrhea. So, how we can manage this hypothyroidism? So, the Lakshanas are given and the Shamana Yogas. In Asthir Social, Sthoulya, we can give the Varunadi Kwatha or the Asanadi Kwatha. In Gugulu, we can give Kanchanara, Navaka, Vaishora, Gugulu, and Shiva Gutika, Usha Kativati. Next, Sandhi Shula, we can give Yogaraj Gugula, Laksha Gugul, and Simhanad Gugul. In Vibhandanam, we can give Trifala Churna, Abhipattika Churna, Shotha, Punarnavadi Kwat, and Vakshuradi Gugul. In Clydebia, Ashwagandha Kapikachu. Nashtartava, we can give Sukumara Grutam, Rajapravartani Vati, Varanadi Kwat. Vishada, Kalyanak Grutam, and Medrasayan we can give. So, what are the Pathya and Apathyas in hypothyroidism? Puranashali, Yava, Kulutha, Udvartana, Ushnajala, Vyayam should be given. Apathyar, Masha, Sheetajala, Madhya, Dadhi, Gudha, and the Divaswapna should be avoided. So, yoga and pranayam. So, there are some yoga which will be helpful in the hypothyroidism, like Virasana, Trikonasana, Sarvangasana. And in pranayam, Surya Bhedana pranayam with Kumbhika and the Bastrika. So discussion. So hypothyroidism is such an anukta vyadhi with evident kaphomedodushti. Dhatvagya mandya, which leads to trothodushti. So according to the clinical presentation, it can be diagnosed as Sthoulya if the patient has obesity, Galaganda if the swelling present, Kapha Junmada if the patient has depression-like psychiatric manifestation. So Chikitsa for hypothyroidism should aim at the Agni correcting Jatharagni and Vata Dhatuvagni, Sroto Shodhana, Kaphavata Shamak and Medohar line of treatment. So Vaman will be the best Shodhan therapy if as it is remove Kapha Medodushti, removes Avaran and treats Strotodushti. Lakshanak Chikitsa and the Rasayan Chikitsa is inevitable as it does Strotodushti and helps to attain Dhatu Samyata. So conclusion. So looking into symptoms of the disease on the basis of Ayurvedic fundamental, it becomes evident that the kapha and the vegetation of the vat is the main event with the vegetation of Agni. So it is hypothyroidism is an anukta vyadhi where there is an evident kapha medodushti and dhatuvagni mandam. So curative as well as preventive aspect role of Rasayan Chikitsa is inevitable. So Ayurveda has a promising solution even for the management of anukta vyadhi. So these are the references. Thank you.
Thank you, Dr. Mrutila, for the highly valuable presentation. Next week, I go to the another paper presentation. I would like to invite Dr. Megha Lakshman Patare for the paper presentation. I would like to invite Dr. Megha Lakshman Patare for the paper presentation.
Hello, I am Dr. Megha Pathare, MD Scholar, Dravyagun Vigyan from LRP Islampur, Sangli. My topic is Conceptual Review of Draksha as an Ahar Kalpana in Brihatrayee. Introduction. In Ayurveda, we use many plants as Ahariya Dravya as well as Aushadhi Dravya. Draksha is the most useful traditional medicinal as well as Ahariya Dravya in India. Its fruit is known as grapes, which is the edible part of the plant. It is valuable food with medicinal properties, stated by systems of medicine like Ayurveda, Siddha, Unani, and secured valuable status in many formulations. It is rich in flavonoids, polyphenol, antioxidant, anti-inflammatory, and cardioprotective effects. It have grape seed extract is studied for neuroprotective and hepatoprotective action. Objective to analyze Draksha in Brihatrayee to understand Guna, Karma, Rasa and Ahar Kalpana of Draksha in Brihatrayee. Material and methods. Material Brihatrayee along with few articles related to Draksha published on internet have been referred for this conceptual review. Method conceptual review. Study drugs. Botanical name, common name, Rasa, Virya, Vipak, Dosha and action. Botanical classification of Draksha is as follows. Botanical description of Draksha is as follows, like growth habit, leaves, flowers, fruit, root. Conceptual significance as Ahar. Ahar Dravya means Draksha is not just a fruit but a functional food in Ayurveda, bridging nutrition and medicine. Classification. Fall under Pathya Ahar, wholesome diet, due to its nourishing and therapeutic qualities. Therapeutic nutrition act as a rasayan, support dhatu poshan, that is tissue nourishment, and enhances oja, that is vital essence. Chemical composition of Draksha. Draksha is rich in sugars, vitamins, minerals, polyphenol and organic acids. Properties and actions of Draksha are as follows. Rasa, Madhur and Amla. Guna, Guru, Snigdha. Virya, Shit. Vipak, Madhur. Dosha action, it pacifies Pitta and Vata. Properties of Draksha mentioned in Brihatrayee is as follows. First, Charak Samhita. Draksha is described as Phalottama, that means the best among fruits, included in Kanthya Dravya, Virechanopag Dravya and Kasahar Dravya. It is used in conditions like Shrama, Trishna, Jwara and Raktapitta. Caution, Charak warn against combining sour fruits like grapes with milk due to Viruddha Ahar concept. Sushrut Samhita. It is classified under Parushakadigana, a group of fruits with specific therapeutic action. Emphasizes its use in Vatarakta, Pandu and Kushta. Stem ash is used for joint pain, piles and urinary calculi. Ashtangridaya. In Ashtangridaya, Draksha is mentioned as Phalottama. Highlight its rejuvenating, aphrodisiac and nervine tonic properties. It is useful in constipation, burning sensation and amenorrhea. Kalpana specific preparation of Draksha is as follows. First, Draksha Yavagu. Rice gruel with Draksha decoction used for digestive weakness and Pitta disorders. Second, Draksha Manda. Thin rice water infused with Draksha. It is ideal for fever, thirst and dehydration. Draksha Kashai. Decoction for Rakta Pitta, Vata Rakta and general fatigue. Fourth one is Draksha Kalpa, a compound preparation involving Draksha often used in rejuvenation therapy. Conceptual review in Ahara Kalpana. Pathyahar, Draksha is considered as Pathya, means wholesome and suitable for most conditions. Mahabheshaja. As per Acharya Kashyapa, diet itself is a supreme medicine. Draksha exemplifies this by offering nutritional and medicinal synergy. Prakriti specific use. Its Shit, Virya and Madhur Ras make it ideal for Pitta and Vat Prakriti individuals. It includes calories, carbohydrates, dietary fiber, protein, vitamins, potassium, calcium, magnesium, iron, flavonoids and organic acids. References of Draksha in Brihatrayee is as follows. Discussion on Draksha. Draksha, known botanically as Vitis vinifera, is celebrated in both classical Ayurvedic texts and in modern nutritional science for its deeply nourishing qualities. In Brihatrayee, Charak Samhita, Sushrut and Ashtangridaya, It is honored as Phalottama, the best among fruits, and described as Rudya, Balya, and Kanthya. These attributes reflect its role not only in physical healing but in emotional restoration. Ayurvedically, Draksha is Madhura in taste, Shita in potency, and Snikta in quality. It pacifies Vata and Pitta, nourishes Rasadhatu, and enhances Ojas, the vital essence. It is used in conditions like Kasa, Rajekshma, Shrama, Rudrog, often in formulations such as Draksha Rishta, Draksha Auleha, and in Chavanprash. Conclusion on Draksha. Draksha is more than a fruit. It is ritual of sweetness, a symbol of quiet strength, and a bridge between ancient healing and modern vitality. Its presence in both Ayurvedic literature and nutritional science confirm its timeless relevance. As a part of curated routine, Draksha offers emotional clarity, physical resilience, aesthetic harmony through its gentle taste and versatile form. In honoring Draksha, one honors the art of restoration, where nourishment becomes ceremony and sweetness becomes strength. References for this article is as follows. Thank you.
Thank you, Dr. Meha, for the very detailed presentation. Next, we go to the another paper presentation. I would like to invite Dr. Samphaji Eskarje for the paper presentation. I would like to invite Dr. Samphaji Eskarje for the paper presentation.
Namaste. Today I will be presenting a topic of my synopsis, a review on Parikartika Vyadhi and its Ayurveda management protocol. My name is Dr. Sambaji Esgarje. I am doing this synopsis under the guidance of Dr. Sachin Patil sir. These are the contents from introduction, aims and objectives, review of literature, diagnostic criteria, inclusion, exclusion, hypothesis, pilot study, and bibliography. Coming to the introduction of Parikartika. Parikartika is one of the Gudagata Vikaras characterized with Kartanavat, Chedanavat Shula in Guda Pradesha. As per classics, Parikartika can be correlated with fissure in ano. About 30 to 40% of population suffers from anal problems of fissure, and fissure compromises 10 to 15% of anorectal disorders. According to Ayurveda, fissure or Parikartika is due to vitiated Apanavata, and this is the main cause of Parikartika. Excessive intake of Tikta, Ushna, Kashaya, Rasatmaka, Ahara, Alpa Bhojana, Vega Dharana, Vega Udhirana, excessive Shodhana therapy, and lack of local hygiene, all these add up to the Samprapti of Parikartika. In both the types of Parikartika, it may be acute or chronic. Agonizing pain and bleeding during and post defecation is seen. But here we are focusing more on chronic fissure. Coming to need for the study, any disease which is not cured by medicine needs surgical or parasurgical intervention. And Parikartika in acute stage is curable by local application medication treatment, but in chronic fissure with local and medical treatment is failed, then parasurgical is the only remedy. Fissurectomy is one of the treatment options for managing Parikartika, and post fissurectomy the surgical wound needs to be taken care, or chances might be that it may get infected and irritation due to averidification. Panchula Alkala cream is one of the Ayurvedic topical applications which is used for wound healing and with antimicrobial properties. It is a combination of 5 herbs for Shodhana and Ropana of wounds. Coming to the aims and objectives of the study, it is to revive the Parikartika and Fissure in detail and to evaluate the efficacy of Panchavalkala cream and povidone ointment in the management of post-operative wound of Parikartika with special reference to chronic Fissure and to compare each other efficacy. Coming to its literature review, in Ayurveda, it is mentioned in Charaka Samhita and Sushruta Samhita described under Parikartika as complications of Basti and Virechana. Nidana, Samprapti, Lakshana, Chikitsa and Parikartika, everything will be mentioned in the complete thesis work. Acharya Kashyapa described Parikartika and its types in Garbhini Chikitsa, and modern science is correlated to Fissure. Drug selection criteria comes under where Panchalkala cream is selected for group A and povidone ointment for group B. So it is applied twice daily for 21 days and total 30 number of patients is selected for each group A and group B. Panchalkala cream has pancha dravyas, that is Ashwatha, Udumbara, Vatha, Plaksha and Parisha. Here Ashwatha is Kashaya Madhurrasa, Guru Rukshaguna, Shita Virya, Katu Vipaka. Whereas Udumbara has Kashaya Rasa, Lagu Rukshaguna, Shita Virya, Katu Vipaka. Vatha is as Kashaya Rasa, Guru Rukshaguna, Shita Virya and Katu Vipaka. Plaksha has Kashaya Rasa, Guru Rukshaguna, Shita Virya, Katu Vipaka. And Parisha has Kashaya Rasa, Lagu Rukshaguna, Shita Virya and Katu Vipaka. And all among these 5, it is Shita Virya and Katu Vipaka. Hence best for wound healing property with Kashaya and Kashaya Rasa Dravya. Into povidone cream, it contains lidocaine and nifedipine. Lidocaine is a local anesthetic blocking pain signals from nerve to brain, whereas nifedipine is a calcium channel blocker. It works by blocking the action of calcium on blood vessels of venous, hence relaxes smooth muscles and improves blood supply. Materials and methods. Sample source is selected from the OPD and IPD of Sri Shivageshwar Rural Medical College, and diagnosed cases of Parikartika selected. Diagnosis of Parikartika is done with lakshanas like Shula, Daha, Kandu, and Shonitasrava. Patients' inclusion criteria will be done like patients of both sex, irrespective of religion, occupation, socioeconomic status. Patients who are clinically diagnosed of Parikartika and undergone fissurectomy procedure recently. Patients preferably aged between 18 to 60 years, and patients who are willing for sign informed consent and be a part of study protocol. Exclusion criteria: patients suffering from systemic diseases like diabetic mellitus, hypertension, tuberculosis will be excluded. Patient with HPSAG and HIV positive will be excluded. And patients are fissure and associated with anorectal conditions like hemorrhoids, fistula, CA rectum, or ulcerative colitis, Crohn's disease. All these diseases who are suffering will be excluded. Hypothesis: the difference in the efficacy of topical application of Panchavalkala cream and povidone ointment in the management of post-operative wound of Parikartika is not statistically significant, whereas alternative states it is statistically significant. Patient selection will be done under patients who have undergone fissurectomy and who are willing to get enrolled in the study, and patients suffering from fissure in are the main selection. Plan of the study is it is an interventional study, 2-arm open label, active control, randomized clinically prospective clinical study with purposive sampling. Total 60 patients will be selected, 30 patients for each group. Investigations are like HP, TCDC, ESR, RBS, HPSAG will be carried out. Ethical clearance will be taken and statistical test will be performed. Assessment criteria is pain, oozing of blood, ulcer in ANO will be seen with a grading of 0 to 1 to 3. Pilot study was already done for 5 patients where the result was found effective. Hence, the study is carried forward on. Treatment plan is under aseptic precaution, fissure bed is cleaned with gauze. Local application of Panchavalkala cream is done twice daily for 21 days for group A, and for group B, local application of nifedipine with the lidocaine cream twice daily for 21 days. And assessment is done on first day and after treatment on 21st day and after follow-up on 38 days. So these are the bibliography study. Thank you.
Thank you, Dr. Sambhaji. Thank you for the presentation. One more paper presentation is there. Once again, I would like to invite Dr. Sambhaji Karge for the paper presentation on the another topic.
Namaste. Today I'm going to present a topic on Nadirana, pylonal sinus. I will present you the insights, the treatment modalities, and all the literature review on Nadirana. My name is Dr. Sambhaji S. Garje. Thanks to my guide, Dr. Sachin Patil sir, for guiding me through my PG studies. We will go through superficially through the what is pylonal sinus. First, it was discovered by Hogdays in 1880. Sinus is a blind ending tract usually lined by granulation tissue that leads from an epithelial surface into the surrounding tissue, often into an abscess cavity. Sinus may be congenital or acquired. Pylonal sinus is commonly seen in natal cleft or gluteal cleft and generally contain hairs. Also, it was known as jeep diseases since it was common in jeep drivers during Second World War. Let's see about its pathonatomy of pylonal sinus. Primary tract, an opening on skin and expanding into a small terminal cavity. Whereas hairs, nearly all the hairs lies loose, but few are still attached to the tract wall. Secondary tracts connects to the deep part of the primary tract to the sinus opening lining. Lining of the tract is usually filled with granulation tissue. Contents are like hair, epithelial scales, and debris. And microscopically, foreign body, giant cells, aerobic and anaerobic organisms are seen. Coming to the incidence of pylonal sinuses, it is usually found with the age of 20 to 30 years. And gender incidence, that it is more common in males, and it is common in Western countries, and usually common in hairy people, because in the gluteal cleft, when the hair gets obstructed, it goes on deposition, gets deposited into pylonal sinus, forming into pylonal cavity. Risk factors of pylonal sinus are people suffering with obesity, sedentary occupations, positive family history, local irritation or trauma, increased sweating, poor personal hygiene, abundant hair in gluteal folds are people with risk factors of pylonal sinus. Clinical features of pylonal sinus are signs and symptoms with acute abscess or chronic draining sinus in the sacrococcygeal area, pruritus, pain, tenderness, induration. These are clinical features. Let's see about complications of pylonal sinuses. Like pylonal sinus usually forms an abscess later and recurrent inflammation, recurrence of sinus formation, and squamous cell carcinoma is also seen as a complication. Let's see the motor management in pylonal sinus. Coming to its conservative management, avoid long sitting and driving, depilation of hair by using creams or by razor, frequent sitz bath, keeping the area dry, and injection of phenol. Let's see a few operative procedures of pylonal sinus. Elliptical excision, wide radical excision, excision and healing by granulation, excision and marsupialization, excision and primary closure, closure by Z-plasty, and myocutaneous class. And coming to its Ayurvedic management of pylonal sinus. First, let's see what is pylonal sinus in Ayurveda. Dushtavrana, that is Shalaja Nadirana. It is considered as Shalaja Nadirana because the hair or any organisms are deposited in Nadirana. Shalya is something hidden in dhatus and not removed properly results in Shalaja Nadirana. Quickly formed sinus excluding warm liquid, frothy, churned up type liquid, clear or blood stained discharge with intense pain are all the clinical features of Shalaja Nadirana. Prognosis is Kshata Sadhya. In Shalaja Nadirana, sinus need to be opened, Shalya should be removed, and cleansing of the tract should be done. That is as explained as management by Bhedana, Aishana, and Patana. Medicines like Gugulu Tiktaka Kashaya can be used. Ksharasutra is described in Nadirana. Surgical procedures for Shalaja Nadirana are Chedana of the whole tract, partial Chedana of the tract, and Ksharasutra application for the remaining tract, Ksharasutra application for the complete tract, Ksharasutra only in lateral tracts, Ksaravarti application, Chedana and Ksharalepa application, cleansing wound with Triphala Kvata, and application of Jatyadhigruta was also mentioned. Coming to the merits of Ksharasutra therapy in parallel sinus are encouraging healing from the base, least recurrence rate, simple procedure, minimally invasive, minimal scar, cosmetic value, minimal work of days, and cost effective. Usually parallel sinus is meant for a lay opening technique is also done. It is opened, removed, cleansed, and lay opening technique is also done. And Ksharasutra after opening, Shara also is applied. Ksharasutra in parallel sinus is done like this. Thank you.
Thank you, Dr. Sampaji Karge. Thank you for the well-explained paper and poster presentation. Next, we go to the another paper presentation. I would like to invite Dr. Rajeshri Shinde for the presentation.
Good evening, everyone. Myself, Dr. Rajeshri Shinde, third year OBGYN student. Good evening, everyone. Myself, Dr. Rajeshri Shinde, third year OBGYN student from Dr. D.Y. Patil Ayurvedic College and Research Center. Today's my topic of poster presentation is cervical cancer prevention. In India, cancer of the cervix uteri is third most common cancer with an incidence rate of 18.3% and a second leading cause of death with a mortality rate of 9.1%. What are the risk factors of cervical cancer? The most common cause of cervical cancer is HPV, that is human papillomavirus, early sexual contact at the age less than 18 years, early pregnancy at the age less than 20 years, smoking, multiple sexual partners, socio-economically low background, status, for example, infections like HIV, and smoking. To prevent cervical cancer, we can advise some screening tests to patients. These are HPV DNA testing, pap smear, colposcopy, also called as visual inspection with acetic acid. Pap smear, there are two types, conventional and liquid-based cytology. It is specific but not sensitive. Screening started at age of 21 years and repeated every 3 years. Treatment cannot be started with positive pap smear report alone. Need to be confirmed by colposcopic biopsy. This pap smear test detects squamous cell and glandular cell abnormalities. In colposcopy, we apply acetic acid solution to the cervix. In normal human, the cervical mucosa will appear pink, but when she is having cervix or if there are some dysplastic changes in cervix, this acidic acid stains it white and it is called as aceto-white areas. And third test is HPA DNA testing. It is recommended at the age of greater than 30 years. Can be done as early as less than 25 years. To prevent cervical cancer, we can advise some vaccines against cervical cancer, mostly against HPV virus. There are two vaccines available in the market. One is Cervareg, that is bivalent vaccine. It is effective against two subtypes of HPV, that is 16 and 18. Gardasil, it is available in two forms, quadrivalent and nonavalent. Gardasil quadrivalent, it is effective against four subtypes of HPV, 6, 11, 16 and 18. And Gardasil 9, that is nonavalent vaccine, it is effective against 9 subtypes of HPV. It provides protection against 6 cancers plus genital warts. WHO recommendation of dose schedule is like between 9 to 14 years, there are 1 or 2 doses are enough. Between 15 to 20 years, 1 or 2 doses are recommended. About 21 years, 2 doses are recommended. At the and the gap between 2 doses should be 6 months. If the patient is or the woman is HIV positive, then she should be take 3 doses. So this is about cervical cancer prevention. Thank you.
Thank you, Dr. Rajeshri Shinde, for the poster presentation. Thank you for the energetic presentation. Next, we go to the another paper presentation. I would like to invite Dr. Ashlesha Arjun Mane for the paper presentation. It's a case report.
Good evening all. Myself Dr. Ashlesha Arjun Mane, second year PG scholar, Shalyatantra Department, Vidarbha Ayurvedic Mahavidyalaya, Amravati. My guide name is Dr. Manjusha Kalmel, guide and HOD, Shalyatantra Department, Vidarbha Ayurvedic Mahavidyalaya, Amravati. I represent a case report, herpes zoster managed by Ayurvedic treatment using bleach therapy, Jalaukavacharan. First, introduction. The varicella zoster virus reactivates to cause herpes zoster, commonly referred to as shingles, an acute viral infection.
After an initial chickenpox infection, stays latent in the sensory ganglia and can revoke later in life, usually when the immune system is compromised by aging, immunosuppressive medications, or other underlying medical disorders. A painful vesicular rash that develops along the affected nerve dermatomes is the hallmark of herpes zoster. The sensation is frequently characterized as a scorching, throbbing, or stinging. Patient may have pruritus, fever, and malaise in addition to the rash. Postherpetic neuralgia, which appears as ongoing nerve pain even after the rash has cleared up, is one of the most crippling side effects of herpes zoster. Acharya Charak and Shushruth advocate for the therapeutic use of raktamokshan, that is bloodletting, to treat disease caused by pitta imbalance, as it is believed to help remove excess with and toxins from the body and restore balance. Bloodletting is the technique that can be performed through various methods, one of which is Jalaukavacharan or leech therapy, which has been gaining attention as a potential adjunctive treatment for herpes zoster. Next case study. A 36-year-old male patient came in with Ayurvedic Mahavidyalaya Amravati in Shalyatantra department with complaints of severe pain and burning sensation, the patient reported. The appearance of blister-like skin lesion that extended from the left side of his back to his chest, which had been present for 2 days. Based on the clinical presentation, the patient was diagnosed with herpes zoster. Next, materials. Leeches Jaloka for bloodletting, Estimado for local application, Paripatadi Kada 2 teaspoon bedi for internal use, Amrutarishta 2 teaspoon bedi for internal use. Materials. Methods. He received treatment in the OPD and was monitored for a while. As an emergency measure, he received 3 doses of the Jalaukavacharan medicine leeches on the 1st, 3rd, and 5th of his treatment. Thus, leech therapy was administered to the 3 measurements, which not only reduce redness and swelling but also ease burning and pain associated with herpes zoster. Result. Treatment procedure. The patient underwent 3 settings of Jalaukavacharan. First setting on day 1st. The leeches were applied to the affected area. Second setting on day 3rd. A second session of leech therapy was performed. Third setting on day 5th. The final session of leech therapy was administered. Observations. Following each session, the patient experienced progressive relief from the burning sensation, daha, and pain shook. The lesions, which were initially red and blistered, began to heal. These are some pictures before treatment and after treatment. Discussion. The varicella zoster virus reactivates to cause herpes zoster, a common viral infection that is characterized by painful vesicular eruptions that are usually limited to particular dermatomes. One of the main causes of morbidity is the severe discomfort, especially the burning feelings that go along with the rash. Even while the illness is managed with typical treatments, such analgesic and antiviral drugs, these mostly provide palliative comfort and ignore long-term problems like post-herpetic neuralgia. One such alternative treatment that has been explored in recent years is Jalaukavacharan or leech therapy, which is grounded in Ayurvedic principles. As outlined in the case study, leech therapy involves the application of medicinal leeches to the affected areas. Their saliva contains numerous bioactive compounds that are believed to provide multiple therapeutic benefits. These include anticoagulants and analgesic antivirals and anti-inflammatory agents, all of which have the potential to directly influence the course of herpes zoster. Conclusion. Herpes zoster can be effectively treated with leech therapy, also known as Jalaukavacharan, which relieves the discomfort and burning feeling. There were no side effects or difficulties, and the patient handled the treatment quite well, with recovered and showed no symptom of post-herpetic neuralgia. When orthodox treatment for acute viral infection like herpes zoster is insufficiently effective, this instance illustrates the potential role that traditional remedies like Jalaukavacharan may play. These are some references related to herpes zoster.
Thank you, Dr. Ashlesha. Thank you for the detailed presentation. Next, I would like to invite Dr. Rameshwar Khetkar for the paper presentation. I would like to invite Dr. Rameshwar Khetkar for the paper presentation.
Good evening to all. Myself, Rameshwar Bhujan Khedkar. I am from Gramin Ayurved Mahavidyalay, Patur, in second year PG Scholar, Shalyatantra Department. My HOD and guide name is Dr. Gayatri Mawle Madam from Gramin Ayurved Mahavidyalay, Patur, District Akola. I am presenting seminar on corn disease with treatment of Agnikarma, Snigdha Agnikarma. My abstracts, Kadar, that is corn, in modern science, is a localized hyperkeratosis of the skin. It usually at the site on pressure of the sole and toes, commonly on sole and toes. There is usually a horny induration of the cuticles with a hard center. Here we applying Agnikarma for management of Kadar, that is called as per Acharya Shushruta has described Kadar as a Shudra Rog is in Shushruta Samhita Nidan Sthan Adhyay and in Chikitsa Sthan which can be related to corn as per modern science. Agnikarma is one of the parasurgical procedure that has more effect in pain management along the curing of the disease. Introduction. Corn is a localized hyperkeratosis of the skin. It is usually occur at the site on pressure, that is on sole, toes, is the common sites. There may be upper and lower limbs. There is usually a horny innervation of the cuticle with hard center. It has been deeper center core, which reaches deeper layer as a dermis. It is usually white, gray, yellow in color, as described by Samhita. Can be closely related with lesion of the skin caused by hyperkeratosis. The management of Kadar is aimed at removal of the hyperkeratosis lesion by Snigdha Agnikarma. Here we demonstrated as OPD based simple and effective ancient technique, the Snigdha Agnikarma case study, and presenting a 35-year-old male patient come in Shalyatantra Department OPD in a Gramin Ayurved Mahavidyalay, Patur, presenting with complaints of painful hyperkeratosis in his foot, the greater toe of the right foot, that is on, has been persistent from since 8 months, causing discomfort while walking, standing in position. Patient was ready for Agnikarma after conventional treatment we discussed before. Material and methods. Material. Ridradi Churna, Panchavolcal Shalaka for Agni, Alvera, gas stove, betadine solution and Gospis. Agnikarma procedure. Pre-operative. Now, what are doing before the operative measures? Pre-operative measures. Proper assessment should be made before going for Agnikarma. Patient counseling is very vital before the process, so it should be properly done. Instrument required during the process should be kept ready. Consent also taken. Operative procedure. First of all, gas stove on the Pancha Dhatu Shalaka was placed on it. Shalaka was heated until was red hot. Then heated shalaka was applied to the mark corn in a circular manner for few seconds to achieve a therapeutic burn. Care was taken to limit the burn to the corn and avoid surrounding healthy tissues, followed by immediate application of the aloe vera pulp on it, reduce burning sensation. Post-operative care. The burn site was dressed with a sterile bandage to prevent infection. Patient was advised to keep the area clean and dry. Patient was instructed to avoid putting pressure on treated areas for few days and follow up regularly for monitoring and dressing changes up to complete resolution of the call. Now I'm presenting the image of before Agnikarma, after Agnikarma, and after the 1 week of Agnikarma. See, the images are presenting now result. In this case, patient get cure in first setting of the Agnikarma. Whether is a Shudra, which is minor but painful disease. Agnikarma is a procedure done in the Vata Kaphaj Vyadhi, as it has action of the Ushna, Tikshna, Sukshma, Vyavai, Vikasi, and Pachan, as it has properly to destroy the pathology in degeneration. Sorry. At ease has a proper to destroy the patient pathology in a deeper structure. It helped to pacify the vitality of Vat as a well cup dosh, thus relief from pain and cares of the discussion. Case study demonstrated that Agnikarma is an effective treatment for corn, providing significant pain relief and resolving the lesion without recurrence. The patient pain compression with conventional treatment, which was initially severe, decreased dramatically within a week post procedure and continue to improve, ultimately reaching zero on a wax scale, visual analog scale, by 8 weeks. This rapid pain relief is one of the key advantages of the Agnikarma, like due to immediate desensitization of the nerve ending and reduces local inflammation and pain. Conclusion: whether that is corn can be recured if it's only surgical excision done. Agnikarma therapy is more suitable in the management of corn. Agnikarma is a superior for local Vat and Kapha doj Vyadhi because it gives instant relief to the patient. Instead of surgical excision, Agnikarma therapy is the most satisfactory in the management of corn. It has no side effect, no complication, and no recurrence, almost zero recurrence rate. Patient can be regular work, goes on regular activities on the day of settings of Agnikarma. I take reference from Sri Rambert, Rajgopal Shenoy, Kaviraj KB, and Sharma AR. Thank you.
Thank you, Doctor. Thank you for the detailed presentation. Next, we go to another paper presentation. I would like to invite Dr. Shubham Govindrao for the paper presentation. I would like to invite Dr. Shubham Govindrao for the paper presentation.
Hello everyone, my name is Dr. Shubham Govindarao Tukne. I am a MD scholar student from Rog Nidan department. My guide name is Satyendra Kumar Singh sir. I am from PDA College of Ayurveda and Research Center, Nigri. My topic name is Ayurveda in non-communicable management. Non-communicable disease are a chronic disease generally with slow progression which are leading to cause of morbidity and mortality to worldwide. As per WHO, cardiovascular disease, diabetes, cancer, and chronic respiratory disease mainly included in unhealthy and inappropriate diet. Altered lifestyle, tobacco consumption, and mental stress are a main risk factor on non-communicable disease. Modern lifestyle and dietary habits are trigger the risk of non-communicable disease. These lifestyle disorders, which are preventive through the holistic approach of Ayurveda, by its basic principle and maintaining healthy status of an individual in preventive disease. Balanced diet, proper sleep, and mindful and purposefully useful of energy to collect, known as three Trayopastambha, means three pillars of life, of physically, mental, and social spiritual well-being of an individual. To maintain an equilibrium of body, which is achieve the healthy status, Ayurveda focus on balancing three doshas through ahar, vihar, dinacharya, improving Agni by balanced diet, eliminate toxins, strengthening of immunity, and regenerations through a panchakarma, managing stress, mental, and emotion balance through meditations of yoga. Ayurveda focus on consume treatment plans based on body constitution known as Prakriti. These lifestyle modifications are key factors to prevent the managing of non-communicable disease. Ayurveda emphasizes to swasthasya swasthya rakshanam to maintain a healthy status of an individual. Relevant literatures of text Samhita articles are in life disorder and their preventive measures through Ayurveda are reviewed. Ahar, unhealthy, inappropriate diet is a main cause of lifestyle disorder. Intake of Shadrasatmak Ahar as per our Prakriti Agni Guna Ahar Dravya maintain the balanced state of Agni which leads to normal digestions. Dinacharya Ayurveda advise daily routine as per cardian cycles of body. Improving daily routine builds immunity and prevents disease. Brahma Muhurta rising, personal hygiene, exercise, Abhyanga maintain the equilibrium. Rutucharya seasonal changes hampers to a balance of three dosha and Agni. Ayurveda offers to diet a plan and lifestyle changes as per a season and maintain a balance of three dosha. Panchakarma eliminates the toxins from your body through Panchakarma therapies as per our Prakriti and Rutu prevent the risk balancing dosha, which eliminates prevent the risk factors of non-communicable disease. Meditation and yoga. Stress is a key factor of modern lifestyle which triggers non-communicable disease. Ayurveda believe in balancing a body and mind, improving flexibility, metabolism, and reduce stress. Conclusion: unhealthy diet, sedentary lifestyle, lack of exercise are the effect of modern lifestyle leading to non-communicable disease. Ayurveda offers individualized approach of preventing and imaging non-communicable disease through a lifestyle modifications, dietary corrections, detoxification, and regeneration therapies, stress management. Holistic approach of Dinacharya, Rutucharya help to build an immunity and maintain to equilibrium of body. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation. Next, we go to the another paper and poster presentation. I would like to invite Dr. Ashini Gajanrao for the paper presentation. I'd like to invite Dr. Ashini for the paper presentation.
Hello everyone.
Hello everyone, myself Dr. Ashwini Gajananjitskar from Dr. VJD Kramin Ayurved College, Patur, Akola, Maharashtra. I am the PG scholar in the Department of Kai Chikitsa. My guide is Dr. Ashish Keche, Professor in Kai Chikitsa, and co-guide is Dr. Jayashree Katole, HOD in Kai Chikitsa. Topic for my paper presentation is an Ayurvedic approach to management of Mutrakrutya with special reference to urinary tract infections, a case study. Introduction. Mutrakrutya is a broad term which covers the condition in modern science as urinary tract infection. The Pratyatma Lakshan of Mutrakrutya is Dukkhena Mutra Pravrutti, means discomfort during micturition. In Pittaj Mutrakrutya, the vitiated Pitta dosha along with Vata, mainly Apan Vayu, on reaching Basti affects the Mutravaha Strotas. Mutrakrutya is correlated to urinary tract infection usually caused by E. coli bacteria. Urinary tract infection is the second most common infection after upper respiratory tract infection. Women are more susceptible to UTIs primarily due to their anatomy. The worldwide prevalence of urinary tract infection, according to WHO, is 150 million person per year and still is increasing. Urinary tract infection occur in 1% of boys and 1 to 3% of girls. Method. Case report. A 47-year female patient presented with complaints of increased frequency of urination with scanty flow, painful and burning micturition, persistent urge to urination, and pain in lower abdomen since 15 to 20 days. These symptoms were recurring off and on from last 2 to 3 months. History revealed that she was suffering from chronic cystitis, for which she has taken modern treatment but having only symptomatic relief, but not cured completely. There was no history of diabetes mellitus, hypertension, hypothyroidism, or any other major disorder. The family history was also not significant with the patient disorder. Nidan was Mutravega Dharan and excessive intake of spicy food. General examination. General condition was good. Respiratory system, air entry bilateral equal and clear. CVS, S1, S2 normal, no added sounds. CNS, conscious and oriented. Per abdomen was soft. BP was normal. Pulse was normal. Prakruti was Vat Pittaj. Darshan was normal. Samprapti Ghatak, Dosha, Pitta Pradhan Tridosh, Dushta, Rasa and Rakta, Agni, Tikshna Agni, Strotas, Mutravaha Strotas. Pathophysiology, due to aggravated Tridosh, especially Apana Vata gets locked in the urinary tract, producing obstruction and difficulty in micturition. Lab investigations. HB 12.6 gram %, fasting blood sugar 98 mg per dl, urine was pale yellow and clear, urine protein, glucose, RBCs was absent, urine pus cells was 16 to 18 cells per HPF, urine epithelial cells were 6 to 8 cells per HPF, USG suggestive of cystitis. Treatment. It includes mainly 3 interventions: Gokshuradi Gugul, Chandraprabhavati and Ushiraso. Gokshuradi Gugul was administered at the dose of 250 mg BD with lukewarm water before food for 21 days. Chandraprabhavati 250 mg BD with lukewarm water after food for 21 days. Ushirasa 15 ml BD with lukewarm water after food for 21 days. Result. After 21 days of treatment with Gokshuradi Gugul 250 mg BD, Chandraprabhavati 250 mg BD and Ushiraso 15 ml BD, patient had relieved from symptoms like burning, micturition, lower abdominal pain, frequent urination and discomfort. In urine routine investigation, there was significant decrease in number of pus cells and epithelial cells observed after the treatment. No significant complication is evident during the course of study. Mode of action. Due to its diuretic and anti-inflammatory properties, it helps to alleviate symptoms like painful micturition, frequent urination, and burning sensation associated with UTI. Chandraprabhavati, it is Vyadhi Pratyanics by its Shothahar, Dahagna, Mutral, and Shulahar gunas, reduces symptoms by pacifying Vata and Pitta, and its rejuvenating properties helps in improving Khavaigunya and tackles the disease. Ushiraso, due to its Pitta normalizing property, it alleviates symptoms such as burning sensation during urination. The abundance of antimicrobial and antibacterial properties treats several types of urinary infections. Discussion. Symptoms related to UTI are mainly related with inflammation and infection of the urinary bladder and urethra. Inflammation of urinary tract leads to increase of pus cells and epithelial cells in the urine sample. Ayurvedic perspective of this case presenting with painful and burning urination with increased frequency of urine has been established with Pittaj Mutrakrucha, as pain, frequency and urgency are the features of Vata dominancy. This treatment was planned on the basis of predominance of Dosh, Dushta and Strota involvement. Thus, Chandraprabhavati, Goksurati Kukud and Ushirasa combinedly helps to reduce symptoms of UTI and significant decrease in number of pus cell and epithelial cells in the patient with Pittaj Mutrakrucha. Conclusion. The case study shows that recurrent UTI can be managed successfully with Ayurvedic intervention. The symptoms of UTI were markedly reduced. No adverse effect pertaining to the prescribed drug was reported. No recurrence was noted. The limitation of this study is that it is single case study and need to be studied in more number of cases for its concrete conclusion. Thank you.
Thank you, Dr. Ashini. Thank you for the energetic presentation. One more poster presentation is pending. We go to the poster presentation.
Hello, everyone. Hello everyone, myself Dr. Ashwini Gajanan Jiskar. I am the PG scholar in the Department of Kai Chikitsa from GAM College, Akola. Topic for my poster presentation is an integrated approach to the management of Manyastambha with special reference to cervical spondylosis, a case study. Need for the study. Manyastambha in Ayurveda refers to condition affecting the neck region characterized by stiffness and pain. It is considered as Vata predominant Vata Vyadhi, meaning it involves an imbalance of Vata dosha. Modern lifestyle factors like prolonged sitting, improper posture, and increased screen time contribute to aggravation of Vata, leading to Manyastambha. Keeping all these facts in mind, it is need of an hour to bring out treatment modality of Manyastambha Vyadhi with long-lasting relief and no adverse effect. Methods. Different Ayurveda and modern textbooks, journals, research papers, articles are referred to study concept of Manyastambha and its correlation to cervical spondylosis. Case report. A 40-year female tuition teacher by occupation with complaints of pain and stiffness in the cervical region since 1 year and pain radiating to both upper limb since 7 months. Both before 1 month, she had a painful neck movement and was diagnosed case of cervical spondylosis. Analysis. The resembling clinical features of Manyastambha and cervical spondylosis have correlation. Manyastambha comes under Urdhva Chatrugat Roga and Nanatmaj Vata Vyadhi. In Ayurveda, general line of management of Urdhva Jatrugat Rog and Nanatmaj Vyadhi such as Snehan, Svedan, Nastya, along with oral Ayurvedic medicines were adopted for the case. Manyavasti is a type of Mrudu Snehan and Svedan was adapted for the patient. The interpretation of efficacy and probable mechanism of action of therapy can be explained by combined result of action of drug. Results: Hetu and causes of cervical spondylosis and Manyastambha causing Vata Prakop and Dhatukshay are similar. Manyastambha is classically treated with Snehan, Svedan and Manyapasti. Abhyantar Chikitsa with Yogaraj Gugul 250 mg BD helps in resolving degenerative changes and healing cervical spondylosis. Dashmul Kwat 20 ml PD is Tridoshahar means elevating all deranged doshas. Vedana Sthapan means painkiller and Shotahar means subsides inflammation. Mahavata Vidvansa Ras is a potent analgesic drug. It pacifies vitiated Vata dosha and helps in the management of neuritic pain. Modern treatment initially for first 5 days with muscle relaxant tablet Mayoril Plus helped in relieving severe constant aching pain in cervical region. Discussion: According to Ayurveda, the main etiological factor of Manyastambha is vitiated Vata and Kapha dosha. In the present case study, the treatment has been planned to manage cervical spondylosis with prime focus to elevate Vata and Kapha dosha. Snehan and Svedan lubricates the scrotus and hence corrects stiffness, rigidity and induces elasticity in the body. Nasya with Anutela helps in elimination of Vata, Kapha dosha and clears obstruction in the channels. Manyabasti is very effective because it acts at the site of Samprapti. Thus, combined result of action of oral medicines and Bahya Chikitsa helps in the management of cervical spondylosis. Similarly, control study with comparative drugs can be performed to prove better therapeutic efficacy and management of Manyastambha. References are taken from Charak Samhita, Ayurveda Deepika commentary of Chakrapani, edited by Vaidya Yadavji Trikamji Acharya, Varanasi, reprint 2000, and from Chikitsa Sthan, 20th chapter. WHO gradation of Ayurveda symptoms, developing guidelines for clinical research. Shri Govinda Das Bhaishya Ratnavali, Shri Kaviraj Ambika Datta Shastri, Chaukhamba. Dr. Indradev Tripathi Chakradatta, Chaukhamba Sanskrit Sansthan, Chakra 25/50, 1997. Now, the first picture shows the mechanism of pathophysiology of the cervical spondylosis, that is the degenerative changes and the disc prolapse at the cervical region. Second is the Manyabasti, which is the procedure for the management of cervical spondylosis. It is very effective because it acts directly at the site of the Samprapti. And third is the rehabilitation exercise for the prophylaxis and the management of the cervical spondylosis. Thank you.
Thank you, Dr. Ashini. Thank you for the well explained, energetic presentation. Thank you for the paper and poster presentation, Doctor. Next, we go to the final presentation. I would like to invite Dr. Priyanka Shamrao for the paper presentation. I would like to invite Dr. Priyanka Shamrao for the paper presentation.
Good evening, all respected jury. Myself, Dr. Priyanka Gunge, PG Scholar, Swasthavritta and Yoga Department, Vidarbha Ayurved Mahavidyalaya, Amravati. My guide name is Dr. S.K. Chopkar, HOD and Guide, Swasthavritta and Yoga Department, Vidarbha Ayurved Mahavidyalaya, Amravati. My topic for paper presentation is a review study on the concept of mental health in Ayurveda. Introduction. Ayurveda, the ancient Indian system of medicine, offers a holistic approach to mental health that integrates the mind, body, and soul. Ayurveda is described as mental health in Atharva Veda and the subsequent treatise by Charak, Sushruta, and Bhagavad, containing the details of etiology, symptoms, diagnosis, and therapy for affections in human and animals. The science of mental disorder describes extensively the conditions from mild anger and greed to several psychosis. Simultaneously, the whole world is looking for the solutions of inner conflicts afflicting mental health sector. Ayurvedic theory of mental health is based on combinations of these three gunas, doshas, panchamahabhutas. The combination of these doshas and three gunas inherited at birth indicates an individual's prakriti. The dynamics balance of these above elements create a normal mental health. Daiva Vipashraya, Yukti Vipashraya, Sattvavaja Chikitsa, Achar Rasayan, Dincharya, and Yoga therapy is described in Ayurveda for dissolving these elements. Objectives. The objective of this study is to understand the concept of mental health and to study the importance of mental health in Ayurveda. Material and methods. This study is based on explanatory facts and literature review, and the data is collected totally based on secondary sources like Ayurveda text and research papers. Concept of mind. So in Ayurveda, it is explained that Dhi, Dhruti and Smriti as a basic concept of mind. So Manas and physical mind is directly connected to Dhi, that is intellect, Dhruti, processing information, and Smriti, that is memory. The Dhi is intelligence that depends on learn, focus, and understanding. The Vata dosha should be balanced for optimal functioning of Dhi. Dhruti involves the chemical and electrical processing of information, and therefore it is related to Pitta dosha. Smriti is the ability that remembers. Kapha dosha should be balanced for proper functioning of Smriti. When there is a proper coordination between these three factors, the mental health is perfect. When the coordination between these three factors is not proper, mental health is perfect. When there is lack of coordination between these above factors, this leads to a condition called as mental disease. The process of memory comes under the graduation of physical mind or objective mind. Now the concept of body and mind constitution. So in this, first comes the Tridosha. So according to Ayurveda, Vata, Pitta and Kapha are the three main psychobiological expressions of the nature individually and cosmically. The Vata dosha is dry, despairing, subtle, cold, mobile, minute and changeable, and therefore when Vata is vitiated, then our body is associated with a condition such as attention deficit, bipolar disease, delusions, irrelevant talks, social anxiety, auditory hallucination, fears, and phobia also. Vata governs all the movements of the nervous systems. The Pitta dosha, on other part, is being hot, sharp, penetrating, and spreading, is responsible for comparison, anger, rage, violence, jealousy, frustration, and visual hallucinations. Pitta is more associated with digestive and hormonal changes, and it regulates metabolism and brings about transformation in the body. Kapha dosha is more slow, heavy, inert, smooth gas, soft, immobile, and is therefore associated with sadness, melancholia, stubbornness, dark depression, and it mainly provides stability involved in building up of tissues. Trigunas. The significance of Tridoshas were emphasized by Charak in his renowned commentary. He observed Rajas, Tamas as the possessive individual, and through this general Sattva, Raja and Tamas are concerned with mental faculties, Vata, Pitta and Kapha with the anatomical and physiological entities and later affect the psyche of an individual. Then there is Manovahastrotas. There are no any detailed description found in respect to Manovahastrotas when we go through the systemic literal review of the Srotas by Srotoviman chapter elaborated in the Charak Samhita. In Vimansthan, it is said that Vata, Pitta and Shleshma transverse the entire body through these kinds of Srotas along with the Manasik doshas, which are beyond sense and perception. Hence, the entire senile body is a vehicle and field to operation. Ojas and Manas. The relation between the Manas and Ojas is very relevant in the manner of Rajas Manas Rogas because both Ojas and Manas are seated in the heart. Ojas is depleted by mental emotions such as anger, grief, and person becomes fearful. Asatmendriyartha Sayog. In the classical text of Ayurveda, the Charak Samhita has prime importance because of the highly relevance of mental health and challenge to the other pathy who wrote on the relative manners. Causes of mental illness. Several causes are responsible for mental health. Some are social circumstances, hereditary factors, traumatic incidences, personality of the person, biological reasons, improper diet, physical illness, and overindulgence, severe mental or physical stress. Then there are unfavorable personal, familial, and social environmental factors also. Other psychiatric conditions in Ayurveda. There are also certain terms in Ayurveda which are mentioned below. Unmada, psychosis, apasma, that is convulsive disorder, Brahma, illusion, Atatvanipesh, obsessive disorders, Radnaparat, Tandra, Klama, Mada, Avsada, Chittodveg, and Manas Mandata, that is mental retardation. These are the conditions explained in Ayurveda. Now there is sign of mental health, healthy memory, awareness of responsibilities, following good values, self-awareness and responsibilities of beyond self, staying active, fearless, and doing things enthusiastically. Now remedies for mental health: Daiva Vipashraya, Yukti Vipashraya, Sattva Vajay, Yoga Chikitsa, Achar Rasayan, and Dincharya. These all helps in mental health. Now the conclusion. So examining the literature that Acharya Sushruta the concept of prasanna atma indriya mana equilibrium dosha dhatu mala swastha encompasses the facets of healthy person and empathy demonstrates the significance of mental health. Discussion. Person's mental health is a personal and unique issue. We need to maintain a good health because we are humans, and on the other hand we perform habits and behaviors that contribute to the poor mental health. These behaviors might be anything from minor annoyance to serious anxiety and sadness. And the term mental illness is a broad and encompasses nearly all the mood behavior problems brought by flawed perception, emotion, thought, and attitude. So there are a lot of discussions regarding Achar, Rasaya, Sadvrutam, Pranayam, and Asanas in Ayurveda, and these are all helpful to maintain proper mental health as well as to take care of the mental illness. Thank you.
Thank you, Dr. Priyanka. Thank you for the well explained presentation. Thank you so much, Doctor. Now we are come up to the end of first day of Adveshta National Seminar presentation. I would like to extend my heartfelt appreciation to each and every one of you for making today a remarkable success. This event organized by Ayurveda, has once again proven to be a vibrant platform for the exchange of knowledge, ideas, and inspiration in the field of Ayurveda. My sincere gratitude goes to our panel members and evaluators whose dedication and meticulous attention to detail have ensured that every presentation was reviewed, guided, and assessed with fairness and expertise. Your behind the scenes commitment from preparation to execution has been invaluable in upholding the standards of this seminar. To all the presenters, both in paper and poster categories, I offer my deepest thanks. Your research, insights, and clarity of thoughts have enriched our understanding of diverse subjects, from classical Ayurveda concept to integrate approach combining modern science and tradition. Every topic discussed today reflects a shared passion for advancing this ancient science in contemporary contexts. I also wish to acknowledge the institutions, faculty members, and students who have shown tremendous support by encouraging participation and spreading awareness about this seminar. Your enthusiasm and involvement help keep the spirit of Ayurveda alive across academic and professional communities. A special word of appreciation to the technical and support teams who work tirelessly to ensure seamless live streaming, smooth transition between sessions, and prompt handling of all logistics. Your effort may have been behind the scenes, but the impact has been front and center. To all of our attendees, whether you joined us in person or through the YouTube live stream, thank you for your presence, your attention, and your engagement. Your participation transforms these sessions from simple presentations into meaningful academic dialogue. Today, we have explored an impressive range of themes: clinical studies, literature reviews, modern interpretations of Ayurvedic practice, and case based analysis. Each session has added a unique dimensions to our collective knowledge, and the discussions generated have set the tone for the days ahead. As we conclude, let us carry forward the ideas shared, the collaborations initiated, and the inspiration gained. On behalf of the organization committee, I thank you all for your time, energy, and contributions. We look forward to welcoming you again the next day of insightful learning and meaningful interaction. Until then, have a pleasant evening and a safe journey back. Thank you.